1. Cardiovascular disease encompasses a range of heart and blood vessel disorders, with the most common being coronary artery disease, which can lead to myocardial infarction and is primarily caused by atherosclerosis, a complex pathophysiological process involving lipid deposition, inflammation, and endothelial dysfunction. 2. The heart's electrical system, crucial for maintaining regular cardiac rhythms, can be disrupted in arrhythmias like atrial fibrillation, which increase the risk of thromboembolism, often requiring anticoagulant therapy to prevent stroke and other serious cardiovascular events. 3. Hypertension, often dubbed the silent killer due to its asymptomatic nature, exerts chronic pressure on the cardiovascular system, leading to left ventricular hypertrophy, heart failure, and increased risk for ischemic heart disease if not managed through lifestyle modification and pharmacotherapy. 4. Heart failure is a clinical syndrome characterized by the heart's inability to pump sufficient blood to meet the body's needs, stemming from either systolic or diastolic dysfunction, and is often managed with a combination of ACE inhibitors, beta blockers, and diuretics to alleviate symptoms and improve survival. 5. Lipoprotein A is a genetically determined molecule that plays a significant role as an independent risk factor for cardiovascular diseases due to its pro-atherogenic and prothrombotic properties, necessitating targeted therapeutic approaches like PCSK9 inhibitors in high-risk individuals. 6. Kawasaki disease is an acute, self-limited vasculitis primarily affecting children and poses a considerable risk for coronary artery aneurysms, requiring prompt treatment with high-dose intravenous immunoglobulin and aspirin to reduce cardiovascular complications and ensure long-term heart health. 7. The intricate process of atherosclerosis begins with endothelial injury followed by LDL cholesterol infiltration and oxidation, triggering a cascade of immune responses that culminate in plaque formation and potential rupture, necessitating lifestyle changes and statin therapy for risk reduction. 8. The Ankle Brachial Index (ABI) is a simple, non-invasive diagnostic tool used to assess peripheral artery disease, wherein an ABI of less than 0.90 suggests a high likelihood of significant arterial obstruction and increased cardiovascular risk, guiding further diagnostic and therapeutic interventions. 9. Takotsubo cardiomyopathy, also known as stress-induced cardiomyopathy or broken heart syndrome, mimics acute coronary syndrome but typically resolves with supportive care, highlighting the profound impact of emotional and physical stress on cardiovascular function. 10. Coronary artery bypass grafting, CABG, is a surgical procedure that improves blood flow to the heart in cases of severe coronary artery disease by using grafts from other vessels to bypass blocked arteries, significantly enhancing quality of life and reducing mortality when medical therapy alone is insufficient. 11. In hypertrophic cardiomyopathy, genetic mutations lead to an abnormally thickened heart muscle, particularly the septum, resulting in outflow obstruction, arrhythmias, and sudden cardiac death, often requiring genetic counseling, lifestyle adjustments, and medications such as beta blockers or surgical intervention for management. 12. Angiotensin-converting enzyme inhibitors not only lower blood pressure but also exert protective effects on the cardiovascular system through mechanisms like reducing remodeling, preventing left ventricular hypertrophy, and improving endothelial function, making them a cornerstone in the treatment of heart failure and hypertension. 13. Peripheral artery disease is marked by atherosclerotic blockages in the arteries of the legs, leading to intermittent claudication, rest pain, or critical limb ischemia. Early diagnosis and treatment with exercise therapy, antiplatelet agents, and revascularization are crucial to prevent limb loss and cardiovascular events. 14. Cardiac biomarkers, including high-sensitivity troponins, are pivotal in diagnosing myocardial infarction, as they are sensitive indicators of cardiac myocyte injury, guiding early treatment strategies such as anticoagulation, antiplatelet therapy, and reperfusion to improve patient outcomes. (15) Rheumatic heart disease is a chronic sequela of rheumatic fever caused by group A streptococcal infection, resulting in progressive damage to the heart valves, predominantly the mitral valve, necessitating long-term antibiotics and potentially surgical valve repair or replacement to prevent cardiac failure. (16) The baroreceptor reflex plays a critical role in short-term blood pressure regulation by adjusting heart rate and vascular tone in response to changes in arterial wall stretch, crucial in preventing rapid fluctuations in blood pressure that could lead to syncope or hypertension-related complications. (17) Endothelial cells, lining the interior of blood vessels, are indispensable for maintaining vascular health by secreting substances like nitric oxide, which promote vasodilation, inhibit platelet aggregation, and improve blood flow, and their dysfunction is a pivotal event in the pathogenesis of cardiovascular diseases. (18) One hallmark of chronic heart failure is neurohormonal activation, where systems like the renin-angiotensin-aldosterone system are upregulated, leading to detrimental effects such as vasoconstriction, sodium retention, and cardiac remodeling, which are targeted by life-saving medications like ACE inhibitors and aldosterone antagonists. (19) The QT interval on an electrocardiogram is a critical measure of ventricular repolarization, and its prolongation is associated with an increased risk of life-threatening arrhythmias such as torsades de pointes, necessitating careful monitoring and correction of electrolyte imbalances and medication adjustments as needed. (20) Pulmonary embolism, a potentially fatal cardiovascular emergency, results from a thrombus typically originating in the deep veins of the legs or pelvis, and manifests with acute dyspnea, chest pain, and hypoxemia. Rapid diagnosis via imaging and treatment with anticoagulation is essential for improving survival. (21) The inflammatory biomarker C-reactive protein, CRP, is utilized in cardiovascular risk assessment, as elevated levels correlate with increased risks of atherosclerosis and heart attacks, prompting preventive measures such as lifestyle modifications and pharmacologic interventions aimed at reducing systemic inflammation. (22) Valvular heart diseases, such as aortic stenosis or mitral regurgitation, result from structural abnormalities causing impaired valve function, leading to volume or pressure overload that can progress to heart failure, necessitating regular monitoring and interventions like valve repair or replacement when symptomatic. (23) Essential hypertension is a complex, multifactorial disorder with contributions from genetic, environmental, and lifestyle factors, and it presents a major risk factor for cardiovascular morbidity and mortality, with treatment focused on achieving target blood pressures through lifestyle changes and evidence-based medication regimens. (24) In acute coronary syndromes, prompt recognition and management through the door-to-balloon protocol for angioplasty within 90 minutes in ST elevation myocardial infarction significantly improve outcomes by restoring blood flow and minimizing cardiac muscle damage, emphasizing the importance of time-sensitive intervention. (25) The role of platelets extends beyond hemostasis. In vascular injury, activated platelets contribute to thrombus formation by releasing mediators like thromboxane A2 and inducing coagulation pathways, making antiplatelet therapy a cornerstone in the prevention of recurrent cardiovascular events after an initial infarction. (26) Myocarditis, an inflammation of the heart muscle often due to viral infections, can lead to dilated cardiomyopathy and heart failure, with clinical management ranging from supportive care and anti-inflammatory treatments to advanced therapies like mechanical circulatory support in severe cases. (27) B-type natriuretic peptide, BNP, and its precursor NT-proBNP are crucial diagnostic tools in distinguishing heart failure from other causes of dyspnea, as they are elevated in response to ventricular stretch, guiding the initiation and adjustment of heart failure therapies to optimize patient care. (28) The Framingham Heart Study provided invaluable insights into cardiovascular risk factors, establishing the association between cholesterol levels, hypertension, and smoking with coronary artery disease, thereby shaping modern preventive strategies through risk calculators and lifestyle interventions. (29) Coarctation of the aorta, a congenital narrowing of the aorta typically distal to the left subclavian artery, results in hypertension in the upper extremities and reduced perfusion to the lower body, requiring careful monitoring and surgical repair or balloon angioplasty to prevent long-term complications like heart failure. (30) Sudden cardiac death, often precipitated by ventricular arrhythmias, poses a significant risk in patients with coronary artery disease or cardiomyopathy, with implantable cardioverter defibrillators providing life-saving intervention by restoring normal heart rhythm upon detecting life-threatening disturbances. (31) Triglycerides, though primarily an energy source, are also implicated in atherosclerotic cardiovascular disease risk, with hypertriglyceridemia contributing to small, dense LDL particles and endothelial impairment, necessitating dietary modification and medications like fibrates in conjunction with statins for management. (32) The cardiac stress testing involves assessing the heart's response to exercise or pharmacologic stress, identifying ischemia and functional capacity, with imaging modalities like echocardiography or nuclear scans enhancing diagnostic accuracy for coronary artery disease assessment and guiding treatment strategies. (3) Heart rate variability, HRV, the physiological phenomenon of variation in the time interval between heartbeats, serves as a marker of autonomic nervous system function and cardiovascular health, with reduced HRV associated with increased risk of cardiovascular morbidity and mortality in various populations. (34) The concept of cardiometabolic risk encompasses the clustering of cardiovascular risk factors, including insulin resistance, hypertension, dyslipidemia, and central obesity, necessitating comprehensive management approaches oriented towards lifestyle modification and pharmacotherapy to reduce the risk of cardiovascular events and diabetes. (35) Alcohol consumption has a complex relationship with cardiovascular health, where moderate intake may confer cardioprotective effects through HDL elevation and anti-inflammatory actions, yet excessive use poses risks for hypertension, cardiomyopathy, and atrial fibrillation, informing guidelines for responsible consumption. (36) The intricate process of heart muscle contraction, governed by the sliding filament theory, involves the interaction of actin and myosin filaments within cardiac muscle cells, regulated by calcium ion flux and essential for effective cardiac output, highlighting the significance of calcium channel blockers in treating conditions like hypertension and angina. (37) Patent ductus arteriosus, a common congenital heart defect, results from the failure of the ductus arteriosus to close after birth, causing left-to-right shunting, leading to pulmonary overcirculation and heart failure if untreated, advocating early diagnosis and intervention with either pharmacologic closure or surgical repair. (38) The J-curve phenomenon in hypertension management illustrates the potential for excessively low blood pressure to increase cardiovascular risk, prompting careful titration of antihypertensive therapy to balance optimizing blood pressure control while mitigating the risk of hypotension-related adverse events. 39. The renin-angiotensin-aldosterone system plays a pivotal role in blood pressure regulation and fluid balance, with dysregulation contributing to pathologies like hypertension, heart failure, and chronic kidney disease, where inhibitors of this system, such as ACE inhibitors and ARBs, are the mainstays of treatment. 40. Novel cardiovascular imaging techniques like coronary CTA and cardiac MRI enhance diagnostic precision by non-invasively characterizing coronary artery disease, myocardial function, and structure, guiding personalized management and optimizing therapeutic outcomes in complex cardiovascular cases. 41. Physical inactivity is recognized as a modifiable risk factor for cardiovascular disease, with regular exercise promoting cardiovascular health by improving endothelial function, reducing blood pressure and LDL cholesterol levels, and enhancing insulin sensitivity, underscoring the importance of active lifestyle interventions for disease prevention. 42. The metabolic syndrome, characterized by a constellation of factors including abdominal obesity, dyslipidemia, insulin resistance, and hypertension, increases cardiovascular disease risk exponentially, necessitating multifaceted therapeutic strategies focusing on weight reduction, physical activity, and pharmacotherapy for optimal risk reduction. 43. Mitral valve prolapse, a condition where the valve leaflets bulge into the left atrium during systole, can lead to mitral regurgitation, arrhythmias, and in some cases, significant cardiovascular symptoms requiring surgical intervention, highlighting the importance of regular monitoring and risk stratification. 44. The sodium-potassium pump maintains cellular electrochemical gradients essential for cardiac function, and its impairment can lead to elevated intracellular sodium and calcium levels, affecting myocardial contractility and rhythm, with digoxin influencing this pump to manage heart failure and atrial fibrillation effectively. 45. Homocysteine, an amino acid, is implicated in cardiovascular disease pathogenesis when elevated, promoting endothelial dysfunction, oxidative stress, and thrombotic events, leading to consideration of folic acid supplementation and lifestyle changes as potential therapeutic strategies for reducing associated cardiovascular risks. 46. Cardiovascular risk reduction in diabetes patients extends beyond glucose control, emphasizing management of blood pressure, lipid profiles, and lifestyle factors, with SGLT2 inhibitors and GLP-1 receptor agonists showing promise in reducing cardiovascular events and enhancing overall heart health in this high-risk population. 47. Myocardial perfusion imaging involves the assessment of blood flow to the heart muscle using tracers, providing valuable insight into coronary artery disease severity and therapeutic response, informing decisions on revascularization strategies like PCI or CABG to improve symptom relief and survival outcomes. 48. The progression of left bundle branch block alters ventricular depolarization and is indicative of underlying structural heart disease, often necessitating further evaluation and intervention strategies, such as device implantation in heart failure patients to optimize synchronicity and improve clinical outcomes. 49. Cardiogenic shock, characterized by inadequate tissue perfusion secondary to severe cardiac dysfunction, poses a critical condition with high mortality, demanding prompt intervention with inotropes, mechanical circulatory support, and definitive treatment strategies like PCI or CABG to stabilize hemodynamics and enhance survival prospects. 50. High-density lipoprotein, HDL, cholesterol, often referred to as good cholesterol, plays a vital role in reverse cholesterol transport and endothelial protection, with higher levels traditionally associated with decreased cardiovascular risk, though recent studies suggest functionality may be equally critical, prompting ongoing research into therapeutic HDL targeting approaches. 1. Parkinson's disease is a progressive neurodegenerative disorder characterized by the loss of dopaminergic neurons in the substantia nigra, leading to motor symptoms such as bradykinesia, rigidity, resting tremor, and postural instability, but also encompassing a wide range of non-motor symptoms that can significantly impair quality of life. Two. The hallmark pathological feature of Parkinson's disease is the presence of Lewy bodies, which are abnormal aggregates of the protein alpha-synuclein that accumulate within the remaining dopaminergic neurons, causing cellular dysfunction and death over time. 3. Although the exact etiology of Parkinson's disease is not fully understood, it is believed to result from a combination of genetic and environmental factors, with certain genetic mutations, such as those in the SNCA, LRRK2, and Parkin genes, increasing the risk of developing the disorder. 4. Diagnosing Parkinson's disease primarily involves clinical evaluation, with neurologists relying on a comprehensive assessment of the patient's medical history and a neurological examination, since no definitive laboratory tests or biomarkers currently exist to confirm the diagnosis. 5. The cardinal motor symptoms of Parkinson's disease, such as tremor, occur due to dopamine deficiency in the striatum, which disturbs the balance between direct and indirect pathways in the basal ganglia, thereby impeding the regulation of movement and motor control. 6. Levodopa is considered the gold standard treatment for managing Parkinson's disease symptoms. It effectively replenishes dopamine levels in the brain but may lead to complications such as motor fluctuations and dyskinesias after prolonged use. 7. Dopamine agonists, like pramipexole and ropinirole, are commonly used in the management of Parkinson's disease, particularly in younger patients, as they stimulate dopamine receptors directly and can delay the need for levodopa, albeit with the risk of side effects such as impulsive behaviors. 8. Monoamine oxidase B inhibitors, such as rasagiline and selegiline, are used in Parkinson's disease to extend the action of dopamine by preventing its breakdown, thus providing modest symptomatic relief and potentially exerting neuroprotective effects. 9. Deep brain stimulation is a surgical intervention used in advanced Parkinson's disease where electrodes are implanted in specific brain areas, such as the subthalamic nucleus, to modulate electrical signaling, thereby alleviating motor symptoms and reducing medication requirements. 10. Non-motor symptoms of Parkinson's disease are diverse and can include sleep disturbances, autonomic dysfunction, neuropsychiatric issues like depression and anxiety, and cognitive impairment, all of which require comprehensive management tailored to the individual's needs. The progression rate of Parkinson's disease can vary widely among individuals, influenced by factors such as age at onset, presence of additional comorbidities, and the subtype of Parkinsonism, with some patients experiencing rapid deterioration and others maintaining function over many years. Differential diagnosis is crucial as several conditions might mimic Parkinson's disease, including essential tremor, multiple system atrophy, progressive supranuclear palsy, and drug-induced Parkinsonism, each requiring distinct treatment approaches. 13. Exercise and physical therapy play a vital role in the management of Parkinson's disease, as regular physical activity can improve mobility, flexibility, balance, and overall quality of life while potentially slowing the progression of motor symptoms. 14. Diet and nutrition may impact Parkinson's disease, with recommendations often including a balanced intake of nutrients, adequate hydration, and, sometimes, specific dietary adjustments to optimize medication absorption and alleviate gastrointestinal symptoms. 15. Constipation is a common non-motor symptom in Parkinson's disease due to autonomic nervous system dysfunction, and it can be effectively managed through dietary fiber, hydration, and sometimes the use of laxatives or prokinetic agents. Anosmia, or loss of sense of smell, is frequently one of the earliest signs of Parkinson's disease, often preceding motor symptoms by several years, and may serve as a potential early biomarker for the disorder's prodromal phase. 17. Speech and swallowing problems, such as hypophonia and dysphagia, are common in Parkinson's disease and result from bradykinesia and rigidity affecting the muscles involved in speech production and the coordination of the swallowing reflex, necessitating speech and language therapy interventions. 18. Orthostatic hypotension is a significant autonomic issue in Parkinson's patients, characterized by a drop in blood pressure upon standing that can lead to dizziness or fainting, and may require treatment with mineralocorticoids, vasopressors, or non-pharmacological measures like compression stockings and increased salt intake. 19. Cognitive decline in Parkinson's disease, ranging from mild cognitive impairment to Parkinson's disease dementia, is associated with various factors such as age, disease duration, and the presence of Lewy body pathology, often affecting executive functions and visual spatial abilities. 20. REM sleep behavior disorder, characterized by the loss of normal muscle atonia during REM sleep, is a common premotor symptom of Parkinson's disease, leading to vivid dreams and enactment of behaviors that may be predictive of future neurodegeneration. 21. Fatigue is a prevalent and disabling non-motor symptom in Parkinson's patients, often unrelated to disease severity, requiring a multidisciplinary approach for management, including medication adjustments, sleep optimization, and psychosocial support. 22. Urinary dysfunction, including frequent urination, urgency, and incontinence, occurs due to both central and peripheral nervous system involvement, often requiring urotherapy, medications, or incontinence aids to improve the patient's quality of life. 23. Impulse control disorders, such as compulsive gambling, shopping, or eating, may arise in Parkinson's disease as side effects of dopaminergic treatments, particularly dopamine agonists, necessitating careful monitoring and possible adjustments to therapy. 24. Depression and anxiety are frequently comorbid with Parkinson's disease due to the neurochemical disruptions caused by dopamine deficiency and changes in serotonergic and noradrenergic pathways, often managed with a combination of pharmacotherapy and psychotherapy. 25. The Braak hypothesis suggests Parkinson's disease progression follows a predictable pattern, starting in the lower brainstem and olfactory bulbs before advancing to the substantia nigra and eventually the neocortex, correlating with the emergence and progression of clinical symptoms. 26. Neuroimaging techniques such as MRI and PET scans can aid in differentiating Parkinson's disease from other atypical Parkinsonian disorders, with PET scans particularly useful through visualization of presynaptic dopaminergic neuron function. 27. Apathy, or a lack of motivation, is a common yet often overlooked non-motor symptom of Parkinson's, distinct from depression, which can significantly impair daily functioning and may respond to dopaminergic treatment or psychostimulants. 28. Genetic testing can be informative in familial Parkinson's cases, especially when mutations in genes like LRRK2, PARK7, and PINK1 are suspected, although most cases remain sporadic with multifactorial inheritance patterns. 29. Pain is an underappreciated symptom in Parkinson's disease, with patients experiencing musculoskeletal, dystonic, or central pain syndromes, often requiring a multifaceted approach to management, including optimization of dopaminergic medications and analgesics. Neuroprotective strategies in Parkinson's disease research aim to slow or halt disease progression, with ongoing exploration of agents such as antioxidants, anti-inflammatory drugs, and neurotrophic factors, although no definitive neuroprotective treatment has yet been established. Safety and fall prevention are critical considerations in Parkinson's disease care, given the increased risk of falls due to balance dysfunction and orthostatic hypotension, necessitating regular evaluations and interventions such as home modifications and assistive devices. Parkinson's disease can impact vision, with issues such as blurred vision, difficulty with contrast sensitivity, and abnormal eye movements arising from functional changes in the basal ganglia and dopaminergic pathways involved in ocular motor control. Gait difficulties in Parkinson's, characterized by shuffling steps and stooped posture, are primarily a result of impaired automaticity of movement, often addressed through cueing strategies, physiotherapy, and medication adjustments to improve locomotion. Despite being a movement disorder, Parkinson's disease also disrupts other neurotransmitter systems, including serotonin, norepinephrine, and acetylcholine, contributing to the diverse array of motor and non-motor symptoms experienced by patients. The Unified Parkinson's Disease Rating Scale, UPDRS, is a widely used clinical tool that evaluates motor and non-motor experiences of daily living, as well as medication complications, providing a comprehensive overview of the disease's impact on an individual. Freezing of gait, a sudden, temporary inability to move the feet, is a common and challenging motor symptom in Parkinson's disease, often triggered by environmental factors or stress, and managed through physical therapy techniques and cueing devices. Sensory symptoms in Parkinson's disease, including paresthesia and pain, may result from central and peripheral nervous system changes, necessitating careful differentiation to tailor appropriate treatment strategies, often involving medications and complementary therapies. Swallowing difficulties due to Parkinson's are rooted in impaired coordination and weakening of the oropharyngeal muscles, posing a risk for aspiration and necessitating dietary modifications, swallow therapy, and sometimes medical interventions like feeding tubes. Parkinson's disease is traditionally categorized into different clinical subtypes such as tremor-dominant and akinetic rigid, each associated with distinct progression patterns, response to treatment, and prognosis, emphasizing the need for personalized management approaches. Olfactory testing is sometimes employed in Parkinson's disease assessment, given that olfactory dysfunction often precedes motor symptoms, with tests such as the University of Pennsylvania Smell Identification Test, UPSIT, potentially aiding in early diagnosis. Bradykinesia, or slowness of movement, is a core symptom of Parkinson's disease resulting from dopaminergic depletion in the motor circuit and is typically assessed through observation of tasks such as finger tapping and hand movements during a neurological exam. The role of inflammation in Parkinson's disease pathogenesis is gaining attention, with evidence suggesting neuroinflammatory processes may contribute to neurodegeneration, prompting research into anti-inflammatory treatments as potential therapeutic avenues. 43. The concept of levodopa-sparing strategies involves using non-levodopa treatments such as MAO-B inhibitors or dopamine agonists in the early stages of Parkinson's to potentially delay the onset of levodopa-induced motor complications and maintain therapeutic efficacy. 44. Dopamine transporter imaging, using single-photon emission computed tomography, SPECT, can serve as an adjunct diagnostic tool by providing visual evidence of presynaptic dopaminergic neuron integrity and aiding differentiation among Parkinsonian syndromes. 45. Gastrointestinal motility issues, including delayed gastric emptying, gastroparesis, complicate medication management in Parkinson's, as they can affect the absorption and effectiveness of oral medications like levodopa, necessitating specific dietary and pharmacological strategies. 46. The role of coenzyme Q10 and other dietary supplements as potential disease-modifying therapies in Parkinson's disease remains an area of active investigation, with mixed evidence regarding their efficacy in slowing disease progression or improving symptoms. 47. Advanced Parkinson's disease treatments may involve the use of continuous drug delivery systems, such as levodopa-carbidopa intestinal gel or apomorphine infusion, to provide steady drug levels and reduce motor fluctuation severity in patients with complex disease. 48. Parkinson's disease research is exploring gene therapy approaches, such as the delivery of genes encoding neurotrophic factors or enzymes that synthesize dopamine, with the aim to restore dopaminergic function and provide long-term disease modulation. 49. Impaired facial expression, or hypomimia, in Parkinson's disease results from bradykinesia affecting facial muscles, leading to a reduced ability to convey emotions and impacting social interactions, often ameliorated by ensuring optimized dopaminergic therapy. 50. The psychosocial impact of Parkinson's disease is profound, affecting not only the patients but also their caregivers, with challenges that include coping with loss of autonomy, financial strain, and social isolation, requiring comprehensive support networks and resources. One. Cardiovascular disease encompasses a range of heart and blood vessel disorders, with the most common being coronary artery disease, which can lead to myocardial infarction and is primarily caused by atherosclerosis, a complex pathophysiological process involving lipid deposition, inflammation, and endothelial dysfunction. 2. The heart's electrical system, crucial for maintaining regular cardiac rhythms, can be disrupted in arrhythmias like atrial fibrillation, which increase the risk of thromboembolism, often requiring anticoagulant therapy to prevent stroke and other serious cardiovascular events. 3. Hypertension, often dubbed the silent killer due to its asymptomatic nature, exerts chronic pressure on the cardiovascular system, leading to left ventricular hypertrophy, heart failure, and increased risk for ischemic heart disease if not managed through lifestyle modification and pharmacotherapy. 4. Heart failure is a clinical syndrome characterized by the heart's inability to pump sufficient blood to meet the body's needs, stemming from either systolic or diastolic dysfunction, and is often managed with a combination of ACE inhibitors, beta blockers, and diuretics to alleviate symptoms and improve survival. 5. Lipoprotein A is a genetically determined molecule that plays a significant role as an independent risk factor for cardiovascular diseases due to its pro-atherogenic and prothrombotic properties, necessitating targeted therapeutic approaches like PCSK9 inhibitors in high-risk individuals. 6. Kawasaki disease is an acute, self-limited vasculitis primarily affecting children and poses a considerable risk for coronary artery aneurysms, requiring prompt treatment with high-dose intravenous immunoglobulin and aspirin to reduce cardiovascular complications and ensure long-term heart health. 7. The intricate process of atherosclerosis begins with endothelial injury followed by LDL cholesterol infiltration and oxidation, triggering a cascade of immune responses that culminate in plaque formation and potential rupture, necessitating lifestyle changes and statin therapy for risk reduction. 8. The Ankle Brachial Index, ABI, is a simple, non-invasive diagnostic tool used to assess peripheral artery disease, wherein an ABI of less than 0.90 suggests a high likelihood of significant arterial obstruction and increased cardiovascular risk, guiding further diagnostic and therapeutic interventions. 9. Takotsubo cardiomyopathy, also known as stress-induced cardiomyopathy or broken heart syndrome, mimics acute coronary syndrome but typically resolves with supportive care, highlighting the profound impact of emotional and physical stress on cardiovascular function. 10. Coronary artery bypass grafting, CABG, is a surgical procedure that improves blood flow to the heart in cases of severe coronary artery disease by using grafts from other vessels to bypass blocked arteries, significantly enhancing quality of life and reducing mortality when medical therapy alone is insufficient. 11. In hypertrophic cardiomyopathy, genetic mutations lead to an abnormally thickened heart muscle, particularly the septum, resulting in outflow obstruction, arrhythmias, and sudden cardiac death, often requiring genetic counseling, lifestyle adjustments, and medications such as beta blockers or surgical intervention for management. 12. Angiotensin-converting enzyme inhibitors not only lower blood pressure but also exert protective effects on the cardiovascular system through mechanisms like reducing remodeling, preventing left ventricular hypertrophy, and improving endothelial function, making them a cornerstone in the treatment of heart failure and hypertension. 13. Peripheral artery disease is marked by atherosclerotic blockages in the arteries of the legs, leading to intermittent claudication, rest pain, or critical limb ischemia. Early diagnosis and treatment with exercise therapy, antiplatelet agents, and revascularization are crucial to prevent limb loss and cardiovascular events. 14. Cardiac biomarkers, including high-sensitivity troponins, are pivotal in diagnosing myocardial infarction, as they are sensitive indicators of cardiac myocyte injury, guiding early treatment strategies such as anticoagulation, antiplatelet therapy, and reperfusion to improve patient outcomes. 15. Rheumatic heart disease is a chronic sequela of rheumatic fever caused by group A streptococcal infection, resulting in progressive damage to the heart valves, predominantly the mitral valve, necessitating long-term antibiotics and potentially surgical valve repair or replacement to prevent cardiac failure. 16. The baroreceptor reflex plays a critical role in short-term blood pressure regulation by adjusting heart rate and vascular tone in response to changes in arterial wall stretch, crucial in preventing rapid fluctuations in blood pressure that could lead to syncope or hypertension-related complications. 17. Endothelial cells, lining the interior of blood vessels, are indispensable for maintaining vascular health by secreting substances like nitric oxide, which promote vasodilation, inhibit platelet aggregation, and improve blood flow, and their dysfunction is a pivotal event in the pathogenesis of cardiovascular diseases. 18. One hallmark of chronic heart failure is neurohormonal activation, where systems like the renin-angiotensin-aldosterone system are upregulated, leading to detrimental effects such as vasoconstriction, sodium retention, and cardiac remodeling, which are targeted by life-saving medications like ACE inhibitors and aldosterone antagonists. 19. The QT interval on an electrocardiogram is a critical measure of ventricular repolarization, and its prolongation is associated with an increased risk of life-threatening arrhythmias such as torsades de pointes, necessitating careful monitoring and correction of electrolyte imbalances and medication adjustments as needed. 20. Pulmonary embolism, a potentially fatal cardiovascular emergency, results from a thrombus typically originating in the deep veins of the legs or pelvis, and manifests with acute dyspnea, chest pain, and hypoxemia. Rapid diagnosis via imaging and treatment with anticoagulation is essential for improving survival. 21. The inflammatory biomarker C-reactive protein, CRP, is utilized in cardiovascular risk assessment, as elevated levels correlate with increased risks of atherosclerosis and heart attacks, prompting preventive measures such as lifestyle modifications and pharmacologic interventions aimed at reducing systemic inflammation. 22. Valvular heart diseases, such as aortic stenosis or mitral regurgitation, result from structural abnormalities causing impaired valve function, leading to volume or pressure overload that can progress to heart failure, necessitating regular monitoring and interventions like valve repair or replacement when symptomatic. 23. Essential hypertension is a complex, multifactorial disorder with contributions from genetic, environmental, and lifestyle factors, and it presents a major risk factor for cardiovascular morbidity and mortality, with treatment focused on achieving target blood pressures through lifestyle changes and evidence-based medication regimens. 24. In acute coronary syndromes, prompt recognition and management through the door-to-balloon protocol for angioplasty within 90 minutes in ST elevation myocardial infarction significantly improve outcomes by restoring blood flow and minimizing cardiac muscle damage, emphasizing the importance of time-sensitive intervention. 25. The role of platelets extends beyond hemostasis. In vascular injury, activated platelets contribute to thrombus formation by releasing mediators like thromboxane A2 and inducing coagulation pathways, making antiplatelet therapy a cornerstone in the prevention of recurrent cardiovascular events after an initial infarction. 26. Myocarditis, an inflammation of the heart muscle often due to viral infections, can lead to dilated cardiomyopathy and heart failure, with clinical management ranging from supportive care and anti-inflammatory treatments to advanced therapies like mechanical circulatory support in severe cases. 27. B-type natriuretic peptide, BNP, and its precursor NT-proBNP are crucial diagnostic tools in distinguishing heart failure from other causes of dyspnea, as they are elevated in response to ventricular stretch, guiding the initiation and adjustment of heart failure therapies to optimize patient care. 28. The Framingham Heart Study provided invaluable insights into cardiovascular risk factors, establishing the association between cholesterol levels, hypertension, and smoking with coronary artery disease, thereby shaping modern preventive strategies through risk calculators and lifestyle interventions. 29. Coarctation of the aorta, a congenital narrowing of the aorta typically distal to the left subclavian artery, results in hypertension in the upper extremities and reduced perfusion to the lower body, requiring careful monitoring and surgical repair or balloon angioplasty to prevent long-term complications like heart failure. 30. Sudden cardiac death, often precipitated by ventricular arrhythmias, poses a significant risk in patients with coronary artery disease or cardiomyopathy, with implantable cardioverter defibrillators providing life-saving intervention by restoring normal heart rhythm upon detecting life-threatening disturbances. 31. Triglycerides, though primarily an energy source, are also implicated in atherosclerotic cardiovascular disease risk, with hypertriglyceridemia contributing to small, dense LDL particles and endothelial impairment, necessitating dietary modification and medications like fibrates in conjunction with statins for management. 32. The cardiac stress testing involves assessing the heart's response to exercise or pharmacologic stress, identifying ischemia and functional capacity, with imaging modalities like echocardiography or nuclear scans enhancing diagnostic accuracy for coronary artery disease assessment and guiding treatment strategies. 3.3. Heart rate variability, HRV, the physiological phenomenon of variation in the time interval between heartbeats, serves as a marker of autonomic nervous system function and cardiovascular health, with reduced HRV associated with increased risk of cardiovascular morbidity and mortality in various populations. The concept of cardiometabolic risk encompasses the clustering of cardiovascular risk factors, including insulin resistance, hypertension, dyslipidemia, and central obesity, necessitating comprehensive management approaches oriented towards lifestyle modification and pharmacotherapy to reduce the risk of cardiovascular events and diabetes. Alcohol consumption has a complex relationship with cardiovascular health, where moderate intake may confer cardioprotective effects through HDL elevation and anti-inflammatory actions, yet excessive use poses risks for hypertension, cardiomyopathy, and atrial fibrillation, informing guidelines for responsible consumption. The intricate process of heart muscle contraction, governed by the sliding filament theory, involves the interaction of actin and myosin filaments within cardiac muscle cells, regulated by calcium ion flux and essential for effective cardiac output, highlighting the significance of calcium channel blockers in treating conditions like hypertension and angina. Patent ductus arteriosus, a common congenital heart defect, results from the failure of the ductus arteriosus to close after birth, causing left-to-right shunting, leading to pulmonary overcirculation and heart failure if untreated, advocating early diagnosis and intervention with either pharmacologic closure or surgical repair. The J-curve phenomenon in hypertension management illustrates the potential for excessively low blood pressure to increase cardiovascular risk, prompting careful titration of antihypertensive therapy to balance optimizing blood pressure control while mitigating the risk of hypotension-related adverse events. The renin-angiotensin-aldosterone system plays a pivotal role in blood pressure regulation and fluid balance, with dysregulation contributing to pathologies like hypertension, heart failure, and chronic kidney disease, where inhibitors of this system, such as ACE inhibitors and ARBs, are the mainstays of treatment. Novel cardiovascular imaging techniques like coronary CTA and cardiac MRI enhance diagnostic precision by non-invasively characterizing coronary artery disease, myocardial function, and structure, guiding personalized management and optimizing therapeutic outcomes in complex cardiovascular cases. Physical inactivity is recognized as a modifiable risk factor for cardiovascular disease, with regular exercise promoting cardiovascular health by improving endothelial function, reducing blood pressure and LDL cholesterol levels, and enhancing insulin sensitivity, underscoring the importance of active lifestyle interventions for disease prevention. The metabolic syndrome, characterized by a constellation of factors including abdominal obesity, dyslipidemia, insulin resistance, and hypertension, increases cardiovascular disease risk exponentially, necessitating multifaceted therapeutic strategies focusing on weight reduction, physical activity, and pharmacotherapy for optimal risk reduction. Mitral valve prolapse, a condition where the valve leaflets bulge into the left atrium during systole, can lead to mitral regurgitation, arrhythmias, and in some cases, significant cardiovascular symptoms requiring surgical intervention, highlighting the importance of regular monitoring and risk stratification. The sodium-potassium pump maintains cellular electrochemical gradients essential for cardiac function, and its impairment can lead to elevated intracellular sodium and calcium levels, affecting myocardial contractility and rhythm, with digoxin influencing this pump to manage heart failure and atrial fibrillation effectively. (45) Homocysteine, an amino acid, is implicated in cardiovascular disease pathogenesis when elevated, promoting endothelial dysfunction, oxidative stress, and thrombotic events, leading to consideration of folic acid supplementation and lifestyle changes as potential therapeutic strategies for reducing associated cardiovascular risks. (46) Cardiovascular risk reduction in diabetes patients extends beyond glucose control, emphasizing management of blood pressure, lipid profiles, and lifestyle factors, with SGLT2 inhibitors and GLP-1 receptor agonists showing promise in reducing cardiovascular events and enhancing overall heart health in this high-risk population. (47) Myocardial perfusion imaging involves the assessment of blood flow to the heart muscle using tracers, providing valuable insight into coronary artery disease severity and therapeutic response, informing decisions on revascularization strategies like PCI or CABG to improve symptom relief and survival outcomes. (48) The progression of left bundle branch block alters ventricular depolarization and is indicative of underlying structural heart disease, often necessitating further evaluation and intervention strategies, such as device implantation in heart failure patients to optimize synchronicity and improve clinical outcomes. (49) Cardiogenic shock, characterized by inadequate tissue perfusion secondary to severe cardiac dysfunction, poses a critical condition with high mortality, demanding prompt intervention with inotropes, mechanical circulatory support, and definitive treatment strategies like PCI or CABG to stabilize hemodynamics and enhance survival prospects. (50) High-density lipoprotein, HDL, cholesterol, often referred to as good cholesterol, plays a vital role in reverse cholesterol transport and endothelial protection, with higher levels traditionally associated with decreased cardiovascular risk, though recent studies suggest functionality may be equally critical, prompting ongoing research into therapeutic HDL targeting approaches. (1) Understanding leukemia begins with recognizing its pathophysiology, where unchecked proliferation of abnormal white blood cells in the bone marrow disrupts normal hematopoiesis, leading to overproduction of dysfunctional leukocytes that can infiltrate vital organs and severely compromise immune system functioning. (2) A groundbreaking aspect of leukemia diagnosis involves flow cytometry, a sophisticated technique that enables clinicians to identify and quantify various cell populations in a blood sample, thus differentiating between subtypes of leukemia with unparalleled precision and informing subsequent treatment decisions. (3) The evolution of targeted therapy in leukemia is exemplified by tyrosine kinase inhibitors, such as imatinib, which specifically antagonize the BCR-ABL fusion protein in chronic myeloid leukemia, CML, thereby halting cancer cells' proliferation without substantially impacting normal cellular processes. (4) In acute lymphoblastic leukemia, all cytogenetics plays a pivotal role, as identifying chromosomal abnormalities such as the Philadelphia chromosome or translocations involving chromosome 12 and 21 informs prognosis and the selection of precise therapeutic protocols that are tailored to individual genetic profiles. (5) Leukapheresis is an innovative therapeutic intervention for acute leukemic presentations, where the removal of excess leukocytes from the bloodstream through apheresis rapidly diminishes hyperviscosity syndromes, thereby preventing cerebrovascular accidents and relieving symptomatic leukostasis. (6) Acute myeloid leukemia, AML, pathophysiology hinges on mutations in hematopoietic progenitor cells leading to clonal expansion of immature myeloid blasts, which not only crowd out normal precursors but also manifest in varied clinical presentations such as anemia, infection, and thrombocytopenia. 7. The notion of minimal residual disease, MRD, detection in leukemia has transformed remission monitoring, with sensitive techniques such as next-generation sequencing allowing for the detection of residual leukemic cells at a molecular level, thereby preempting relapse and refining therapeutic regimens. 8. Educational outreach in leukemia highlights the risk factors, including previous chemotherapy, radiation exposure, and genetic predisposition, emphasizing preventive strategies and early intervention to potentially mitigate the disease burden and improve demographic-specific outcomes. 9. Leukemia stem cells represent a paramount challenge due to their self-renewing capacity and resistance to conventional therapies. Targeting these cells with inhibitors of specific signaling pathways could potentially eradicate the root of the disease and prevent relapse. 10. The discovery and differentiation of T-cell and B-cell leukemias have provided a greater understanding of leukemogenesis, enabling specialized treatment plans that target distinct immunophenotypes, thereby improving therapeutic efficacy by directly engaging the malignancy's cellular origin. 11. Bone marrow aspiration and biopsy remain gold standard procedures for leukemia diagnosis, providing vital morphological and cytogenetic information necessary for classifying leukemia type, assessing marrow cellularity, and pinpointing specific chromosomal or molecular aberrations. 12. The role of the tumor microenvironment in leukemia progression is gaining attention, with stromal cell signals and cytokine networks being investigated for their contributions to drug resistance and establishing niches that protect leukemic cells from therapeutic elimination. 13. Personalized medicine in the management of leukemia now capitalizes on genetic and molecular data to customize treatment regimens, using pharmacogenomics to predict drug response and toxicity, thereby optimizing therapeutic outcomes while minimizing adverse effects. 14. Advances in leukemia research emphasize the potential of CAR T-cell therapy, wherein genetically modified autologous T-cells are engineered to express chimeric antigen receptors that target specific leukemia-associated antigens, achieving unprecedented remission rates in refractory cases. 15. Pediatric leukemia research underscores that children with Down syndrome have an elevated risk of developing acute leukemia, necessitating vigilant clinical surveillance and tailored therapeutic approaches to maximize outcomes while minimizing treatment-related morbidity. 16. High-dose chemotherapy followed by hematopoietic stem cell transplantation remains a cornerstone in treating certain high-risk leukemias, wherein autologous or allogeneic stem cells are infused to replace the eradicated leukemic marrow and restore hematopoietic functions. 17. Understanding the role of epigenetic modifications in leukemia, such as DNA methylation and histone acetylation, has opened new avenues for therapies like hypomethylating agents, which seek to reverse aberrant epigenetic states and reactivate tumor suppressor genes. 18. The application of machine learning in leukemia is revolutionizing diagnostics by analyzing vast datasets to identify patterns and anomalies, offering the potential for early detection and personalized prognosis while continuously refining therapeutic approaches through adaptive algorithms. 19. Leukemia-related fatigue, a pervasive symptom that significantly impacts quality of life, is being re-evaluated through comprehensive patient-centered studies aiming at integrative management approaches that encompass physical, psychological, and pharmacologic strategies. 20. Chronic lymphocytic leukemia. Kia pathogenesis is heavily influenced by the accumulation of functionally inert yet non-apoptotic B lymphocytes, with research targeting the B cell receptor signaling pathway to inhibit downstream survival signals and induce cancer cell apoptosis. Translational research in leukemia has spotlighted the significance of microRNAs in post-transcriptional regulation, with select mRNAs serving as potential biomarkers for early diagnosis, therapeutic targets, or as modulators of drug sensitivity and resistance mechanisms. 22. In pediatric leukemia, supportive care has gained prominence, encompassing measures to address treatment-related toxicities such as infections, organ dysfunction, and growth impairment, thus elevating survivors' quality of life and fostering holistic recovery journeys. 23. The discovery of oncogenes such as TET2 and FLT3 in leukemia has catalyzed research into their role in leukemic transformation, with ongoing trials testing inhibitors and prototypic compounds aimed at these genes to arrest disease progression at a molecular level. 24. Recognition of therapy-related acute leukemia, resulting from previous treatment for other malignancies, highlights the need for judicious therapeutic planning, grasping personalized risk assessments and monitoring to prevent secondary leukemogenesis. 25. Cutting-edge metabolomics research is revealing leukemia's distinct metabolic profiles, where aberrant metabolic pathways not only drive leukemic cell survival but also present opportunities for therapeutic interventions targeting critical metabolic vulnerabilities. 26. Investigative efforts are unraveling how the immune system's evasion by leukemic cells relies on down-regulating checkpoint molecules. Thus, therapeutic strategies rekindling anti-leukemic immune responses are being refined to overcome immune escape mechanisms. 27. For adolescent leukemia survivors, long-term follow-up care is critical, given the potential for late effects such as secondary cancers, cardiac dysfunction, or cognitive impairment, necessitating comprehensive survivorship programs that address these diverse health challenges. 28. Exploring the interplay between leukemia and the central nervous system is crucial, as certain leukemias demonstrate proclivity for CNS invasion. Lumbar puncture and prophylactic CNS-directed therapies are integral to preventing neurological manifestations and relapses. 29. Investigating the therapeutic potential of bispecific antibodies in leukemia involves engineering molecules that simultaneously bind to leukemic cells and T cells, harnessing the immune system for precise targeting and elimination of malignant hematopoietic cells. 30. Advances in leukemia diagnostics incorporate liquid biopsy technology, allowing non-invasive detection of circulating tumor DNA and clonal evolution monitoring in plasma, providing real-time data for early relapse identification and therapeutic decision-making. 31. Leukemia pathophysiology often involves recurrent cytogenetic abnormalities, such as translocations or inversions, which lead to the creation of fusion genes. These genetic markers are pivotal in subclassifying leukemias and tailoring targeted treatments. 32. Research in leukemia explores the implications of clonal hematopoiesis of indeterminate potential, where certain mutations might predispose individuals to malignant transformation, spotlighting the need for heightened surveillance and preemptive therapeutic considerations. 3.3. In the context of leukemia, investigating the efficacy of kinase inhibitors inhibiting dysregulated signal transduction pathways holds promise, as exemplified by drugs targeting the JAK-STAT and PI3K, AKT pathways present in multiple leukemias. 34. The microbiome's influence on leukemia progression and treatment response is an emerging front in oncological research, with symbiotic bacterial communities impacting drug metabolism and immune modulation, necessitating further exploration to enhance therapeutic regimens. Incorporating patient-reported outcomes into leukemia clinical trials provides rich insights into the impact of therapies on symptom burden and quality of life, fostering a more holistic understanding of patient-centered care and informed decision-making. The role of the bone marrow niche microenvironment in leukemia has prompted research into therapies disrupting interactions between leukemic cells and supportive stromal components, aiming to increase the efficacy of conventional chemotherapeutic regimens. Understanding pharmacokinetics and pharmacodynamics in leukemia therapy guides dosing regimens and toxicity management, ensuring that therapeutic concentrations are achieved without incurring unacceptable side effects, hence enhancing treatment outcomes. Recent strides in immunophenotyping have advanced the identification of leukemia subtypes, with specific antigen expression profiles guiding targeted treatment options such as monoclonal antibody therapies, elevating precision medicine in hematology. Hematologic support in leukemia consists of transfusion strategies for managing cytopenias, wherein red blood cells and platelets are administered to prevent bleeding complications and alleviate anemia-related symptoms, contributing significantly to patient management. Exploring the genetic landscape of leukemia uncovers actionable mutations, with collaborative databases pooling genomic information to identify mutation-driven treatment options, thereby advancing the goal of precision oncology for leukemic patients. The paradigm shift in understanding leukemia has brought focus to the relevance of patient psychosocial dynamics, with psychological support interventions playing a vital role in mitigating the emotional impact of diagnosis and treatment, aiding overall healing. Investigations into lifestyle modifications as adjunctive measures in leukemia management propose strategies to bolster general health, mitigate comorbid conditions, and possibly modulate cancer progression through diet, exercise, and stress management routines. Molecular-targeted radiotherapy in leukemia utilizes radio-labeled molecules binding selectively to leukemic antigens, enabling precise delivery of radiation to cancerous cells while minimizing damage to healthy tissue, heralding a new era of radiotherapy precision. Understanding cytokine release syndrome, a notable adverse effect associated with leukemia immunotherapies like CAR T-cells, is crucial. Careful monitoring and management, often with corticosteroids or cytokine inhibitors, ensure this potent treatment remains viable. Leukemia treatment resistance is an ongoing challenge, with research into mechanisms such as efflux pump overexpression and altered drug metabolism informing development of novel agents capable of overcoming these defenses to enhance patient responses. The advent of transcriptomics in leukemia research reveals the comprehensive gene expression profiles characteristic of each leukemia subtype, offering insights into disease biology and opportunities for discovering new molecular targets for therapeutic exploitation. The identification of leukemia stem cell markers such as CD123 has prompted a wave of immunotherapeutic strategies, with agents aimed at these markers showing promise in eradicating the putative roots of leukemia, thereby reducing recurrence rates. 48. Understanding the prevalence and impact of acute leukemia in aging populations has underscored the need for geriatric-focused treatment protocols that maximize therapeutic benefit while accommodating the physiological vulnerabilities inherent in older adults. '49. Advancements in cryopreservation and expansion of hematopoietic stem cells offer new possibilities for leukemic patients lacking suitable donors, enhancing the accessibility and success rates of stem cell transplants, particularly for minority populations. 50. The exploration of leukemia in rare genetic disorders like Fanconi anemia emphasizes the complexity of carcinogenesis within a context of genetic instability, guiding innovation in genetic therapies and personalized treatment strategies that address the multifaceted nature of these cases. One. Pancreatic cancer often exhibits late-stage symptoms due to its retroperitoneal location, which allows tumors to grow significantly before inducing noticeable symptoms such as jaundice, weight loss, or back pain, making early detection challenging and stressing the importance of vigilant monitoring of individuals with high risk factors like chronic pancreatitis or family history of pancreatic diseases. Two. The survival rate for pancreatic cancer remains dismally low, with a 5-year survival rate of around 10%, a stark reflection of the aggressive nature of its pathophysiology, as ductal adenocarcinoma commonly exhibits rapid progression and metastasis, often involving the liver and lungs at the time of diagnosis. 3. Diagnosis of pancreatic cancer commonly involves cross-sectional imaging techniques such as a contrast-enhanced CT or MRI scans, which help identify the extent of the tumor and any metastasis, in conjunction with endoscopic ultrasound (EUS), that provides detailed imaging and allows for fine needle aspiration biopsies to obtain tissue samples. Four. The etiology of pancreatic cancer is multifactorial, with known risk factors including age, smoking, obesity, hereditary syndromes like BRCA1 and BRCA2 gene mutations, diabetes, and dietary factors, while chronic inflammation of the pancreas is also implicated in the development and progression of neoplastic changes in pancreatic tissue. 5. Surgical resection remains the cornerstone of curative therapy for pancreatic cancer, but it is only feasible in approximately 20% of patients due to late-stage presentation, and it usually involves a Whipple procedure, distal pancreatectomy, or total pancreatectomy, depending on the tumor's location and involvement of surrounding structures. Six. The pathophysiology of pancreatic cancer at the molecular level often involves alterations in oncogenes like KRAS and tumor suppressor genes such as p53 and SMAD4, which contribute to deregulated cell growth, resistance to apoptosis, angiogenesis, and metastatic dissemination of cancer cells. Seven. Clinical staging of pancreatic cancer, crucial in determining treatment options and prognosis, relies on the TNM system where T describes the size and local extent of the tumor, N for regional lymph node involvement, and M indicates the presence or absence of distant metastasis. 8. Chemotherapy regimens in pancreatic cancer, such as the combination of FOLFIRINOX or gemcitabine with nab-paclitaxel, are employed in cases where surgical options are not viable or as neoadjuvant or adjuvant treatment, with ongoing investigations into targeted therapies and immunotherapies aiming to improve efficacy and survival outcomes. 9. Palliative care plays a significant role in managing pancreatic cancer due to the high rate of incurable disease, focusing on alleviating symptoms such as pain and jaundice, typically employing interventions like nerve blocks, biliary stenting, or radiation therapy to improve quality of life. 10. The role of biomarkers in pancreatic cancer is evolving, with CA19-9 being the most widely used serum marker for monitoring disease progression in response to therapy, although it has limitations in sensitivity and specificity, leading to continued research into identifying more reliable molecular markers for early detection and personalized treatment strategies. 11. Pancreatic cancer metastasis frequently involves the liver and peritoneum due to hematogenous spread and direct invasion, severely impacting prognosis and treatment options, highlighting the importance of comprehensive staging investigations at diagnosis to guide therapeutic decisions and manage possible complications. The role of genetic counseling is increasingly significant in pancreatic cancer, especially for individuals with a family history suggestive of hereditary cancer syndromes, as mutations like BRCA1/2 and Lynch syndrome can dictate screening strategies, inform treatment plans, and prompt at-risk family members to undergo appropriate surveillance. Recent advancements in immunotherapy for pancreatic cancer focus on overcoming the tumor's immunosuppressive microenvironment, with clinical trials evaluating checkpoint inhibitors, cancer vaccines, and adoptive cell therapies, although the unique biology of pancreatic tumors presents ongoing challenges in achieving significant therapeutic breakthroughs. The onset of new-onset diabetes, particularly in older adults without obesity, has been associated with the early stages of pancreatic cancer, serving as a potential clue for early detection, given that up to 85% of patients exhibit glucose metabolism disorders correlating with tumor-induced insulin resistance or direct islet cell damage. Although smoking is a modifiable risk factor for pancreatic cancer, cessation remains crucial as tobacco use nearly doubles the risk of developing the disease, potentially due to carcinogenic compounds inducing chronic pancreatic inflammation leading to genetic alterations implicated in carcinogenesis. Cachexia is a common complication of pancreatic cancer, characterized by severe weight loss and muscle wasting, impacting patients' overall health status and response to treatment, often necessitating nutritional interventions and metabolic support to manage the multifaceted syndrome caused by tumor and host-derived factors. In the context of pancreatic cancer, endoscopic retrograde cholangiopancreatography (ERCP) serves a dual role in both diagnostic evaluation and therapeutic intervention, particularly in cases of obstructive jaundice, where it can facilitate stent placement to relieve biliary obstruction and collect cytological samples through brushings or duct biopsies. The role of physical activity in pancreatic cancer prevention is an area of active research, with evidence suggesting that regular exercise may reduce risk through mechanisms involving maintenance of healthy body weight, reduction of systemic inflammation, and improvement of insulin sensitivity, underscoring lifestyle modifications as a potential preventive strategy. Neuropathic pain associated with pancreatic cancer is often due to the tumor's infiltration into celiac plexus or other nerve structures, necessitating a multidisciplinary approach including pharmacologic analgesics, nerve blocks, and psychosocial support to effectively manage the complexity of pain profiles seen in affected patients. The interplay between chronic pancreatitis and pancreatic cancer has been a focus of study, as long-standing inflammation results in fibrotic changes and dysplasia, potentially culminating in neoplastic transformation, emphasizing the need for vigilant monitoring and appropriate management strategies in patients with recurrent inflammatory episodes. 21. Recent studies emphasize the importance of identifying precursor lesions such as intraductal papillary mucinous neoplasms, IPMNs, and mucinous cystic neoplasms, MCNs, in the context of pancreatic cancer risk assessment, as these lesions carry a variable risk of malignant transformation and may warrant surgical intervention based on size, presence of solid components, or ductal dilation. 22. Magnetic resonance cholangiopancreatography, MRCP, is a non-invasive imaging modality particularly useful in delineating pancreatic ductal anatomy and identifying lesions or obstructions, and in certain scenarios, it offers superior soft tissue contrast compared to CT, aiding in the diagnosis and staging of pancreatic cancer. 23. The concept of tumor microenvironment is crucial in understanding pancreatic cancer biology, as stromal components like cancer-associated fibroblasts and immune cells contribute to desmoplastic reaction, chemoresistance, and immunosuppression, highlighting potential therapeutic targets aimed at disrupting these supportive networks to inhibit tumor progression. 24. Prognostication in pancreatic cancer relies not only on traditional staging but also on factors such as tumor grade, presence of comorbidities, and molecular profiling, with advances in genomics offering potential insights into individualized risk assessment and tailored therapeutic strategies to improve outcomes. 25. The impact of gallstone disease on pancreatic cancer risk has been observed, wherein long-standing obstruction or inflammation may serve as a promotional factor in the carcinogenic pathway, necessitating prompt management of biliary pathology to potentially mitigate associated risks. 26. Perineural invasion, commonly observed in pancreatic cancer, refers to the propensity of tumor cells to invade surrounding nerve tissues, contributing to pain and disease progression, and represents both a pathologic hallmark of aggressiveness and a challenge in achieving complete surgical resection due to its pervasive nature. 27. In assessing resectability of pancreatic tumors, the involvement of critical vascular structures such as the superior mesenteric artery, celiac axis, or portal vein plays a determinant role, with locally advanced tumors often deemed unresectable unless preoperative therapies can achieve sufficient downstaging to enable surgical intervention. 28. Diabetes mediation and pancreatic cancer share a complicated relationship where some anti-diabetic drugs, particularly metformin, have been investigated for potential protective effects against cancer incidence and progression, while the exact pathways and clinical implications continue to undergo research. 29. The presence of depressed mood and early mental health disturbances have been noted in individuals later diagnosed with pancreatic cancer, which may be attributed to perineoplastic phenomena or tumor-related cytokine release, warranting further exploration into the psychoneuroimmunological aspects of cancer diagnosis. 30. While enteral nutrition is preferred in maintaining nutritional status in pancreatic cancer patients due to its preservation of gut mucosal integrity and function, parenteral nutrition may be necessitated in cases of severe malnutrition or when gastrointestinal function is compromised, highlighting the importance of a tailored approach to nutritional support. 31. A considerable amount of research continues to focus on the role of vitamin D and its receptor pathways in pancreatic cancer, as epidemiological studies suggest an inverse relationship between adequate vitamin D levels and cancer risk, although clinical trials are needed to elucidate therapeutic efficacy in cancer prevention or treatment. 32. The phenomenon of oncogenic KRAS mutations being present in over 90% of pancreatic ductal adenocarcinomas underscores the challenge and urgency in developing targeted therapies against this mutation, as current strategies aim to interfere with downstream signaling pathways or the tumor's metabolic reprogramming influenced by KRAS activity. 33. 3.3. The interplay between gut microbiota and pancreatic cancer reveals complex interactions where dysbiosis could contribute to systemic inflammation and modulate tumor microenvironment dynamics, suggesting that therapeutic modulation of the gut flora may emerge as an adjunct measure in comprehensive cancer management. '34. The role of alcohol consumption in pancreatic cancer remains nuanced, with chronic heavy consumption contributing to pancreatitis and subsequent cancer risk, whereas moderate consumption lacks consistent evidence of similar associations. Thus, moderation remains advised within broader lifestyle considerations to mitigate overall cancer risk. '35. As the field examines the role of oxidative stress in pancreatic cancer pathogenesis, antioxidants and natural compounds are being explored for their potential protective effects, though clinical efficacy remains to be established, highlighting the need for rigorous trials to assess their role in prevention or adjunctive therapy. '36. Pancreatic neuroendocrine tumors, PNETs, although distinct from exocrine pancreatic ductal adenocarcinomas, present varied biological behavior and treatment approaches, often involving surgical resection, somatostatin analogs, and targeted therapies such as mTOR inhibitors, underscoring the diversity within pancreatic neoplasms. '37. Neuroendocrine-like differentiation in pancreatic adenocarcinoma can occur, posing diagnostic challenges and influencing prognosis, as tumors with mixed neuroendocrine and adenocarcinomatous features may exhibit variable responses to conventional chemotherapeutic regimens or targeted treatments. '38. Advances in precision medicine enhance the potential for liquid biopsy techniques, utilizing circulating tumor DNA and exosomes to provide non-invasive diagnostic and monitoring solutions in pancreatic cancer, though technical and analytical challenges persist in translating these modalities into routine clinical practice. '39. Vascular endothelial growth factor, VEGF, plays a critical role in angiogenesis within pancreatic tumors, fostering a pro-tumorigenic environment, yet anti-VEGF therapies have shown limited success, prompting further investigation into combination regimens or alternative angiogenic pathways as therapeutic targets. '40. The presence of diabetes mellitus may alter treatment paradigms in pancreatic cancer, affecting chemotherapy tolerance and metabolic management, thus requiring a comprehensive and collaborative approach to care that addresses oncologic and glycemic control simultaneously to optimize outcomes. '41. Environmental and occupational exposures, such as to certain hazardous chemicals or pesticides, have been implicated as potential risk factors for pancreatic cancer, emphasizing preventive measures and regulatory policies to reduce exposure and associated carcinogenic risks in susceptible populations. '42. Whilst pancreatic cancer surgery remains complex, advances in perioperative care and surgical techniques, including minimally invasive approaches, have contributed to improved surgical outcomes and reduced recovery times, driving ongoing innovation in the field of oncologic surgery. '43. Achieving a balance between curative intent and quality of life remains paramount in the treatment of pancreatic cancer, as aggressive interventions must be carefully weighed against potential benefits and impacts on patient well-being, underscoring the necessity for patient-centered decision-making in oncologic care plans. '44. Atypical presentations of pancreatic cancer, such as migratory thrombophlebitis or Trousseau's syndrome, reflect the tumor's paraneoplastic effects and hypercoagulable state, necessitating vigilant clinical assessment and anticoagulative measures to mitigate thrombosis risk in affected individuals. '45. Surgical margin status, as assessed post-resection, plays a critical role in determining prognosis for pancreatic cancer, as negative margins, R0 resection, are associated with improved survival outcomes, while positive microscopic or macroscopic margins, R1, R2, warrant consideration of additional adjuvant therapies. (46) The role of aspirin and non-steroidal anti-inflammatory drugs, NSAIDs, in pancreatic cancer risk reduction is under investigation, with some data suggesting modest risk reduction potential, but further research is needed to substantiate safety, efficacy, and appropriate use within standard prevention protocols. (47) Autophagy, a cellular degradation and recycling pathway, has dual roles in pancreatic cancer, where it may support tumor cell survival under stress conditions yet also contribute to cell death, positioning it as a target for modulation in novel therapeutic strategies aimed at disrupting cancer cell homeostasis. (48) Endoscopic ultrasound-guided biopsies are highly effective in obtaining tissue samples from pancreatic lesions, particularly due to their high sensitivity and specificity for malignancy, contributing significantly to diagnostic accuracy and facilitating timely therapeutic decision-making processes. (49) Serum amyloid, a protein, and its role in systemic inflammation are being explored within the context of pancreatic cancer as potential diagnostic or prognostic biomarkers, given their association with tumor-induced inflammatory responses, although clinical validation is necessary to support their use in clinical settings. (50) The emerging field of pharmacogenomics in pancreatic cancer seeks to tailor therapeutic regimens based on individual genetic and molecular profiles, optimizing treatment efficacy and minimizing adverse effects, while enhancing personalized medicine approaches that align with the broader shift towards precision oncology. (1) Prostate cancer is the most commonly diagnosed cancer among men worldwide, affecting significant numbers annually and emphasizing the importance of routine screening and early detection methods like PSA blood tests and digital rectal examinations to identify the disease at stages where it is most treatable and potentially curable. (2) Age is a primary risk factor for prostate cancer, with the majority of cases occurring in men over the age of 65, and it is rarely seen in men under 40, indicating the necessity for heightened awareness and regular monitoring as men age. (3) Family history plays a significant role in prostate cancer risk, with men having a first-degree relative with the disease being more than twice as likely to develop it themselves, highlighting the genetic components that must be considered in risk assessments and screenings. (4) The symptoms of prostate cancer can be subtle and may include difficulty urinating, loss of bladder control, and bone pain, which often appear once the cancer has spread beyond the prostate, thus underlining the importance of early diagnostic procedures. (5) The Gleason score is a grading system used to evaluate the prognosis of prostate cancer by examining the patterns of cancer cells in the prostate, with scores ranging from 2 to 10, where higher scores indicate more aggressive and poorly differentiated tumors. (6) Prostate cancer can exist in various forms, from indolent types that grow very slowly and may not require immediate treatment to aggressive cancers that quickly spread to bones and other organs, necessitating prompt and comprehensive therapeutic approaches. 7. Aside from family history, ethnicity is a known risk factor for prostate cancer, with African American men having a higher likelihood of developing the disease compared to Caucasian and Asian men, necessitating tailored strategies for prevention and early intervention. (8) The development of prostate cancer is associated with hormonal factors, particularly the role of androgens like testosterone, which can fuel the growth of cancer cells, making hormonal therapy a pivotal treatment for advanced stages of the disease. 9. A biopsy is the definitive method for diagnosing prostate cancer, involving the extraction and microscopic examination of prostate tissue samples, which determines the presence, extent, and grade of cancer, guiding subsequent management decisions and treatment planning. 10. Radical prostatectomy, the surgical removal of the entire prostate gland along with some surrounding tissue, is a standard treatment option for localized prostate cancer and can lead to a high probability of curing the disease when performed at an early stage. 11. Radiation therapy, using high-energy beams to target and kill cancer cells, serves as a primary or adjunctive treatment option for prostate cancer, showing particular efficacy in localized cancer in situations where surgery might not be feasible. 12. Active surveillance is a management strategy for low-risk prostate cancer cases where the disease is closely monitored through regular testing and biopsies, deferring immediate treatment unless there are signs of progression or significant changes. 13. Androgen deprivation therapy, ADT, is a cornerstone treatment for advanced prostate cancer, involving medications or surgical procedures that lower testosterone levels, slowing cancer growth and reducing symptoms, albeit with potential side effects like hot flashes and reduced libido. 14. PSA, or prostate-specific antigen, is a protein produced by prostate cells and measured through blood tests, serving as a marker for prostate health with elevated levels potentially indicating cancer or other prostate disorders, thus aiding in screening and monitoring. 15. The role of chemotherapy in prostate cancer is typically reserved for advanced stages where the cancer no longer responds to hormone therapy alone, utilizing drugs that kill rapidly dividing cells, thereby managing symptoms and potentially extending survival. 16. Immunotherapy for prostate cancer, which harnesses the body's immune system to attack cancer cells, is an evolving field with treatments like Sipuleucel T providing a novel approach for certain patients with metastatic castration-resistant prostate cancer. 17. Bone metastases are common in advanced prostate cancer, leading to complications like fractures and pain, and require targeted therapies such as bisphosphonates or radiation to reduce skeletal-related events and improve quality of life. 18. Obesity is a modifiable risk factor that may influence the development and progression of prostate cancer, with evidence suggesting that excess weight is linked to an increased risk of aggressive disease and poorer outcomes, highlighting the importance of maintaining a healthy lifestyle. 19. The association between diet and prostate cancer risk is still under investigation, with studies exploring the potential protective effects of diets rich in fruits, vegetables, and fish, and the possibly increased risks posed by high consumption of red and processed meats. 20. Genetic testing for BRCA1, BRCA2, and other similar mutations is advised for men with a strong family history of prostate cancer, as some mutations can elevate risk and influence personalized screening and treatment strategies for individuals at genetic risk. 21. Prostate cancer's microenvironment is complex, with stromal cells, immune infiltrates, and signaling molecules interplaying with cancer cells, influencing tumor initiation, growth, and resistance to therapies, underscoring the need for comprehensive treatment strategies. 22. MRI-guided biopsy is an advanced diagnostic technique that improves the accuracy of prostate cancer detection by using magnetic resonance imaging to target suspicious areas within the prostate, potentially leading to more precise and earlier identification of significant cancers. 23. Chronic inflammation and prostatitis have been investigated as potential factors in prostate cancer development, with some studies suggesting that inflammatory processes could contribute to carcinogenesis, though more research is needed to establish definitive causal links. Advances in precision medicine are shaping the future of prostate cancer treatment, where specific genetic and molecular profiles of a patient's tumor can guide individualized therapy choices, improving effectiveness and minimizing unnecessary side effects. Prostate cancer staging is crucial for determining the appropriate treatment approach, with stages ranging from I to IV, indicating the tumor's extent and spread from localized to distant metastasis, which directly influence prognosis and therapeutic decisions. Cryotherapy is an alternative treatment option for localized prostate cancer where extreme cold is used to freeze and kill cancerous tissue, offering a less invasive method compared to surgery, though primarily utilized for patients with recurrent disease after radiation. The role of vitamin D in prostate cancer prevention and treatment is a topic of ongoing research, as its potential anti-cancer properties and influence on prostate cell growth suggest that adequate levels may offer some protective benefits, though evidence remains inconclusive. Robotic-assisted laparoscopic prostatectomy is a minimally invasive surgical technique used to remove the prostate with precision and typically results in quicker recovery times, less blood loss, and reduced likelihood of long-term complications compared to open surgery. External beam radiation therapy, EBRT, for prostate cancer involves directing beams of radiation from outside the body to the prostate, effectively treating localized cancers with sophisticated techniques like intensity-modulated radiation therapy, IMRT, that maximize tumor targeting while sparing healthy tissue. Brachytherapy is a form of internal radiation treatment for prostate cancer where radioactive seeds are implanted directly into the prostate tissue, providing targeted therapy with minimal exposure to surrounding organs, making it a suitable option for some localized cancers. The concept of the prostate cancer gray zone describes cases with intermediate risk features where treatment decisions are particularly challenging, as they require careful consideration of potential benefits versus adverse effects, emphasizing the importance of individualized patient counseling. Hormone-refractory prostate cancer occurs when the disease progresses despite androgen deprivation therapy, necessitating alternative treatment modalities such as second-line hormonal therapies, chemotherapy, or participation in clinical trials evaluating novel agents. Neuroendocrine differentiation in prostate cancer is an aggressive variant that demonstrates unique histological features and may arise de novo or following hormonal therapy, necessitating distinct management approaches as it often shows resistance to conventional treatments. The ongoing debate about the benefits and harms of PSA screening highlights the importance of shared decision-making between patients and healthcare providers, considering individual risk factors and preferences when deciding the appropriate age and frequency for testing. Focal therapy for prostate cancer is an innovative approach that treats only the cancerous part of the prostate, utilizing techniques like HIFU, high-intensity focused ultrasound, to minimize side effects while effectively controlling the disease, although long-term outcomes are still under evaluation. Combination therapies, involving the concurrent use of multiple treatments such as ADT and radiation, have been shown to improve survival outcomes in patients with high-risk prostate cancer, emphasizing the importance of a multidisciplinary approach in managing complex cases. Sarcomatoid differentiation in prostate cancer is a rare but aggressive form characterized by a mixture of epithelial and mesenchymal features, associated with poor prognosis and challenging treatment courses, often necessitating a combination of surgery, chemotherapy, and radiation. Sentinel lymph node biopsy is an emerging technique in prostate cancer that identifies the first lymph nodes to which cancer cells are likely to spread, providing valuable staging information that can guide the extent of surgical intervention and additional therapies. The impact of prostate cancer on sexual health and function is significant, with treatments like surgery and radiation potentially affecting erectile function. Hence the importance of discussing potential side effects and considering options like nerve-sparing techniques or penile rehabilitation. Timely management of urinary symptoms associated with prostate cancer can improve quality of life, whether through surgical intervention, medications, or lifestyle modifications aimed at addressing obstructive urinary issues or irritative symptoms linked to treatment. 41. A multidisciplinary prostate cancer clinic involves specialists from urology, oncology, radiology, and other fields collaborating to create a comprehensive care plan tailored to each patient's unique clinical situation, optimizing outcomes through a coordinated approach. 42. Investigations into the microbiome and its relationship with prostate cancer suggest that bacterial colonization in the body's microbiota may play a role in disease development and progression, although concrete mechanisms and therapeutic implications are yet to be determined. 43. Advanced imaging technologies such as PSMA, prostate-specific membrane antigen, PET scans provide superior specificity and sensitivity in detecting prostate cancer metastasis, particularly in cases of biochemical recurrence where conventional imaging falls short. 44. Cognitive decline and mood changes are potential side effects associated with hormone therapy for prostate cancer, reflecting the far-reaching impacts of treatment on a patient's overall well-being and the need for comprehensive supportive care measures. 45. Metastatic castration-resistant prostate cancer, mCRPC, represents a treatment-resistant stage where the cancer progresses despite androgen deprivation therapy, requiring innovative therapeutic options such as targeted therapies and novel androgen pathway inhibitors. 46. The risk factor of dietary fat intake in prostate cancer remains contentious. However, some studies suggest that high consumption of saturated fats may correlate with an increased risk of aggressive forms, signifying the potential benefits of dietary modifications in prevention strategies. 47. Sarcopenia, or the loss of skeletal muscle mass and strength, can be a concern in prostate cancer patients, particularly those undergoing ADT, highlighting the importance of exercise regimens and nutritional support to maintain muscle health and minimize treatment-associated morbidities. 48. The psychological impact of a prostate cancer diagnosis can be profound, contributing to anxiety and depression, underscoring the necessity for mental health support and counseling as integral components of comprehensive cancer care. 49. Liquid biopsies, which analyze circulating tumor DNA in the blood, represent a promising non-invasive method for detecting and monitoring prostate cancer, offering insights into tumor genetics and treatment resistance patterns that can inform personalized therapeutic decisions. 50. Radioligand therapy, an experimental approach in prostate cancer treatment, utilizes molecules that deliver radiation directly to cancer cells while sparing normal tissues, showing promise in early trials for patients with advanced disease that has not responded to conventional treatments. 1. Cardiac arrhythmia refers to any disruption in the heart's normal rhythm, commonly resulting from chaotic electrical impulses within the heart muscle, which can lead to various symptoms such as palpitations, dizziness, syncope, or in severe cases, sudden cardiac death, emphasizing the importance of comprehensive cardiovascular examination and electrocardiogram (ECG) evaluation as part of the diagnostic process. The pathophysiology of cardiac arrhythmias often involves alterations in ion channel function, which can be attributed to genetic mutations, myocardial ischemia, or structural heart changes, leading to the development of conditions like atrial fibrillation, ventricular tachycardia, and other conduction disorders that necessitate tailored therapeutic strategies to mitigate risks and manage symptoms. Atrial fibrillation, the most prevalent form of cardiac arrhythmia, is characterized by rapid, irregular beating of the atrial chambers and can increase the risk of stroke and heart failure, making anticoagulation therapy an essential component of management alongside rate control medications like beta blockers or calcium channel blockers to improve patient outcomes. Ventricular fibrillation is a life-threatening cardiac arrhythmia caused by disorganized electrical activity in the ventricles, leading to cardiac arrest if not promptly treated with immediate defibrillation and advanced cardiac life support measures, underscoring the critical need for emergency response and intervention. The diagnostic approach for cardiac arrhythmias often involves Holter monitoring or event monitors, which provide continuous ECG recordings over 24 hours or longer, enabling clinicians to capture transient episodes of arrhythmia, correlating them with symptoms and aiding in the accurate identification of both the type and cause of arrhythmia. Supraventricular tachycardia, SVT, is a common arrhythmia originating above the ventricles, characterized by an abnormally fast heartbeat, often exceeding 150 beats per minute, which can be managed acutely with vagal maneuvers, adenosine, or, in recurrent cases, catheter ablation, highlighting the importance of individualized patient care. Long QT syndrome is a potentially dangerous arrhythmia disorder that prolongs ventricular repolarization, predisposing individuals to torsades de pointes, a form of polymorphic ventricular tachycardia, necessitating regular monitoring, avoidance of QT prolonging medications, and possibly the use of beta blockers or implantable cardioverter defibrillators, ICDs, in high-risk patients. Bradycardia is an arrhythmic condition defined by a heart rate of fewer than 60 beats per minute, which can be physiological or pathological, requiring thorough assessment to determine if management with pacemaker implantation is required to prevent symptoms like fatigue, dizziness, or syncope associated with insufficient cardiac output. Wolff-Parkinson-White syndrome is an arrhythmia condition caused by an accessory pathway that allows electrical impulses to bypass the heart's normal conduction system, leading to episodes of tachycardia that can be effectively treated with catheter ablation to prevent recurrence and improve quality of life. Premature ventricular contractions, PVCs, are early heartbeats originating in the ventricles, and while often benign, frequent PVCs should be evaluated with an electrocardiogram and echocardiogram to rule out underlying structural heart disease. Beta blockers may be considered if symptomatic or if there is an associated cardiomyopathy. Carotid sinus hypersensitivity, a cause of bradyarrhythmia, results from exaggerated response to stimulation of the carotid sinus, leading to episodes of syncope or presyncope that can impact quality of life and require head-up tilt testing for diagnosis, with dual-chamber pacemaker implantation being an effective treatment for recurrent symptomatic cases. 12. The ventricular tachycardia storm, characterized by frequent episodes of ventricular tachycardia requiring repeated interventions within a short period, is a critical arrhythmic emergency demanding aggressive treatment, including antiarrhythmic drugs, catheter ablation, and in some cases, sympathetic blockade, highlighting the importance of prompt therapy to prevent cardiomyopathy. 13. Sinus tachycardia, a common arrhythmic condition where the heart rate exceeds 100 beats per minute, can result from physiological responses to exercise or stress, but requires assessment to exclude underlying cardiac or systemic pathology, with management focusing on treating the root causes, reducing anxiety, and avoiding stimulants. 14. Atrioventricular nodal reentrant tachycardia, AVNRT, is a type of reentrant supraventricular tachycardia that can cause palpitations and lightheadedness, often diagnosed through characteristic ECG findings and effectively managed with the use of adenosine, rate-controlling medications, or radiofrequency catheter ablation for definitive treatment. 15. Atrial flutter, an arrhythmia characterized by a rapid and regular atrial rate, typically presents with a sawtooth pattern on ECG and can lead to rapid ventricular responses, necessitating rate control or rhythm control strategies similar to those used in atrial fibrillation, including electrical cardioversion, antiarrhythmic drugs, and potentially catheter ablation. 16. The Brugada syndrome is an inherited arrhythmic disorder with a distinct ECG pattern predisposing individuals to sudden cardiac death, particularly at rest or during sleep, where risk stratification is critical, and patients may benefit from ICD implantation to prevent life-threatening arrhythmic events despite being often asymptomatic. 17. Junctional rhythm refers to an arrhythmic condition where the heart's electrical activity originates in or near the atrioventricular node, leading to slower heart rates and occasionally retrograde atrial conduction, necessitating evaluation for causes such as digitalis toxicity or intrinsic conduction system disease with management tailored to the underlying etiology. 18. The multifocal atrial tachycardia, typically associated with underlying lung disease or metabolic disturbances, presents as an irregular rhythm with at least 3 different P-wave morphologies on ECG, requiring a multifaceted approach to treatment that includes correction of underlying conditions and the cautious use of rate-controlling agents. 19. Antiarrhythmic drugs play a pivotal role in the management of various arrhythmias, classified into different classes based on their electrophysiological properties, necessitating careful selection and monitoring due to potential proarrhythmic effects and interactions with other medications, emphasizing their use in conjunction with non-pharmacological methods when appropriate. 20. AV block, or atrioventricular block, is a type of heart block where the electrical conduction between the atria and ventricles is impaired, which can range from first-degree blocks with delayed conduction to third-degree blocks with complete dissociation, requiring pacemaker intervention in symptomatic high-grade blocks to maintain adequate hemodynamic stability. 21. Sick sinus syndrome, involving dysfunction of the sinus node, can result in episodes of bradycardia, sinus arrest, or alternating bradycardia-tachycardia syndrome, with symptomatic patients often requiring the implantation of a permanent pacemaker to alleviate symptoms and improve heart rate responses during daily activities. 22. Catecholaminergic polymorphic ventricular tachycardia is an inherited condition where adrenergic stress can trigger life-threatening arrhythmias in structurally normal hearts, mandating a combination of lifestyle modifications, beta blockers for arrhythmia prevention, and ICDs for high-risk patients to prevent sudden cardiac events during emotional or physical stress. 23. Digoxin, a cardiac glycoside used in the management of certain arrhythmias and heart failure, works by increasing vagal tone and improving heart contractility. However, it demands careful dose adjustment and monitoring to avoid toxicity characterized by gastrointestinal disturbances, visual changes, and potentially life-threatening arrhythmias due to its narrow therapeutic window. 24. Transvenous pacemaker insertion is a standard intervention for symptomatic bradyarrhythmias, involving the placement of pacing electrodes through the venous system to the heart, providing reliable electrical stimulation to correct slow heart rates, with advancements in technology offering options for dual-chamber or even leadless pacemakers tailored to patient-specific needs. 25. Idiopathic ventricular fibrillation refers to VF occurring in the absence of identifiable structural heart disease or known trigger factors, necessitating comprehensive evaluation to exclude reversible causes or genetic predispositions, with ICD therapy often being the cornerstone of prevention against recurrence and sudden cardiac death. 26. The tilt table test is a diagnostic tool used to evaluate unexplained episodes of syncope or presyncope, designed to provoke symptoms through postural changes, allowing assessment of autonomic function and vasoactive responses, with results guiding treatment options like lifestyle changes, medical therapies, or pacemaker implantation, particularly in neurally mediated syncope. 27. Atrial tachycardia, resulting from an abnormal focus of impulse generation outside the sinus node, often appears as regular narrow complex tachycardia on ECG, and management may involve pharmacological agents like calcium channel blockers or beta blockers and consider non-pharmacological approaches like catheter ablation for long-term control. 28. Amiodarone is a broad-spectrum antiarrhythmic agent effective against a wide range of arrhythmias, including atrial fibrillation and ventricular tachycardia, although its use may be limited by side effects such as thyroid dysfunction, pulmonary fibrosis, and liver toxicity, demanding vigilant long-term monitoring and consideration of risk-benefit balance. 29. AVRT, or atrioventricular reciprocating tachycardia, commonly results from an accessory pathway like in Wolff-Parkinson-White syndrome, presenting on ECG with delta waves, and treatment options include vagal maneuvers, pharmacological interventions, or catheter ablation to sever the accessory pathway for definitive resolution of the arrhythmia. 30. The Maze procedure, a surgical intervention for atrial fibrillation, involves creating a series of strategically placed incisions or ablations in the atria to disrupt reentrant circuits and restore sinus rhythm, typically reserved for patients undergoing cardiac surgery. For other indications or those who have failed catheter-based therapies. 31. Beta blockers, often used in the management of various arrhythmias, work by blocking beta-adrenergic receptors, reducing heart rate, and decreasing myocardial oxygen demand, proving effective in rate control for atrial fibrillation and preventing recurrent ventricular arrhythmias, with the selection of specific agents guided by patient comorbidities and cardiovascular risk. 32. Lown-Ganon-Levine syndrome is characterized by a short PR interval without the presence of delta waves on the ECG, resulting from accelerated atrioventricular conduction, with management focusing on symptom alleviation through the use of medications like verapamil or catheter ablation, tailored to individual patient presentation and pathway determination. 3. Electrolyte imbalances, such as hypokalemia and hypomagnesemia, are common reversible causes of arrhythmias, leading to increased cardiac excitability and the risk of ventricular tachyarrhythmias, necessitating prompt correction of deficiencies through oral or intravenous supplementation alongside continuous cardiac monitoring for patients at risk. 34. The physiological basis of reentry arrhythmias, a frequent mechanism in conditions like atrial flutter and ventricular tachycardia, involves the presence of anatomical or functional circuit pathways that allow a reentrant current of electrical activity, perpetuating tachycardia, and is typically managed through targeted ablation therapy to interrupt these circuits. 35. Sinus node dysfunction is often implicated in nocturnal bradycardia, resulting from an interplay of autonomic factors and sleep-disordered breathing, highlighting the importance of assessing for conditions like obstructive sleep apnea, which may exacerbate this arrhythmia, with therapeutic approaches including positive airway pressure therapy and pacemaker considerations for persistent symptoms. 36. In atrial fibrillation management, novel oral anticoagulants, NOACs, play a key role in stroke prevention, offering alternatives to traditional warfarin therapy free from frequent INR monitoring, with choices of dabigatran, rivaroxaban, apixaban, or edoxaban being driven by patient renal function, bleeding risks, and individual patient preferences. 37. Familial atrial fibrillation, a heritable form of arrhythmia, highlights the role of genetic predisposition in arrhythmogenesis, necessitating genetic counseling and consideration of vigilance in family members, with treatment strategies paralleling those of sporadic atrial fibrillation, emphasizing the balance of rate versus rhythm control approaches. 38. The implantable cardioverter defibrillator, ICD, remains a cornerstone in preventing sudden cardiac death in high-risk population segments like those with ischemic cardiomyopathy or inherited channelopathies, capable of delivering life-saving shocks or anti-tachycardia pacing to terminate ventricular tachyarrhythmias and restore sinus rhythm. 39. Premature atrial contractions, PACs, frequent ectopic beats originating in the atria, are usually benign but can serve as a precursor to more significant arrhythmias like atrial fibrillation, with lifestyle modifications being advised if symptomatic and consideration of beta blockers or calcium channel blockers for suppression. 40. The vagal maneuvers, simple physical techniques aimed at stimulating the vagus nerve, can induce reflexive slowing of heart rate, proving advantageous in terminating reentrant arrhythmias like supraventricular tachycardia, and should be included in initial therapeutic instruction for patients at risk of acute episodes alongside medical therapies. 41. QT interval prolongation, an ECG finding indicative of delayed cardiac repolarization, poses a significant arrhythmia risk for developing torsades de pointes, requiring careful evaluation and avoidance of QT prolonging substances, with therapeutic correction focusing on withdrawal of offending agents, electrolyte repletion, or use of specific antiarrhythmics. 42. The Holter monitor, a portable device providing continuous ECG recording over a day or more, plays a vital role in uncovering paroxysmal arrhythmias difficult to detect with standard examinations, guiding diagnosis and therapeutic decisions by correlating symptomatic episodes with underlying cardiac rhythm abnormalities. 43. Dopamine receptor agonists, sometimes involved in the management of Parkinson's disease or prolactinomas, carry the potential for inducing arrhythmic events through disturbance of sympathetic and parasympathetic balance, underscoring the need for baseline cardiac assessment and ongoing ECG monitoring to prevent adverse cardiac outcomes. 44. Accessory pathways in the heart predispose to arrhythmias by allowing electrical impulses to bypass normal conduction, creating scenarios like Wolff-Parkinson-White syndrome, with catheter ablation offering definitive management by selectively destroying the pathway, leading to permanent resolution and prevention of recurrence. 45. Recurrence of atrial fibrillation post-cardioversion is common and often necessitates the use of antiarrhythmic medications for rhythm maintenance, underscoring the need for consideration of rate control, lifestyle interventions, and assessment of secondary causes to sustain sinus rhythm and improve patient quality of life. 46. Ventricular premature beats, VPBs, or extrasystoles are isolated electrical impulses originating in the ventricles, commonly detected on routine ECGs, and while often benign, warrant evaluation for possible underlying heart disease in symptomatic patients or those with frequent VPBs, utilizing treatment strategies like beta blockers if deemed necessary. 47. The electrophysiological study, EPS, serves as a diagnostic tool for elucidating complex arrhythmia mechanisms, guiding therapeutic interventions by mapping cardiac electrical activity, and determining the exact location of aberrant pathways, forming a basis for decisions regarding catheter ablation or device therapy in refractory cases. 48. Respiratory sinus arrhythmia, a benign variation of heart rate with breathing, reflects the normal interaction between the respiratory cycle and the parasympathetic nervous system, often more pronounced in younger individuals and athletes, representing a physiological, non-pathological finding with no need for clinical intervention. 49. QRS widening on ECG signifies impaired conduction through the ventricles, seen commonly in bundle branch blocks, electrolyte imbalances, or drug effects, requiring assessment to determine if chronic or acute changes necessitate further cardiac workup, with specific treatment guided by underlying etiology and associated symptoms. 50. The Has-Bled score is a clinical tool used to estimate bleeding risk in patients with atrial fibrillation undergoing anticoagulation therapy, aiding in individualized risk assessment and optimization of therapeutic strategies, balancing the benefits of stroke mitigation against the potential for major bleeding complications. 1. Breast cancer is not a singular disease but rather a heterogeneous group with various subtypes such as luminal A, luminal B, HER2 positive, and triple negative, each exhibiting distinct molecular profiles and clinical behaviors, which necessitate personalized treatment strategies including targeted therapy, chemotherapy, radiation, or hormone therapy, thereby highlighting the importance of precision medicine in improving patient outcomes. 2. While most breast cancers originate in the lobules, starting as ductal carcinoma in situ, DCIS, the cancer can also arise from the connective tissue, leading to rarer forms like Phyllodes tumors, which require a surgical approach due to their tendency to recur locally despite being typically benign or borderline. 3. The triple-negative breast cancer subtype, characterized by the absence of estrogen receptor, progesterone receptor, PR, and HER2 amplification, remains one of the most aggressive forms, with limited targeted therapies, making ongoing research into immune checkpoint inhibitors and PARP inhibitors crucial to expanding therapeutic options for improving survival rates in affected women. 4. Novel imaging techniques such as contrast-enhanced mammography and automated breast ultrasound systems are increasingly used to improve sensitivity and specificity in detecting breast cancer, especially in women with dense breast tissue, potentially catching malignancies that could be missed using traditional mammography alone. 5. Dr. William Stewart Halsted pioneered the radical mastectomy in the late 19th century as a definitive treatment for breast cancer. However, advances in surgical techniques and a better understanding of tumor biology have shifted preference towards breast-conserving surgery and sentinel lymph node biopsy, significantly reducing surgical morbidity while maintaining oncologic efficacy. 6. The process of epithelial mesenchymal transition, EMT, plays a crucial role in the metastatic spread of breast cancer, as tumor cells lose their epithelial characteristics and gain mesenchymal traits, enhancing their mobility and invasiveness, which can lead to metastatic lesions in distant organs such as the bone, liver, lungs, and brain. 7. Oncotype DX and MammaPrint are two genomic assays that analyze the expression of multiple cancer-related genes in early-stage breast cancer, providing critical insights into recurrence risk and helping guide treatment decisions regarding the necessity of adjuvant chemotherapy. thus contributing to more personalized approaches for patient management. 8. Breast conservation therapy, BCT, which combines lumpectomy with radiation therapy, is as effective as mastectomy in early-stage breast cancer for survival outcomes and is associated with better cosmetic results in quality of life for many women, making it a preferred choice for eligible patients. 9. The risk of breast cancer increases with age, and around 80% of breast cancers occur in women over the age of 50, underscoring the importance of regular screening through mammography for early detection, as early-stage cancers are more amenable to treatment and have a higher likelihood of cure. 10. Inflammatory breast cancer is a rare but highly aggressive form of breast cancer characterized by skin changes resembling an infection, such as redness and warmth, and often presents without a distinct lump, requiring immediate treatment with chemotherapy followed by surgery and radiation to improve the historically poor prognosis associated with its rapid progression. 11. Breast cancer survivors face the long-term health challenges of treatment-induced side effects, including cardiotoxicity from anthracyclines and trastuzumab, lymphedema post-axillary surgery, and osteoporosis from aromatase inhibitors, necessitating a multidisciplinary follow-up to monitor and manage these chronic conditions to enhance survivors' quality of life. 12. Prophylactic mastectomy, the surgical removal of one or both breasts to reduce cancer risk, is considered in women with a high genetic predisposition to breast cancer, particularly those carrying BRCA1 or BRCA2 mutations, reducing the risk of developing breast cancer by about 90%, although the decision remains deeply personal and complex. 13. Neoadjuvant chemotherapy, administered before surgical intervention, is increasingly utilized in locally advanced breast cancer to shrink tumors, potentially allowing for less extensive surgery and providing early indication of how responsive the cancer is to the treatment regimen, which can inform further therapeutic strategy. 14. The role of the tumor microenvironment in breast cancer progression and treatment resistance is gaining attention, with the surrounding stromal cells, immune cells, and extracellular matrix components interacting dynamically with cancer cells, suggesting potential therapeutic targets that could prevent or alter metastatic spread. 15. Recent advances in biomarker discovery, such as the identification of circulating tumor cells, CTCs, and cell-free DNA, cfDNA, in the bloodstream, hold promise for creating less invasive diagnostic and prognostic tools for monitoring breast cancer progression and treatment response, providing real-time insights into disease dynamics. 16. Some breast cancer treatments target the angiogenesis process, crucial for tumor blood supply, with drugs like bevacizumab inhibiting the vascular endothelial growth factor, VEGF, though its use remains controversial due to varying responses and concerns about side effects outweighing survival benefits, prompting ongoing evaluations of optimal clinical settings for its application. 17. Male breast cancer, comprising about 1% of all breast cancer cases, often presents at a more advanced stage partly due to limited awareness and lack of routine screening, highlighting the need for increased recognition and tailored screening strategies that address the distinct risk factors and genetic predispositions unique to men. 18. Breast cancer incidence shows significant geographical variability worldwide, influenced by factors such as lifestyle, diet, reproductive history, and access to screening, enabling epidemiologists to construct risk prediction models that contribute to targeted prevention strategies within diverse populations. 19. Emerging breast cancer vaccine research aims to harness the immune system to recognize and target tumor-specific antigens, with experimental vaccines showing promise in eliciting immune responses in preclinical trials, potentially offering adjuvant tools for preventing recurrence in high-risk individuals and improving long-term survival. 20. Bisphosphonates and denosumab are agents used in breast cancer with bone metastasis to reduce skeletal-related events, such as pathologic fractures and spinal cord compression, by inhibiting cancer-induced bone resorption, thereby improving quality of life for patients with advanced stage disease. #21. Breast density, categorized through mammographic assessment, is a strong independent risk factor for breast cancer, with women having dense breast tissue at a higher risk due to the difficulty in detecting tumors and the increased probability of harboring aggressive features, sparking conversations on supplemental screening modalities like MRI and ultrasound. #22. Breast cancer metastasis to the brain occurs in approximately 10 to 15% of metastatic cases and is more common in patients with HER2 positive or triple negative subtypes, necessitating systemic treatment with HER2 targeted therapies and the consideration of stereotactic radiosurgery or whole brain radiotherapy to manage neurological symptoms and maintain life quality. #23. Breast cancer prognosis is evaluated using the TNM staging system, which considers the size and extent of the primary tumor, T, lymph node involvement, N, and metastatic spread, M, providing valuable information on the severity of the disease and guiding treatment decisions, with higher stages typically indicating more aggressive therapy is needed. #24. Hormone receptor-positive breast cancers, characterized by the expression of estrogen and/or progesterone receptors, often respond well to hormonal therapies such as tamoxifen or anastrozole, which block the oncogenic signaling pathways activated by these hormones, and are key components in both adjuvant and metastatic treatment settings. #25. The concept of oncogene addiction in breast cancer highlights how tumors may become reliant on particular genetic drivers, like the amplification of HER2, making targeted therapies addressing these vulnerabilities an effective strategy, as evidenced by the success of HER2 inhibitors like trastuzumab and pertuzumab in transforming the treatment landscape for these cancers. #26. The Gale model is a widely used tool for assessing breast cancer risk, employing a combination of factors such as age, family history, hormonal factors, and reproductive history to calculate an individual's risk of developing breast cancer, aiding in decision-making regarding preventive interventions like increased surveillance or chemoprevention. #27. The presence of tumor-infiltrating lymphocytes, TILs, in breast cancer, particularly in triple-negative and HER2-positive subtypes, is associated with better prognosis and response to chemotherapy, indicating that the host immune response plays a crucial role in modulating cancer progression and therapeutic outcomes. #28. The introduction of digital mammography has revolutionized breast cancer screening by offering superior image quality, better detection rates, and lower radiation doses compared to traditional film mammography, making it a cornerstone in the early detection of malignancies and contributing significantly to decreased mortality rates through early intervention. #29. Microenvironmental hypoxia, often present in rapidly growing breast tumors, is a critical factor that drives cancer cell adaptation and therapy resistance by activating hypoxia-inducible factors, HIFs, which promotes angiogenesis, metabolic reprogramming, and an aggressive phenotype, presenting opportunities for therapeutic intervention with HIF inhibitors. #30. The American Joint Committee on Cancer, AJCC, introduced the 8th edition breast cancer staging system incorporating genomic panels and biomarkers like the 21 gene recurrence score, emphasizing the adoption of molecular data in refining prognostication and guiding the use of adjuvant systemic therapies more precisely. #31. The risk of developing breast cancer is influenced by lifestyle factors, with increased alcohol consumption, obesity, and sedentary behaviors contributing to higher risks, encouraging interventions focused on lifestyle modifications, such as diet, exercise, and reducing alcohol intake, to potentially lower the incidence of breast cancer in the general population. 32. Sentinel lymph node biopsy has become the standard practice for axillary staging in early breast cancer, significantly reducing the morbidity of axillary lymph node dissection by targeting the first draining nodes, allowing you to determine if cancer cells have spread without the need for extensive node removal in the absence of metastatic disease. 3. Breast cancer during pregnancy presents unique challenges, as diagnostic and treatment options must be carefully balanced to protect fetal health while ensuring effective cancer management, with strategies often involving modified chemotherapy regimens compatible with pregnancy and coordinated multidisciplinary care to guide optimal outcomes. 34. The role of the BRCA1 and BRCA2 genes in breast cancer risk extends beyond simple genetic predisposition. These genes are crucial components of the homologous recombination DNA repair pathway, and their mutation results in genomic instability, making cells more susceptible to malignant transformation but also creating opportunities for treatment with PARP inhibitors. 35. Triple-negative breast cancer, TNBC, is being explored for novel therapeutic targets like the androgen receptor, AR, and other non-estrogen receptor pathways, as some TNBCs may express AR, offering potential for anti-androgen therapies to complement existing treatment paradigms and enhance outcomes in this challenging breast cancer subtype. 36. Breast cancer patients may exhibit cancer-related cognitive impairment, often referred to as chemobrain, which includes symptoms such as memory lapses, difficulty concentrating, and mental fog, likely resulting from chemotherapy agents, stress, and inflammatory cytokines, warranting support strategies and cognitive rehabilitation to improve daily functioning. 37. HER2 amplification in breast cancer, traditionally considered as an adverse prognostic indicator, has evolved as a therapeutic target with the development of monoclonal antibodies like trastuzumab, which specifically targets the HER2 receptor, demonstrating improved survival rates and being paramount in the management of HER2-positive breast cancer. 38. Recent studies suggest a possible link between night shift work and elevated breast cancer risk, potentially due to altered levels of melatonin, which is hypothesized to have cancer protective properties, emphasizing the need for additional research and interventions that could mitigate occupational risk factors in shift workers. 39. The integration of artificial intelligence, AI, in breast cancer diagnostics is advancing, with AI algorithms being developed to enhance mammogram interpretations, identify patterns indicative of malignancies with high accuracy, and assist radiologists in reducing false positives and unnecessary biopsies, further streamlining the diagnostic process. 40. Breast cancer recurrence can occur years after initial treatment completion, often influenced by factors such as tumor biology, treatment adherence, and lifestyle, reinforcing the necessity for long-term follow-up and vigilance in survivorship care to detect and manage recurrences early, ensuring timely intervention and improved survival chances. 41. The phenomenon of liquid biopsy is emerging as a game-changer in breast cancer management. It entails the non-invasive collection of blood samples to detect circulating tumor cells or tumor-derived fragments, enabling real-time monitoring of tumor burden, treatment efficacy, and the detection of minimal residual disease, potentially guiding timely therapeutic adjustments. 42. Breast cancer care disparities exist across socioeconomic and racial lines, with access to screening programs, treatment availability, and quality of care often affecting outcomes, calling for public health initiatives to bridge these gaps, ensuring equitable access to preventive measures and treatments for all demographics. 43. While traditionally limited to invasive approaches, focal therapy for breast cancer, including techniques like cryoablation and high-intensity focused ultrasound, offers minimally invasive alternatives to surgical excision, potentially allowing for effective tumor control while preserving breast tissue integrity and patient quality of life. 44. Axillary locoregional recurrence is a concern after initial breast cancer surgery, with the risk factors including incomplete resection and aggressive histology, highlighting the need for careful surgical planning and the potential benefit of adjuvant radiation in cases with unfavorable pathological features to reduce recurrence likelihood. 45. Breast cancer molecular subtyping has transformed therapeutic approaches, as differences in genetic expression profiles guide treatment selection between hormone therapy, HER2 targeted agents, and chemotherapy, tailoring regimens to the unique biology of each case and maximizing treatment efficacy. 46. Phyllodes tumors, a rare form of breast tumors, exhibit a spectrum of behavior from benign to malignant, distinguished by the stromal overgrowth component, and are predominantly treated with wide local excision to ensure clear margins, as the risk of local recurrence is significant, often mandating vigilant follow-up. 47. Radiation therapy advancements, such as intensity-modulated radiation therapy, IMRT, allow for better targeting of breast tumors while sparing healthy tissue, reducing side effects, and improving cosmetic outcomes, representing a substantial progression in adjuvant breast cancer therapy for individuals undergoing conservative surgery. 48. Breast cancer prevention strategies go beyond lifestyle modifications and familial risk assessments. They also include chemoprevention with agents like tamoxifen and raloxifene in high-risk women, which have shown efficacy in reducing breast cancer incidence by modulating estrogen receptor pathways and acting as selective estrogen receptor modulators. 49. Breast cancer metastasis remains a major therapeutic challenge, as disseminated disease becomes less curable and focuses on prolonging survival and maintaining quality of life, highlighting the importance of understanding the molecular mechanisms driving metastasis and exploring targeted therapies to prevent or retard the spread of tumors. 50. The role of autophagy in breast cancer is a double-edged sword, where it can be both tumor suppressive by removing damaged organelles and protein aggregates, and tumor promotive by providing nutrients through cellular recycling during metabolic stress, making it a complex target for therapeutic manipulation and enhancing treatment outcomes. One. Hepatocellular carcinoma, HCC, is a primary liver cancer typically arising in the context of chronic liver disease, often precipitated by hepatitis B or C infections, obesity-related fatty liver disease, or chronic alcohol consumption, exhibiting a multifocal growth pattern within the liver and, in advanced stages, commonly producing elevations of the tumor marker alpha-fetoprotein, AFP. 2. The complex interplay between hepatic stellate cell activation and the surrounding inflammatory milieu can promote fibrosis and cirrhosis, which are significant risk factors for the development of hepatocellular carcinoma, with these cells contributing to the deposition of extracellular matrix and fibrous tissue, setting a fertile ground for oncogenesis. 3. Advances in imaging technology, including contrast-enhanced multiphase CT or MRI scans, have dramatically improved the ability to pinpoint and stage hepatocellular carcinoma, allowing for detailed visualization of tumor vasculature, perfusion characteristics, and differentiation of HCC from benign hepatic lesions. 4. Liver biopsy, though historically considered the gold standard for diagnosing hepatocellular carcinoma, is increasingly being supplanted by non-invasive imaging studies that leverage characteristic radiologic criteria, such as arterial phase hyperenhancement and washout in the venous phase, supplemented by clinical and serologic data. 5. The Barcelona Clinic Liver Cancer (BCLC) staging system is frequently used to classify hepatocellular carcinoma patients and guide treatment decisions, efficiently stratifying patients based on prognostic factors such as tumor size and number, liver function, and performance status to optimize therapeutic outcomes. Six. Surgical resection remains a potentially curative option for hepatocellular carcinoma, particularly in patients with solitary tumors confined to one liver lobe and well-preserved liver function, though postoperative recurrence remains a significant challenge requiring close surveillance and adjunctive treatments. 7. Liver transplant offers the highest chance for cure in patients with hepatocellular carcinoma who fit the Milan criteria, typically defined as a single tumor is less than or equal to 5 cm or up to 3 tumors is less than or equal to 3 cm each, providing not only a complete oncological resection but also correction of underlying cirrhosis. Eight. Transarterial chemoembolization, TACE, a localized form of treatment for hepatocellular carcinoma, involves the delivery of chemotherapeutic agents directly into the hepatic artery supplying the tumor, followed by embolization to restrict the blood flow, inducing ischemia in neoplastic cells. 9. Sorafenib, a multikinase inhibitor, has become a cornerstone of systemic therapy in advanced hepatocellular carcinoma by inhibiting tumor cell proliferation and angiogenesis through blocking the RAF-MEK-ERK pathway and vascular endothelial growth factor receptors, extending patient survival. 10. The pathogenesis of hepatocellular carcinoma involves genetic alterations such as mutations in the TP53 and CTNNB1 genes, which disrupt normal cell cycle control and WNT signaling pathways, leading to unchecked cell proliferation and, ultimately, transformation into malignant hepatic cells. Immunotherapy, particularly immune checkpoint inhibitors like nivolumab and pembrolizumab, has shown promise in the treatment of hepatocellular carcinoma by enhancing the immune system's ability to recognize and attack cancerous cells, offering new hope for patients with previously limited options. 12. The role of the tumor microenvironment in hepatocellular carcinoma is crucial, with the interplay between cancer-associated fibroblasts, immune cells, and extracellular matrix components fostering a pro-tumorigenic environment that supports tumor growth, invasion, and resistance to therapy. 13. Radiofrequency ablation, RFA, is a minimally invasive procedure utilized for treating small hepatocellular carcinoma lesions by inserting a needle electrode into the tumor and delivering high-frequency electrical currents, which generate heat and induce coagulative necrosis of malignant cells. 14. The use of liver imaging reporting and data system, LIRADS, in the evaluation of hepatocellular carcinoma helps standardize reporting, ensuring consistent interpretation of imaging findings, and increases diagnostic accuracy by providing a structured approach for classifying liver lesions based on imaging features. 15. The phenomenon of tumor heterogeneity in hepatocellular carcinoma can lead to differential response to treatments and contributes to the difficulty in achieving sustained remission, as subpopulations of cells may harbor distinct genetic profiles and adaptive mechanisms that enable survival under therapeutic pressure. 16. Hepatocyte nuclear factors and microRNAs play key roles in the transcriptional regulation and post-transcriptional modulation of genes involved in hepatocarcinogenesis, where dysregulation of these molecules can affect pathways integral to cell growth, apoptosis, and differentiation in hepatocellular carcinoma. 17. Exercise has shown potential as an ancillary therapeutic measure in hepatocellular carcinoma, improving patient quality of life and potentially influencing disease progression by modulating inflammatory cytokine levels and insulin sensitivity, although more research is needed to establish definitive benefits. 18. Aflatoxin exposure, particularly in regions where it contaminates staple crops, remains a significant risk factor for hepatocellular carcinoma, as the mycotoxin induces mutations in the DNA of hepatocytes, prominently the TP53 gene, leading to malignant transformation and promoting liver cancer development. 19. The phenomenon of non-cirrhotic HCC is increasingly being recognized, where hepatocellular carcinoma develops in the absence of cirrhosis, often linked to metabolic risk factors such as obesity, diabetes, and non-alcoholic steatohepatitis, challenging traditional paradigms of liver cancer pathogenesis. 20. The surgical technique and extent of resection in hepatocellular carcinoma are critical, with margins of at least 1 cm being preferred to reduce recurrence rates, while preserving enough liver function through careful consideration of the patient's future liver remnant to prevent postoperative liver failure. 21. In the genetic landscape of hepatocellular carcinoma, chromosomal instability, copy number variations, and epigenetic changes, such as DNA methylation and histone modifications, contribute to oncogen activation and tumor suppressor gene silencing, playing pivotal roles in tumor initiation and progression. 22. The hepatitis B virus X protein, HBX, is implicated in the development of hepatocellular carcinoma, exerting multiple effects including disruption of cellular signaling pathways, inhibition of tumor suppressor proteins, promotion of cell cycle progression, and induction of immune tolerance, facilitating liver carcinogenesis. 23. Digital pathology and artificial intelligence are emerging as powerful tools in hepatocellular carcinoma research, offering potential for improved diagnostic accuracy, identification of novel biomarkers, and personalized medicine approaches by processing large volumes of histopathological data efficiently. 24. Hepatocellular carcinoma can exhibit diverse histological subtypes, such as fibrolamellar carcinoma, which typically affects younger patients and has distinct prognostic implications, with the fibrolamellar variant often associated with better survival outcomes compared to conventional HCC subtypes. 25. Advances in liquid biopsy technologies allow for minimally invasive detection and monitoring of hepatocellular carcinoma using circulating tumor DNA or tumor-derived exosomes, offering insights into tumor genetics, treatment response, and potential recurrence without the need for traditional tissue biopsies. 26. The concept of field cancerization in hepatocellular carcinoma highlights the prevalence of precancerous changes or preneoplastic lesions within a chronically injured liver, where regions affected by ongoing inflammation and fibrosis provide a conducive environment for tumor development. 27. The advent of drug-eluting beads used in transarterial chemoembolization introduces a method for sustained local drug delivery in hepatocellular carcinoma treatment, designed to improve the therapeutic index by targeting chemotherapeutic agent release directly at the tumor site with prolonged activity. 28. Understanding the role of gut-liver axis dysbiosis in hepatocellular carcinoma is gaining attention, where microbial composition and translocation of microbial products can influence hepatic inflammation, fibrosis, and carcinogenesis, prompting interest in microbiome-targeted therapies as a potential intervention. 29. Epigenomic research in hepatocellular carcinoma reveals the influence of environmental and lifestyle factors on gene expression, where diet, pollutants, and viral exposures can lead to systemic alterations in DNA methylation patterns or histone modifications that may forecast cancer susceptibility and progression. 30. Alcohol-induced hepatocellular carcinoma involves complex mechanisms where chronic ethanol intake leads to oxidative stress, acetaldehyde production, alterations in lipid metabolism, and DNA damage, all of which converge on promoting hepatocyte injury, aberrant regeneration, and subsequent neoplasia. 31. In clinical trials, combination therapy approaches that utilize checkpoint inhibitors alongside kinase inhibitors or targeted agents against specific molecular pathways present a promising frontier in the therapeutic landscape for hepatocellular carcinoma, potentially enhancing efficacy and therapeutic durability. 32. The assessment of hepatic function using scoring systems like Child-Pugh or the Model for End-Stage Liver Disease (MELD) is critical in the management of hepatocellular carcinoma, as they provide metrics for balancing oncologic intervention with preservation of quality of life and liver function. 3. Targeting angiogenesis in hepatocellular carcinoma through agents like bevacizumab, an anti-VEGF monoclonal antibody, disrupts tumor blood supply, counteracting the angiogenic stimulatory effects seen in HCC's hypoxic microenvironment and reducing tumor growth and metastasis. 34. The metabolic reprogramming observed in hepatocellular carcinoma underscores the Warburg effect, where cancer cells preferentially utilize anaerobic glycolysis over oxidative phosphorylation for energy production, contributing to rapid cell proliferation and offering potential metabolic targets for therapy. 35. Image-guided precise interventions, including microwave ablation or irreversible electroporation, are expanding the repertoire of techniques for local control of hepatocellular carcinoma, offering options for patients unsuitable for surgery with real-time imaging to optimize treatment delivery and results. 36. The investigation of circulating biomarkers, like D-gamma-carboxyprothrombin and soluble programmed death ligand 1, for hepatocellular carcinoma diagnosis and prognosis is a growing field that holds promise in improving early detection and stratification of patient risk profiles. 37. Current research is exploring the role of cancer stem cells in hepatocellular carcinoma, elucidating how these cells sustain tumorigenesis, resist conventional therapies, and serve as a seed for recurrence and metastasis, paving the way for the development of CSC-targeted therapeutics. 38. The interplay of signaling pathways such as PI3K, AKT, mTOR and TGF-beta in hepatocellular carcinoma development and progression is well documented, with dysregulation leading to enhanced cell proliferation, survival, differentiation and epithelial mesenchymal transition, making them focal points for therapeutic intervention. 39. Intra-arterial radiotherapy with yttrium-90 microspheres represents an innovative approach for treating hepatocellular carcinoma, targeting liver tumors with selective delivery of radioactive isotopes, producing localized cytotoxic effects with minimal damage to surrounding healthy tissue. 40. The psychosocial implications of hepatocellular carcinoma are substantial, as patients often grapple with the dual burden of managing oncologic and chronic liver disease, necessitating comprehensive support systems focused on mental health, social integration, and access to multidisciplinary care. 41. The examination of hepatocellular carcinoma in the context of liver transplantation involves considerations of tumor biology, organ availability, and the potential for tumor recurrence, with studies highlighting the influence of factors like pre-transplant treatment response on long-term outcomes. 42. Perioperative management in hepatocellular carcinoma surgery is crucial, requiring optimization of liver function, management of coagulopathy, and precise hemostatic control to minimize the risk of postoperative complications and ensure patient recovery and surgical success. 43. Oncolytic virotherapy is emerging as a novel treatment modality for hepatocellular carcinoma, utilizing genetically engineered viruses that selectively infect and lyse cancer cells, activating systemic anti-tumor immune responses and offering potential in combination with other immunotherapeutic strategies. 44. The utilization of computational modeling in hepatocellular carcinoma research enables simulation of tumor growth and treatment response, offering insights into the dynamic interactions between therapeutic agents and cancerous cells, which can inform the design and optimization of clinical trials. 45. The integration of radiomics, which extracts quantitative features from medical imaging, into hepatocellular carcinoma management provides a non-invasive avenue to characterize tumor phenotype, predict treatment response, and refine prognosis, with potential to advance personalized radiotherapy approaches. 46. Dietary interventions in hepatocellular carcinoma, including modulation of nutrient intake and fasting regimens, draw interest for their ability to influence metabolic pathways and immune responses, presenting opportunities to complement traditional therapies and potentially ameliorate treatment-related side effects. 47. The exploration of epigenetic targeting drugs, such as histone deacetylase inhibitors and DNA methyltransferase inhibitors in hepatocellular carcinoma, seeks to reverse aberrant epigenetic marks and restore normal gene expression patterns, presenting innovative therapeutic avenues in cancer management. 48. Hepatocellular carcinoma research increasingly recognizes the role of extracellular vesicles in mediating cell-to-cell communication within the tumor microenvironment, facilitating the transfer of oncogenic proteins and RNA species that promote metastasis and therapy resistance. 49. Intraoperative navigation using real-time image fusion techniques enhances the precision of surgical resections for hepatocellular carcinoma, potentially improving oncological outcomes by allowing surgeons to delineate tumor margins more accurately and preserve critical liver structures. 50. The potential of chimeric antigen receptor T-cell therapy in hepatocellular carcinoma is being explored, with researchers engineering T-cells to recognize liver cancer-specific antigens, offering a frontier in adoptive cell therapies that leverage targeted immune responses to eradicate malignant cells. Bronchial asthma is a chronic inflammatory disorder of the airways characterized by episodic exacerbations of dyspnea, coughing, wheezing, and chest tightness, driven primarily by eosinophils and mast cells that release inflammatory mediators, leading to a reversible obstruction of airflow and hyperreactivity of the bronchial passages. The pathophysiology of bronchial asthma involves an imbalance of Th1, Th2 cytokine response, where a predominance of Th2 cells promotes an allergic cascade, producing cytokines like IL-4, IL-5, and IL-13, which facilitate IgE synthesis, eosinophil recruitment, and airway remodeling. In diagnosing bronchial asthma, spirometry is a fundamental tool and generally reveals a reversible obstructive pattern, evidenced by a reduced forced expiratory volume in the first second, FEV1, that improves by at least 12% in 200 ml post-bronchodilator administration. The Global Initiative for Asthma Management recommends a stepwise approach to asthma treatment, starting with as-needed low-dose inhaled corticosteroid formoterol for mild cases and escalating to higher doses and additional controller therapies like long-acting beta-2 agonists, LABAs, or leukotriene receptor antagonists for more severe asthma. Exhaled nitric oxide, ENO, levels can serve as a non-invasive biomarker for airway inflammation in asthma, with elevated levels indicating eosinophilic inflammation and a likely positive response to inhaled corticosteroids, thus guiding asthma management tailored to inflammation levels. 6. Common environmental triggers of asthma include inhaling allergens such as pollen, dust mites, pet dander, and mold, alongside air pollutants and tobacco smoke, which can provoke an inflammatory cascade in sensitized individuals, exacerbating asthma symptoms and leading to acute exacerbations. 7. Nocturnal asthma, a variant where symptoms worsen at night, is influenced by circadian variations in bronchial tone and responsiveness, peaking in the early morning due to increased vagal tone, heightened airway inflammation, and potentially reduced levels of circulating glucocorticoids. 8. A significant innovation in asthma management is the use of monoclonal antibodies like omalizumab, an anti-IgE therapy specifically designed for individuals with moderate to severe allergic asthma not adequately controlled by conventional therapies, by binding free IgE, reducing its activity and downstream allergic inflammation. 9. Distinguishing asthma from chronic obstructive pulmonary disease, COPD, requires keen clinical acumen, as patients with asthma typically present with a history of allergies and variable symptoms, while COPD generally arises in older individuals with a history of smoking, showing a progressive and non-reversible pattern of airflow limitation. 10. Asthma exacerbations are acute or subacute episodes of worsening symptoms often precipitated by infections, allergens, irritants, or exercise, owing to increased airway inflammation and narrowing that demand immediate intervention with systemic corticosteroids and bronchodilators to restore airflow and prevent progression. 11. Bronchial thermoplasty represents an innovative treatment for severe refractory asthma, employing controlled thermal energy delivered via bronchoscopy to selectively reduce airway smooth muscle mass, diminishing the excessive contractile response that characterizes asthma and thereby reducing exacerbations and improving quality of life. 12. A personalized approach in asthma management encompasses phenotyping patients into endotypes such as eosinophilic, neutrophilic, mixed granulocytic, or posagranulocytic inflammation, which allows for targeted therapies that specifically address the dominant inflammatory pathway most active in an individual's asthma. 13. Exercise-induced bronchoconstriction, IBD, is asthma triggered by physical activity, due to rapid air movement causing airway drying and cooling, followed by hyperemia and mast cell mediator release. Preventive pre-exercise inhalation of short-acting beta-2 agonists can help mitigate frequency and severity of such attacks. 14. Understanding asthma pathogenesis involves recognizing the role of genetics and environmental interactions, with genetic predispositions such as polymorphisms in genes encoding for cytokines, beta-2 adrenergic receptors, and proteins involved in the inflammatory process that increase the risk of developing asthma when exposed to environmental triggers. 15. Pediatric asthma presents unique challenges due to the developing respiratory system and distinct patterns of inflammation. Small airway size, more pronounced reactions to viral infections, and differential responses to allergen exposure necessitate tailored management strategies aligned with the child's specific triggers and symptom patterns. 16. One innovative diagnostic approach for asthma involves fractional exhaled nitric oxide (FeNO) testing, where elevated levels indicate eosinophilic inflammation that may predict the response to corticosteroid therapy and serve as a marker for adherence to controller medications, providing insight into inflammation control. 17. Occupational asthma is caused by an exposure to specific allergens or irritants at work, such as isocyanates, flour dust, or animal dander, requiring both confirmation of the diagnosis through occupational history and physiological testing, and implementation of exposure controls or workplace changes to alleviate symptoms. 18. In recent years, personalized medicine in asthma has advanced with the advent of biologics targeting specific cytokines such as IL-5, with drugs like mepolizumab and benralizumab that focus on reducing eosinophilia, thereby preventing exacerbations and reducing the need for oral corticosteroids in patients with severe eosinophilic asthma. (19) Allergen immunotherapy is a proactive treatment strategy for allergic asthma sufferers, involving gradual exposure to increasing amounts of specific allergens, which aims to desensitize the immune system, reduce IgE-mediated responses, and provide long-term mitigation of allergic symptoms linked to asthma. (20) The Asthma-COPD Overlap Syndrome, ACOS, poses diagnostic and therapeutic challenges, requiring a nuanced approach that combines treatments addressing both reversible bronchoconstriction and persistent airflow obstruction while considering the presence of airway inflammation characteristic of each condition. (21) Peak expiratory flow rate, PEFR, monitoring provides a practical method to assess airway obstruction in asthma patients. Personal bests are used to set action plans to guide patients on self-management, helping detect early signs of exacerbation and thereby preventing deterioration of lung function. (22) Asthma control is critically evaluated through patient-reported outcomes and validated questionnaires such as the Asthma Control Test, ACT, allowing healthcare providers to quantify symptom presence and severity, and adjust therapeutic regimens accordingly to achieve optimal symptom-free days and nights. (23) Complementary asthma treatments like yoga and breathing exercises can improve respiratory function and reduce stress-related symptom exacerbations, working synergistically with conventional treatment to promote overall well-being, improved lung capacity, and better control of symptoms. (24) The association of asthma with obesity is supported by evidence showing that adipose tissue contributes to systemic inflammation via secretion of adipokines, potentially exacerbating asthma symptoms and reducing lung function, making weight management a critical component of comprehensive asthma management strategies. (25) Vocal cord dysfunction, VCD, is an important differential diagnosis in patients with severe asthma, wherein inappropriate vocal cord closure during inspiration mimics asthma symptoms, highlighting the need for precise laryngoscopy to accurately distinguish between VCD and asthma for effective management. (26) Severe asthma, often refractory to standard treatments, may be guided by genomic studies identifying biomarkers and genetic variations associated with treatment responses, providing a basis for precision medicine approaches that optimize therapy selection and outcome predictions. (27) Asthma management in pregnancy requires careful balancing to ensure maternal health without compromising fetal development, with inhaled corticosteroids remaining the preferred controller medication, while ensuring any pharmacotherapeutic intervention is safe for both mother and child. (28) The hygiene hypothesis suggests that asthma has become more prevalent due to reduced early childhood exposure to infections, leading to an unbalanced immune response favoring allergic sensitization, supporting the importance of early exposure to diverse microbial environments in mitigating the risk of asthma. (29) Prolonged exposure to low-grade air pollution, particularly particulate matter and nitrogen dioxide, not only exacerbates asthma symptoms but is linked with increased onset risk, underscoring the importance of environmental policies and individual practices aimed at minimizing exposure to air pollutants. (30) Digital health technologies and smart inhalers are emerging as valuable tools in asthma management, offering real-time monitoring of medication usage and adherence, providing data-driven insights that inform personalized treatment adjustments and foster improved patient engagement in their healthcare regimen. 31. Asthma in the elderly poses unique challenges, often presenting with atypical symptoms and underdiagnosed due to attribution of symptoms to aging, necessitating vigilant assessment practices that discern asthma from comorbidities, ensuring accurate diagnosis and tailored management. (32) Viral respiratory infections, particularly those caused by rhinoviruses, are significant triggers of asthma exacerbations, inciting inflammation and hyper-responsiveness through pathogen recognition receptors on airway cells, thereby making preventative strategies against respiratory infections essential in asthma management. (3) Pediatric asthma education programs focusing on self-management skills tailored to developmental stages, emphasize understanding trigger avoidance, inhaler technique, and recognizing asthma action plans, which significantly enhance health outcomes and reduce emergency department visits in children. (34) In recent developments, heat maps generated from wearable biosensors monitoring physiological parameters like heart rate and respiratory patterns can provide predictive analytics of asthma exacerbations, offering cutting-edge opportunities for early intervention in asthma management. (35) Lifestyle modifications, including dietary adjustments that prioritize omega-3 fatty acids, antioxidants, and decreased processed foods, have shown promise in reducing systemic inflammation and improving asthma control, supporting the role of nutrition in comprehensive asthma management. (36) The spiraling costs of asthma care have prompted exploration into cost-effective strategies like telemedicine consultations, which improve access to specialist care and are associated with positive outcomes in asthma management, reinforcing the viability of technology-assisted healthcare delivery. (37) Inflammation in asthma is traditionally focused on the eosinophilic variety, yet neutrophilic and mixed inflammatory profiles are increasingly recognized, necessitating distinct approaches such as non-steroidal anti-inflammatory agents or macrolides that efficiently target the specific inflammatory cell populations. (38) The role of the microbiome in asthma is an expanding field of research. Disruptions in microbial diversity in the airway and gut have been linked to increased asthma risk, thus influencing potential therapeutic strategies aimed at modulating the microbiome to maintain immune system balance. (39) Precision-guided inhaler drug delivery systems are being enhanced by leveraging particle engineering technology to optimize drug particle size and distribution, aiming at maximizing deposition in the lower airways and consequently improving efficacy for controlling asthma symptoms and exacerbations. (40) Advances in epigenetic research have opened new frontiers in asthma treatment, revealing how modifications in gene expression, driven by environmental factors, contribute to the asthma phenotype and could become targets for epigenetic therapeutics aimed at altering the disease trajectory. (41) Asthma action plans, individually tailored and regularly reviewed, are critical elements in disease management that empower patients to respond effectively to changing symptoms, preventing exacerbations through a structured approach that defines specific actions based on symptom severity and peak flow measurements. (42) The role of health literacy in asthma outcomes is profound, with studies indicating that improved literacy and understanding of asthma pathophysiology, triggers, and treatments correlate with better disease control, reduced healthcare utilization, and the empowerment of patients to participate actively in their care. (43) Airway remodeling, a chronic outcome of untreated or poorly controlled asthma, results from persistent inflammation leading to structural changes such as subepithelial fibrosis and smooth muscle hypertrophy, emphasizing the importance of timely and consistent treatment to prevent irreversible airway obstruction. (44) Innovations in AI-driven asthma management explore algorithms that integrate patient-specific data, predictive analytics, and clinical guidelines to support healthcare providers in making informed decisions, thereby optimizing individualized care protocols and potentially improving long-term asthma control. The development of fixed-dose combination inhalers that contain both a long-acting beta-2 agonist and an inhaled corticosteroid improves patient adherence, simplifies treatment regimens, and delivers consistent therapeutic benefit by targeting both inflammation and bronchoconstriction in asthma management. Psychological stress has a profound impact on asthma exacerbations, mediated through neuroendocrine pathways that affect immune system function, highlighting the need for integrated care approaches that address both psychological and physiological aspects of asthma to enhance disease management. Clinical trials investigating heat shock proteins in asthma reveal potential therapeutic targets, as these proteins modulate inflammation and protect against cellular damage, offering a novel angle in asthma treatment strategies aimed at reducing immune activation and asthma-associated tissue damage. Environmental control in asthma, especially in homes with allergic asthma patients, demands meticulous attention to allergen sources. Important interventions include the use of high-efficiency particulate air, HEPA, filters, frequent cleaning, and encasing mattresses to mitigate the allergen burden effectively. Inflammation resolution in asthma is a critical focus, where emerging therapies aim to foster pro-resolution lipid mediators like lipoxins and resolvins that actively terminate inflammatory responses, restoring airway homeostasis without compromising host defense mechanisms. The application of therapeutic phage therapy in asthma is under exploration, targeting bacterial infections associated with asthma exacerbations, where phages specifically lyse pathogenic bacteria, thus minimizing bacterial-induced inflammation and presenting a precision treatment modality with potential for personalization. Brain trauma, one of the most complex injuries in neuroscience, involves mechanical damage to brain tissue leading to primary injury and subsequent biochemical and molecular alterations termed secondary injury, which can exacerbate cellular and microvascular damage, potentially resulting in significant neuropsychological deficits and long-term disability if not promptly and effectively managed. Diffuse axonal injury, DI, common in traumatic brain injury, TBI, involves shearing forces that disrupt axonal connections, leading to profound neuropsychological impairment because the injury primarily occurs at the gray-white matter interface, which impairs critical communication networks within the brain. In brain trauma cases, the Glasgow Coma Scale, GCS, remains a vital clinical tool for assessing the level of consciousness. However, its limitations include insensitivity to subtle changes in neurological status and a reduced ability to predict long-term outcomes when used in isolation, emphasizing the need for adjunctive assessments. The cerebral edema that frequently follows brain trauma is the result of a complex interplay between cytotoxic, vasogenic, and interstitial processes, which can increase intracranial pressure and reduce cerebral perfusion, leading to a vicious cycle of ischemic injury and further neuronal damage. Post-traumatic epilepsy is a well-recognized complication of brain trauma, with its risk being influenced by factors such as the severity of the injury, the presence of contusions, and early post-traumatic seizures, necessitating careful long-term neurological monitoring and management to optimize outcomes. The concept of neuroplasticity, in the context of brain trauma, refers to the brain's remarkable ability to reorganize neural pathways, which is crucial during rehabilitation as it facilitates recovery of function by compensating for lost neuronal connections through innovative therapies like cognitive rehabilitation and task-specific training. 7. Biomarkers in brain trauma hold promising potential for revolutionizing diagnostic precision and prognostic assessments, as they can provide insights into the underlying pathophysiological processes, detect secondary injury paths, and guide targeted therapeutic strategies aimed at reducing neurological damage. Eight. Endocrine dysfunction following brain trauma, such as hypopituitarism, results from injury to the hypothalamic pituitary axis, leading to alterations in hormone levels that can affect metabolism, stress response, growth, and reproduction, necessitating comprehensive endocrine evaluation and management for optimal recovery and quality of life. 9. The use of hypothermia as a therapeutic intervention in brain trauma aims to mitigate secondary injury by reducing metabolic demands and suppressing deleterious biochemical cascades, although its efficacy is still under active investigation, with current evidence suggesting it may be beneficial in specific contexts and patient populations. Elevated levels of neuroinflammation, characterized by the activation of microglia and astrocytes, play a dual role in brain trauma, contributing to both the healing process and the propagation of secondary injury, which underscores the importance of targeting inflammatory pathways to modulate this response and improve outcomes. Intraoperative monitoring of intracranial pressure, ICP, in patients with severe brain trauma offers critical real-time data on cerebral hemodynamics, allowing surgical teams to make informed decisions about interventions that can prevent herniation and preserve neurological function by maintaining cerebral perfusion. Traumatic brain injury can lead to the phenomenon of brain-gut interactions, where the injury may precipitate gastrointestinal disturbances such as impaired motility or increased mucosal permeability, potentially exacerbating central nervous system inflammation through a bidirectional interaction involving the gut microbiome. The role of imaging techniques like diffusion tensor imaging, DTI, in evaluating brain trauma is increasingly recognized for its ability to detect microstructural changes in white matter tracts, providing insight into the degree of axonal damage and potentially guiding prognosis and tailored rehabilitation strategies. The blood-brain barrier's integrity is often compromised following brain trauma, which allows inflammatory mediators, immune cells, and neurotoxic substances to penetrate the central nervous system, exacerbating injury and necessitating research into strategies that can restore and protect barrier function. Secondary hemorrhagic transforms within cranial contusions add complexity to the management of brain trauma, as these developments can increase intracranial pressure and risk of further ischemic injury, often requiring careful monitoring and possibly surgical intervention to mitigate potential complications. The impact of age on brain trauma outcomes is significant, with younger patients exhibiting greater neuroplastic potential and recovery prospects, while older individuals face compounded risks due to age-related brain alterations and comorbidities, increasing the challenge of achieving favorable outcomes. Comorbid conditions such as hypertension or diabetes can magnify the consequences of brain trauma by predisposing individuals to cerebrovascular dysregulation and impaired metabolic responses, thus highlighting the importance of comprehensive risk management and control of these factors in affected patients. Nutrition plays a crucial role in brain trauma recovery, with early and adequate nutritional support being essential for maintaining metabolic balance, supporting immune function, and promoting neurorecovery, underlining the importance of integrating nutritional therapy into the holistic care approach for these patients. Traumatic brain injury often results in an acute hypercoagulable state, where the risk of thromboembolic complications increases due to alterations in coagulation pathways, necessitating the judicious use of anticoagulation therapy tailored to the individual patient's risk profile to prevent secondary complications. 20. Innovations in the management of brain trauma include the development of neuroprotective agents aimed at reducing oxidative stress and excitotoxicity, with research directed at compounds that can stabilize mitochondrial function and prevent the cascade of neuronal apoptosis being particularly promising. 21. The concept of a concussion spectrum of disorders captures the diversity and complexity of post-concussive symptoms arising from mild brain trauma, where patients may experience a range of cognitive, physical, and emotional symptoms that require individualized management strategies focused on gradual reintegration and rehabilitation. 22. Sleep disturbances, common following brain trauma, significantly impact recovery as they exacerbate fatigue, cognitive decline, and mood disorders. Thus, addressing sleep hygiene and, where necessary, pharmacological interventions are essential components of comprehensive brain injury management. 23. Rehabilitation after brain trauma focuses on the principle of neuroplasticity to encourage the re-establishment of neural connections, encompassing therapies like physical, occupational, and speech therapy tailored to the individual's specific needs, aimed at maximizing functional recovery and enhancing quality of life. 24. The catecholamine surge observed following acute brain trauma signifies a physiological stress response, potentially leading to systemic complications like hyperglycemia and cardiac arrhythmias, which healthcare providers must proactively manage to prevent exacerbation of the primary neurological injury. '25. Long-term cognitive outcomes after brain trauma are influenced by the initial severity of injury, extent of axonal damage, and the presence of post-traumatic complications, with emerging evidence suggesting that genetics and pre-existing mental health status also play significant roles in recovery trajectories. '26. Innovative assessment tools such as the Automated Neuropsychological Assessment Metrics, ANAM, are being developed to provide objective, computer-based evaluations of cognitive function in brain trauma patients, facilitating the early detection of cognitive deficits and informing rehabilitation strategies. '27. Technological advancements such as wearable sensors are being incorporated into brain trauma rehabilitation to enhance real-world monitoring of motor and cognitive activities, providing valuable feedback that guides therapeutic interventions and aids in tracking recovery progress in everyday environments. '28. The evolution of telemedicine is transforming the landscape of brain trauma care by increasing accessibility to specialists, enabling remote monitoring and consultations that ensure continuity of care, especially for patients in underserved or rural areas where access to specialized brain injury facilities is limited. '29. The complex interplay of genetic predisposition and environmental factors in brain trauma vulnerability and recovery suggests that personalized approaches incorporating genetic profiling and exposure history may enhance the precision of both preventative strategies and therapeutic interventions. '30. Research into blast-induced brain trauma as a distinct subset of traumatic brain injury highlights unique pathophysiological features such as primary blast wave impact and secondary barotrauma, necessitating specialized approaches for diagnosis, management, and long-term care tailored to the specific injury mechanism. '31. The role of neuroimaging in chronic traumatic encephalopathy, CTE, resulting from repeated brain trauma is evolving, with advanced modalities like positron emission tomography, PET, scans offering potential insights into tau deposition patterns that may herald new diagnostic and therapeutic frameworks. '32. Cognitive reserve, the brain's resilience to pathological damage, is a key factor in brain trauma outcomes, with individuals with higher cognitive reserve often showing better functional recovery, emphasizing the importance of educational and mentally stimulating activities as a form of protective intervention throughout life. 3.3. The risk of neurodegenerative diseases such as Alzheimer's or Parkinson's following brain trauma indicates that long-term surveillance and risk modification strategies are imperative in at-risk populations to potentially delay the onset or reduce the severity of these chronic conditions. '34. The development of brain organoids from stem cells provides a novel in vitro model for studying brain trauma, offering researchers an unprecedented opportunity to investigate the cellular and molecular mechanisms of injury and repair in a controlled laboratory environment that mimics human brain physiology. '35. Innovative rehabilitative techniques such as virtual reality, VR, are being harnessed in brain trauma therapy, offering immersive experiences that challenge cognitive and motor skills, engaging neural pathways in ways traditional therapies cannot, thus potentially accelerating the rehabilitation process. '36. Traumatic brain injury can disrupt the body's circadian rhythms, leading to a cascade of biological and behavioral changes such as altered sleep-wake cycles and hormone secretion, requiring interventions that aim to re-establish normal rhythmicity for overall well-being and recovery optimization. '37. Neuroendocrine regulation following brain trauma is critical, as dysregulation can result in significant clinical manifestations such as adrenal insufficiency or thyroid dysfunction, which necessitates vigilant hormonal monitoring and replacement therapy when indicated to support the patient's overall recovery. '38. Exploring the gut-brain axis in brain trauma highlights a pathway where changes in gut microbiota composition can influence central nervous system outcomes, with probiotics and dietary interventions potentially providing novel avenues to modulate secondary injury processes and support recovery. '39. The development of smart helmets, embedded with sensors, aims to revolutionize the prevention and immediate impact assessment of head injuries, providing real-time data on the magnitude and biomechanics of impacts that can inform immediate care and potential long-term risk evaluation. '40. The integration of artificial intelligence, AI, in brain trauma care leverages machine learning algorithms to predict outcomes based on a multitude of variables such as imaging findings, clinical data, and genetic information, enabling personalized treatment plans that optimize recovery and minimize complications. '41. Vascular changes after brain trauma, including the development of microthrombi and altered blood flow dynamics, play a crucial role in the progression of secondary brain injury, with research focusing on interventions that target endothelial function and blood-brain barrier repair to mitigate these effects. '42. Advances in understanding the role of exosomes, extracellular vesicles that facilitate cell communication, suggest that they could be harnessed to deliver therapeutic molecules to injured brain tissue, offering a novel strategy for repairing neuronal networks and reducing the impact of traumatic injuries. '43. Post-traumatic amnesia, a common symptom following brain trauma, reflects a transient disruption in anterograde and retrograde memory processing, and its duration can provide critical prognostic information regarding the severity of the injury and expected recovery timeline. '44. Children and adolescents with brain trauma require specially adapted management protocols, as their developing brains and distinct physiological responses necessitate tailored approaches in both acute care and rehabilitation to promote favorable neurodevelopmental outcomes. '45. Innovations in pharmacogenomics offer the potential to tailor drug treatments after brain trauma according to individual genetic profiles, optimizing efficacy and minimizing adverse effects, and opening new frontiers in personalized medicine for these complex injuries. '46. The role of early mobilization in brain trauma recovery is gaining attention as evidence supports that gradual activity resumption, under careful monitoring, can promote neuroplasticity, prevent complications from prolonged immobility, and support the physical and cognitive recovery of the patient. '47. Cognitive behavioral therapy, CBT, is proving to be a valuable adjunctive treatment for managing the psychological sequelae of brain trauma, addressing issues such as anxiety, depression, and cognitive distortions, which are common barriers to full functional recovery. 48. Emerging research into the role of mitochondrial dysfunction in brain trauma suggests that targeting these organelles to enhance bioenergetics and reduce oxidative stress could offer new therapeutic pathways to ameliorate secondary neuronal damage. '49. The development of advanced neuromonitoring techniques, such as near-infrared spectroscopy, NIRS, offers non-invasive means to assess cerebral oxygenation in real time, providing crucial information that could guide interventions during the critical phases of brain trauma management. '50. Brain trauma significantly affects emotional regulation, leading to challenges such as irritability or emotional blunting, which require integrated management strategies involving psychotherapy, pharmacotherapy, and family education to ensure holistic recovery and reintegration into daily life. 1. Ischemic heart disease, often stemming from atherosclerosis, occurs when there's an imbalance between myocardial oxygen supply and demand, usually due to reduced blood flow through the coronary arteries, ultimately leading to chest pain or more severe complications like myocardial infarction, especially if left untreated and in the presence of risk factors such as hypertension, smoking, dyslipidemia, and diabetes. 2. Diagnosis of ischemic heart disease often involves a combination of patient history, physical examination, electrocardiography to detect street segment changes, and imaging techniques like stress echocardiography or coronary angiography to visually assess blood flow restrictions or blockages in the coronary arteries. 3. A pivotal aspect of treating ischemic heart disease is lifestyle modification, including smoking cessation, a heart-healthy diet rich in fruits, vegetables, lean proteins, and whole grains, regular physical activity, and weight management, often complemented by pharmacologic therapy to manage cholesterol, blood pressure, and blood sugar levels. 4. Common medications used in the management of ischemic heart disease include antiplatelet agents like aspirin, which help prevent clot formation, beta blockers which reduce myocardial oxygen demand by decreasing heart rate, and statins to lower cholesterol levels, thus slowing the progression of atherosclerosis. 5. Percutaneous coronary intervention, PCI, commonly known as angioplasty, is a cornerstone procedure for treating certain cases of ischemic heart disease, entailing the insertion of a balloon catheter to widen narrowed arteries, often followed by the placement of a stent to maintain vessel patency and avert restenosis. 6. Coronary artery bypass grafting, CABG, is a surgical method used to treat severe ischemic heart disease, where one or more blocked coronary arteries are bypassed using vessels harvested from other parts of the body, thus allowing blood to flow around the blockage and improve myocardial oxygen supply. 7. Pathophysiologically, ischemic heart disease can lead to a cascade of events starting with endothelial dysfunction, increased oxidative stress, inflammatory responses, plaque formation and instability, culminating in acute coronary syndromes if a plaque ruptures and obstructs blood flow to cardiac tissue. 8. The pathogenesis of ischemic heart disease is intricately linked with systemic inflammation, in which inflammatory markers such as C-reactive protein elevate, indicating a heightened state of immune activation that contributes to the development and progression of atherosclerotic plaques within coronary arteries. 9. In ischemic heart disease, stable angina is characterized by predictable chest pain or discomfort, often triggered by physical exertion or emotional stress, which is usually relieved by rest or nitroglycerin, signifying a temporary mismatch between oxygen supply and demand within the heart muscle. Unstable angina, a component of acute coronary syndromes, involves new or worsening chest pain that occurs at rest or with minimal exertion, and differs from stable angina by reflecting a more significant and potentially life-threatening reduction in coronary blood flow, often necessitating urgent medical evaluation and intervention. 11. Silent ischemia refers to episodes of myocardial ischemia that occur in the absence of overt symptoms like chest pain, detectable through electrocardiographic changes, and poses a diagnostic challenge in ischemic heart disease, being particularly prevalent in diabetic patients due to autonomic neuropathy blunting typical pain responses. 12. Left ventricular dysfunction is a significant consequence of chronic ischemic heart disease, where sustained inadequate blood supply results in impaired cardiac contractility and ejection fraction, leading to symptoms of heart failure such as dyspnea, fatigue, and peripheral edema, requiring diligent monitoring and management. 13. Myocardial infarction, a severe manifestation of ischemic heart disease, occurs when one or more coronary arteries become completely obstructed, leading to irreversible myocardial necrosis unless prompt restoration of blood flow is achieved, often accompanied by symptoms such as crushing chest pain, diaphoresis, and nausea. 14. Pre-infarction angina, also known as crescendo angina, serves as a warning sign of impending myocardial infarction, manifesting as an increase in frequency, intensity, or duration of angina episodes, thus demanding immediate medical evaluation to prevent progression to a full-blown heart attack. 15. In ischemic heart disease, the principle of coronary steal phenomenon refers to a paradoxical worsening of ischemia in areas of collateral circulation when blood flow is diverted away by dilation of vessels supplying nearby well-perfused territories, often observed during certain pharmacological stress tests. 16. The term ischemic cascade is employed to describe the sequential pathophysiological events during myocardial ischemia, which begin with metabolic alterations, followed by diastolic and systolic dysfunction, electrocardiographic changes, and finally the onset of chest pain if ischemia is not relieved. 17. Cardiac rehabilitation is a critical component of the long-term management of ischemic heart disease, incorporating structured exercise programs, education on heart-healthy living, psychological support, and risk factor modification to improve cardiovascular health, enhance quality of life, and reduce the likelihood of future cardiac events. 18. Anomalous coronary artery origin, though rare, is a congenital defect that can predispose individuals to ischemic heart events, particularly young and otherwise healthy patients, due to abnormal positioning of coronary arteries leading to compromised myocardial perfusion, especially during exercise. 19. Variant angina, also known as Prinzmetal's angina, is a form of ischemic heart disease characterized by episodic chest pain at rest due to coronary artery vasospasm, with episodes often occurring at night or in a cyclical pattern, and typically responsive to calcium channel blockers or nitrates. 20. Genetic predisposition plays a role in ischemic heart disease. Microvascular angina, sometimes termed Syndrome X, involves chest pain resulting from dysfunction of the small coronary vessels which may not show obstructions on angiography, necessitating alternative diagnostic tests such as stress MRI or PET for evaluation of microvascular function. 22. Thrombolytic therapy, a key treatment in the early management of acute myocardial infarction due to ischemic heart disease, involves administering medication like tissue plasminogen activator, TPA, to dissolve blood clots in coronary arteries, restoring perfusion and minimizing myocardial damage if administered timely. 23. Aspirin resistance, a phenomenon where patients with ischemic heart disease do not respond adequately to aspirin's antiplatelet effects, can result in suboptimal prevention of thrombotic events, necessitating the use of alternative or additional antiplatelet agents like clopidogrel to effectively reduce cardiovascular risk. 24. Ischemic preconditioning is a fascinating protective mechanism in ischemic heart disease, where short cycles of non-lethal ischemia render the myocardium more resistant to subsequent ischemic insults, potentially offering insights into novel therapeutic strategies aiming at ischemic tolerance enhancement. 25. Chronic total occlusion in ischemic heart disease refers to a completely blocked coronary artery persisting for more than 3 months, presenting a complex therapeutic challenge, often addressed with advanced percutaneous techniques or surgical revascularization depending on the patient's symptoms and anatomy. 26. The pathophysiology of ischemic heart disease involves oxidative stress, whereby excess reactive oxygen species generation in the myocardium contributes to endothelial dysfunction and inflammatory processes that exacerbate atherosclerosis, myocardial injury, and arrhythmogenic potential. 27. Glycocalyx disruption is an emerging focus in ischemic heart disease research, where the degradation of this delicate endothelial surface layer, composed of proteoglycans and glycoproteins, plays a crucial role in vascular homeostasis, contributing to increased leukocyte adhesion, platelet aggregation, and endothelial dysfunction. 28. Heart rate variability in ischemic heart disease is considered an important prognostic marker, where reduced variability can indicate impaired autonomic regulation, predicting increased likelihood of adverse cardiac events, underlining the significance of assessing heart rate dynamics in risk stratification. 29. In ischemic heart disease, the no-reflow phenomenon describes a situation where, despite successful opening of an occluded artery, inadequate microvascular associated with microvascular injury and endothelial dysfunction. 30. The concept of hibernating myocardium in ischemic heart disease reflects a state where chronic ischemia leads to adaptive myocardial downregulation in contractile function to preserve viability, often reversible upon revascularization, highlighting the importance of accurate assessment in chronic ischemia cases. 31. In ischemic heart disease, the ischemia-reperfusion injury paradoxically exacerbates myocardial damage upon restoration of blood flow after a period of ischemia, through mechanisms involving oxidative stress, calcium overload, and activation of inflammatory pathways, necessitating exploration of therapeutic interventions to mitigate such injury. 32. Central to ischemic heart disease is the phenomenon of positive remodeling, wherein coronary artery walls expand outwardly, maintaining lumen size despite significant atherosclerosis and often delaying the onset of symptomatic ischemia until later stages, posing challenges in early disease detection. 3. In the context of ischemic heart disease, endothelial progenitor cells and their regenerative capacity have been studied for their potential to repair damaged endothelium and promote vascular health, offering avenues for innovative treatments aimed at enhancing endogenous repair mechanisms. 34. Plaque vulnerability in ischemic heart disease refers to the propensity of atherosclerotic plaques to rupture, often due to a thin fibrous cap, large lipid core, and active inflammation, which can lead to acute coronary syndromes, stressing the importance of therapeutic strategies that stabilize vulnerable plaques. 35. Metabolic syndrome, characterized by a cluster of risk factors including abdominal obesity, insulin resistance, hypertension, and dyslipidemia, significantly heightens the risk of developing ischemic heart disease, necessitating comprehensive management of all contributing components to reduce cardiovascular event likelihood. (36) Stress testing in ischemic heart disease, typically performed with exercise or pharmacologic agents, helps assess myocardial perfusion and presence of ischemia by monitoring electrocardiographic changes, symptoms, and sometimes imaging, aiding diagnosis and guiding treatment planning. 37. In ischemic heart disease, lipoprotein A is an independent risk factor, its structure and function resembling that of LDL with a unique apolipoprotein, A moiety, promoting atherogenesis and thrombosis through mechanisms still being elucidated, yet considered in high-risk cardiovascular profiles. (38) Genetic variations influencing nitric oxide synthase function may contribute to ischemic heart disease risk, as nitric oxide is a critical endothelium-derived vasodilator involved in maintaining vascular tone, with dysfunction predisposing to endothelial damage, atherosclerosis, and subsequent ischemic events. (39) A crucial factor in ischemic heart disease management is the timely identification and treatment of peripheral artery disease, often concomitant due to shared pathophysiologic mechanisms, as it can aggravate cardiac ischemia and elevate the risk of coronary events, necessitating comprehensive vascular assessment. (40) The J-curve concept in ischemic heart disease refers to the observation that both excessively high and very low blood pressure values may increase cardiovascular risk, emphasizing the necessity of achieving an optimal blood pressure range through individualized therapy to balance benefits and potential harms. (41) Inverse care law in ischemic heart disease highlights the discrepancy between healthcare need and provision, where those with greatest necessity often receive the least effective care, underscoring ethical imperatives to rectify access inequalities and ensure equitable delivery of cardiovascular services. (42) Myxomatous degeneration, while primarily associated with mitral valve prolapse, can have implications in ischemic heart disease as it may contribute to hemodynamic abnormalities, and its presence in the cardiac valves indicates underlying connective tissue disorders that may coexist with coronary pathologies. (43) In ischemic heart disease, cardiogenic shock represents a life-threatening condition arising from inadequate tissue perfusion due to severely compromised cardiac output, often following a large myocardial infarction, mandating aggressive hemodynamic support and prompt revascularization efforts. (44) Hyperhomocystinemia is recognized as a modifiable risk factor for ischemic heart disease, linked to endothelial dysfunction and atherogenesis, with therapeutic measures focusing on vitamin supplementation, particularly folic acid, to lower plasma homocysteine levels and mitigate associated cardiac risk. (45) The ischemic threshold, pertaining to ischemic heart disease, denotes the specific level of physical or emotional exertion that provokes ischemia, potentially varying with underlying plaque burden or myocardial demand, guiding management efforts to curtail activities surpassing this critical boundary. (46) In ischemic heart disease, endothelin-1, a potent vasoconstrictor peptide produced by endothelial cells, plays a challenging role in pathophysiology by exacerbating ischemic episodes through increased vascular tone and promoting atherogenesis, thus serving as a possible therapeutic target for mitigation of ischemic insults. (47) Coronary artery anomalies, although rare, can predispose individuals to ischemic heart disease by altering normal blood flow patterns, and are particularly significant in young athletes who may experience sudden cardiac events during high-intensity activities, necessitating careful evaluation. 48. Mental stress-induced myocardial ischemia highlights a non-traditional component of ischemic heart disease, where psychological stress triggers coronary vasoconstriction and compromised myocardial perfusion, with potential contributions to adverse cardiac events, advocating for stress management interventions. '49. Cardiovascular magnetic resonance imaging, CMR, has emerged as an invaluable tool in ischemic heart disease, providing detailed anatomical and functional evaluations of myocardial perfusion and viability, offering insights beyond traditional imaging techniques, and aiding in nuanced diagnosis. '50. Selenium deficiency has been implicated in ischemic heart disease, given its role as a crucial cofactor for antioxidant enzymes, with deficiency exacerbating oxidative stress and endothelial dysfunction, suggesting a potential benefit from selenium supplementation in cases of low dietary intake. '1. Brain tumors, particularly gliomas, can disrupt the blood-brain barrier, altering its permeability and potentially making the brain environment more susceptible to the influx of macromolecules and peripheral inflammatory cells, which can exacerbate cerebral edema and influence the tumor's microenvironment, requiring tailored therapeutic strategies to manage these effects alongside the primary treatment. '2. The distinction between primary and secondary brain tumors is critical, as primary brain tumors originate within the brain itself and may include glioblastomas or meningiomas, while secondary brain tumors, or brain metastasis, result from cancer spreading from another part of the body, such as the lungs, emphasizing the need for comprehensive systemic cancer management. '3. Advances in neuroimaging, including functional MRI and PET scans, enable not only the precise localization of brain tumors but also the assessment of tumor metabolism and potential malignancy, thereby refining preoperative planning and post-treatment monitoring, which enhances surgical outcomes and minimizes damage to critical brain areas. '4. The application of precision medicine in the treatment of brain tumors involves utilizing genetic and molecular profiling of tumors, which allows clinicians to tailor therapies based on specific mutations, such as IDH1 and IDH2 in gliomas, potentially improving response rates and minimizing unnecessary exposure to broader chemotherapeutic agents. '5. Tumor Treating Fields, TT fields, are an innovative non-invasive treatment modality for glioblastoma that employs alternating electric fields to disrupt cancer cell division by targeting the meiotic spindle, offering an additional therapeutic option that can be combined with surgery, radiation, and chemotherapy for comprehensive multimodal treatment. '6. The role of the tumor microenvironment in brain tumor pathophysiology is significant, with components such as hypoxia, immune cell infiltration, and extracellular matrix modulation influencing tumor growth, angiogenesis, and resistance to therapy, making it a focal area for developing novel therapeutic agents that can alter these pathways. '7. The utilization of stereotactic radiosurgery, SRS, such as Gamma Knife or CyberKnife, provides a highly precise irradiation method that delivers concentrated doses to brain tumors while sparing surrounding healthy tissue, making it particularly beneficial for small to medium-sized tumors or those located in surgically challenging areas. '8. Brain tumors can cause neurocognitive deficits, including memory impairment and executive dysfunction, due to direct neural disruption and indirect effects of treatments such as radiation and chemotherapy, necessitating cognitive evaluations and rehabilitation programs as integral components of comprehensive patient management. '9. The growing field of oncolytic virotherapy explores the use of genetically engineered viruses to selectively infect and kill brain tumor cells while sparing healthy cells, combining direct oncolytic effects with immune-mediated tumor suppression, holding promise as a novel approach especially in immunoresponsive tumors. 10. Dexamethasone is commonly utilized in brain tumor management to reduce vasogenic edema and improve neurological symptoms by decreasing capillary permeability and stabilizing the blood-brain barrier, yet its long-term use requires careful monitoring for side effects such as hyperglycemia and immunosuppression. Bevacizumab, an anti-angiogenic monoclonal antibody targeting vascular endothelial growth factor, VEGF, is utilized in recurrent glioblastoma to hinder abnormal blood vessel formation, thereby reducing tumor vascularity and edema, although its use requires consideration of potential adverse effects and the development of resistance. Neuro-oncology has witnessed the promising advancement of immunotherapy, including checkpoint inhibitors and CAR T-cell therapies, that harness the body's immune system to recognize and eradicate tumor cells, although challenges remain in overcoming the immunosuppressive environment inherent to brain tumors. The integration of artificial intelligence in brain tumor diagnosis allows for the automation and enhancement of imaging interpretation through machine learning algorithms, improving accuracy and consistency in identifying tumor characteristics, predicting outcomes, and aiding in the early detection of subtle tumor changes. Enhancing the delivery of chemotherapeutic agents in brain tumor therapy involves various strategies, such as the development of nanoparticles and liposomal formulations, which can cross the blood-brain barrier more effectively, increase drug concentrations at the tumor site, and reduce systemic toxicity. In molecular pathology, the detection of 1p19q co-deletion in oligodendrogliomas not only serves as an essential diagnostic marker distinguishing them from other types but also indicates a favorable response to chemotherapy, highlighting the necessity of genetic testing in establishing a precise diagnosis and treatment plan. Diffusion tensor imaging, DTI, is a specialized MRI technique that enables visualization and mapping of white matter tracts in the brain, assisting neurosurgeons in assessing tumor infiltration and preserving vital neural pathways during surgical resection, thus optimizing functional outcomes for patients. Chordomas, rare malignant tumors arising from embryonic notochord remnants, predominantly occur at the skull base or spinal column and require meticulous surgical excision, often followed by proton beam therapy for radiation-sensitive tissues, underscoring the need for specialized multidisciplinary care. Seizures are commonly associated symptoms in patients with brain tumors due to epileptogenic changes within the cerebral cortex, often managed with anti-epileptic drugs such as levetiracetam, although careful titration and monitoring are necessary to avoid adverse effects and interactions with other cancer therapies. The discovery of EGFR mutations and amplifications in certain glioblastomas has opened avenues for targeted therapies using tyrosine kinase inhibitors, although resistance mechanisms and heterogeneity within tumors present ongoing challenges that require the development of combination therapeutic strategies. The blood-brain barrier, BBB, poses a significant obstacle in the delivery of effective chemotherapy for brain tumors, prompting research into methods to transiently and safely disrupt the BBB using focused ultrasound or osmotic agents without compromising the protection it affords the central nervous system. Understanding the progression of brain tumors from low-grade to high-grade malignancies is crucial, as it often involves distinct molecular pathways and genetic alterations, necessitating vigilant monitoring and potential intervention to halt or delay malignant transformation and improve long-term outcomes. Integrating palliative care early in the treatment of brain tumors focuses on optimizing quality of life by addressing symptoms, psychosocial support, and patient and family education, ensuring that holistic care is provided alongside curative or life-prolonging treatments for a balanced approach to the disease. 23. Tumor heterogeneity within brain tumors contributes to variable responses to treatment and recurrence rates, emphasizing the importance of obtaining tissue biopsies from multiple tumor areas and employing comprehensive genomic profiling to guide personalized therapeutic interventions effectively. 24. The incidence of pituitary adenoma, generally benign tumors, can lead to hormonal imbalances and pressure effects on nearby structures such as the optic chiasm, requiring a combination of endocrinological management and surgical intervention via transsphenoidal resection when indicated. 25. Optic gliomas, associated with neurofibromatosis type 1, can lead to progressive visual loss in children and are managed through a combination of observation, chemotherapy, and in some cases, radiation therapy, with ongoing research into targeted molecular treatments aimed at preserving vision and stabilizing tumor growth. 26. Recognizing the signs and symptoms of increased intracranial pressure, such as headache, nausea, and papilledema, is vital in patients with brain tumors, prompting immediate intervention with measures like shunt placement or craniotomy to relieve pressure and prevent further neurological deterioration. 27. Novel techniques in intraoperative visualization and navigation, such as intraoperative MRI and fluorescence-guided tumor resection, allowing surgeons to distinguish neoplastic tissue more reliably, thereby improving surgical margins and patient outcomes. 28. Studying the role of microRNAs in brain tumor biology has unveiled their functions in regulating gene expression, tumor growth, and metastasis, paving the way for therapeutic targeting of these small non-coding RNAs to disrupt oncogenic pathways and improve the efficacy of existing treatments. 29. The exploration of epigenetic modifications, such as DNA methylation and histone acetylation, in brain tumors has revealed their influence on gene expression and tumor behavior, leading to the potential for developing epigenetic drugs that can reverse aberrant changes and restore normal cellular functions. 30. The prognostic significance of MGMT promoter methylation in glioblastoma lies in its correlation with improved response to alkylating agents like temozolomide, offering insight into personalized treatment planning and highlighting the critical role of molecular profiling in guiding therapeutic decisions. Cerebellar tumors, such as medulloblastomas, primarily affecting children, can disrupt coordination and balance, requiring a combination of surgical resection, craniospinal irradiation, and chemotherapy, with ongoing research into molecular subtyping aiming to optimize treatment strategies and reduce long-term side effects. Unveiling the potential of chimeric antigen receptor (CAR) T-cell therapy for targeting specific antigens expressed on brain tumors represents a promising frontier, but challenges remain in ensuring T-cell penetration into the central nervous system and sustaining durable responses in patients. Assessment of tumor-associated epilepsy in brain tumor patients involves distinguishing between seizure types and understanding the complex relationship between epileptogenic networks and tumor pathology, highlighting the necessity for individualized anti-epileptic regimens and neurosurgical consultation when refractory seizures persist. Recognizing the role of neuroinflammation in the progression and treatment resistance of brain tumors opens avenues for therapeutic targeting of inflammatory pathways, with agents such as COX-2 inhibitors and immune modulators being explored for potential anti-tumor efficacy and symptom relief. Pseudoprogression in brain tumor imaging, often seen after radiation therapy and characterized by transient inflammatory changes rather than true tumor growth, poses diagnostic challenges requiring differentiation from actual progression through serial imaging studies and potentially utilizing advanced metabolic imaging techniques. Ethical considerations in brain tumor clinical trials encompass informed consent, balancing innovation with patient safety, and equitable access to experimental treatments, necessitating robust ethical frameworks and communication strategies to ensure patients and families make informed decisions regarding participation. (37) Managing the neurocognitive side effects of radiation therapy for brain tumors involves implementing strategies such as hippocampal sparing techniques, cognitive rehabilitation, and pharmacological interventions aimed at reducing the risk of long-term intellectual impairment and ensuring sustained quality of life. (38) The potential use of ketogenic diets in brain tumor management explores the hypothesis that reducing glucose availability may affect tumor metabolism and growth, although this requires rigorous clinical investigation to verify efficacy and ensure safety in combination with standard oncological treatments. (39) Glioma stem cells are implicated in tumor recurrence and resistance to therapy, highlighting the importance of targeting these cells specifically with treatments that can impede their self-renewal and differentiation capabilities, thereby improving long-term control and patient prognosis. (40) The exploration of biomarkers, such as circulating tumor DNA, ctDNA, in the blood of brain tumor patients, offers a non-invasive method for monitoring disease status, treatment response, and early detection of relapse, providing a valuable tool for precision medicine approaches in neuro-oncology. (41) Neurofibromatosis type 2, NF2, is characterized by the development of multiple nervous system tumors, including schwannomas and meningiomas, requiring vigilant surveillance and, when necessary, intervention with surgery or newer medical therapies such as VEGF inhibitors to manage tumor growth and maintain neurological function. (42) Differentiating between tumor recurrence and radiation necrosis in brain cancer patients involves evaluating clinical presentation and employing advanced imaging modalities such as perfusion MRI or PET scans, aiding in determining the appropriate management pathway and avoiding unnecessary interventions. (43) Innovative surgical techniques in skull-base tumor resection, utilizing endoscopic approaches, allow for minimally invasive access to complex regions while reducing patient morbidity, emphasizing the critical role of specialized multidisciplinary teams in achieving optimal surgical outcomes and preserving neurological function. (44) The neuropeptide Y, NPY, receptor system has been implicated in brain tumor growth and angiogenesis, presenting a potential target for therapeutic intervention with antagonists designed to disrupt these pathways and complement existing treatments aimed at brain tumor control. (45) Olfactory neuroblastomas, originating in the nasal cavity extending into the brain, demand a multidisciplinary approach involving surgery, radiation, and sometimes chemotherapy, highlighting the complexities and importance of specialized care in managing these rare and challenging tumors. (46) Understanding the epidemiology and risk factors associated with brain tumors, including genetic predispositions and environmental exposures, provides essential insights for public health strategies aimed at early detection, prevention, and improved patient education on potential risks and symptoms. (47) The intricate relationship between neural stem cells and brain tumor development suggests potential strategies for therapeutic targeting, as alterations in stem cell regulatory pathways may contribute to tumorigenicity, requiring an understanding of stem cell biology in the context of oncogenesis and therapy. (48) Intracranial germ cell tumors, though rare, often present in pediatric patients and typically respond well to chemotherapy and radiation, depending on the type and location, underscoring the need for age-appropriate treatment protocols and long-term follow-up to monitor for potential late effects. 49. The role of metabolic reprogramming in brain tumor cells includes alterations in glucose and lipid metabolism to support rapid growth and survival, providing a potential target for novel therapies aimed at disrupting these pathways to reduce tumor proliferation and enhance treatment efficacy. 50. Exploring the potential of biodegradable polymer implants delivering localized chemotherapy directly to the site of brain tumor resection offers a method to maximize drug delivery while minimizing systemic toxicity, demonstrating a novel approach in the quest to improve patient outcomes and quality of life post-surgery. One. Cardiac arrhythmias, often resulting from disruptions in the heart's electrical conduction system, can lead to symptoms such as palpitations, dizziness, and syncope, while potentially increasing the risk for more serious conditions like stroke and heart failure. Hence, understanding the complexities of atrial and ventricular arrhythmias is crucial for effective clinical management. 2. Diagnosing cardiac arrhythmias often involves the use of electrocardiograms, ECGs, as a primary tool, where healthcare providers analyze the electrical activity of the heart through P, QRS, and T waves, which can reveal patterns indicative of atrial fibrillation, tachycardia, or other arrhythmic conditions. 3. Although antiarrhythmic drugs like amiodarone, beta blockers, and calcium channel blockers are integral to the medical management of various cardiac arrhythmias, they come with their own set of pharmacokinetic challenges and side effects, necessitating careful patient monitoring and individualized treatment plans. 4. Atrial fibrillation, one of the most common types of arrhythmias, is characterized by rapid and irregular beating of the atria and is often associated with an increased risk of thromboembolic events, which calls for anticoagulation strategies in addition to rhythm or rate control therapies. 5. The pathophysiology of ventricular arrhythmias can involve abnormalities in ion channel functioning within myocardial cells, leading to conditions such as ventricular tachycardia or fibrillation, which are particularly serious due to their potential to precipitate sudden cardiac arrest. 6. Holter monitoring, which involves continuous ECG recording typically over 24 to 48 hours, is a valuable diagnostic method for identifying transient arrhythmic episodes that may not be captured during a standard ECG test in a clinical setting. 7. In certain cases of refractory arrhythmias or when medical management is insufficient, catheter ablation procedures might be considered. These involve the targeted destruction of arrhythmic foci within the heart tissue via radiofrequency or cryoablation techniques, aiming to restore normal cardiac rhythm. 8. Breach of cellular homeostasis and calcium ion handling in cardiomyocytes can contribute to arrhythmic phenomena, highlighting the importance of calcium channel function in maintaining proper myocardial contraction and electrical stability, often factored into pharmacotherapeutic interventions. 9. Genetic predispositions, sometimes linked to inherited channelopathies such as long QT syndrome or Brugada syndrome, can underpin the development of arrhythmias, indicating the need for genetic counseling and screening in at-risk populations to guide preventive and therapeutic strategies. 10. Cardiac arrhythmias in the context of ischemic heart disease can arise from scarring and fibrosis post-myocardial infarction, which disrupts electrical conduction pathways, thereby necessitating not only direct arrhythmia management but also comprehensive cardiovascular care to mitigate underlying ischemic burden. 11. Lifestyle factors such as excessive caffeine or alcohol consumption, smoking, and stress can exacerbate or trigger arrhythmic episodes, suggesting that a holistic approach to arrhythmia management must include patient education and lifestyle modifications alongside medical interventions. 12. The occurrence of arrhythmias during pregnancy presents unique clinical challenges due to physiologic changes and the need to consider fetal health, often requiring collaborative multidisciplinary care to address rhythm disturbances while minimizing risks to mother and child. For individuals experiencing symptomatic bradyarrhythmias, potentially due to sinus node dysfunction or atrioventricular block, implantation of a pacemaker can provide effective rhythm management, thereby alleviating symptoms and reducing the risk of complications associated with low heart rates. Unlike mere heart rate increase or decrease, arrhythmias involve the intricate disturbance of the heart's electrical impulses, necessitating attentive risk factor stratification and patient-specific treatment protocols, considering the vast array of underlying etiological mechanisms in each case. A comprehensive history and physical examination remain pivotal in the initial assessment of patients presenting with suspected arrhythmias, for symptoms such as palpitations, fatigue, or dyspnea can stem from a vast differential diagnosis, thereby helping clinicians to triage and guide further investigations efficiently. The role of the autonomic nervous system in modulating cardiac rhythms is significant, where imbalances in sympathetic and parasympathetic tone can precipitate arrhythmic events. Clinical interventions sometimes involve modulation of autonomic inputs to stabilize cardiac function. Antiarrhythmic drug therapy carries potential proarrhythmic risk, necessitating diligent monitoring for QT interval prolongation or other adverse effects, especially in drugs that alter ion channels, underscoring the complexity of striking a balance between therapeutic benefits and possible toxicities. Emerging non-invasive technologies like wearable ECG monitors provide continuous cardiac rhythm surveillance, empowering patients with real-time insights and facilitating early detection of arrhythmic phenomena outside of traditional clinical environments, fostering proactive management. Pathological hypertrophy and dilation of cardiac chambers, often seen in conditions such as left ventricular hypertrophy or cardiomyopathies, can induce arrhythmic electrical conduction, highlighting the intersection between structural myocardial changes and electrophysiological disturbance. Psychoemotional factors, including anxiety and depression, have been noted to influence the presentation and perceived burden of arrhythmias, thereby requiring a biopsychosocial model of care that integrates mental health support in managing patients with cardiac arrhythmias. The electrophysiological study, EPS, serves as a cornerstone diagnostic tool for elucidating the mechanisms of arrhythmias, whereby intracardiac electrode catheters help in mapping the heart's electrical activity and understanding specific arrhythmic circuits for targeted therapeutic decisions. The electrophysiology of the cardiac conduction system involves synchronized depolarization and repolarization events, with the sinoatrial and atrioventricular nodes playing critical roles. Disruptions here can result in inefficient cardiac cycles and highlight areas of potential electrophysiological intervention. Structural heart conditions such as valvular diseases may predispose patients to arrhythmias due to resultant atrial enlargement and pressure overload, demonstrating the interconnected nature of mechanical and electrical heart dynamics in arrhythmogenesis. Synchronization of ventricular contraction and improved hemodynamics are the goals of cardiac resynchronization therapy, CRT, used in select cases of heart failure with arrhythmias where biventricular pacing can dissolve dysynchrony and ameliorate symptoms. Pediatric arrhythmias demand careful consideration, as they may manifest differently than in adults, with common etiologies including congenital heart defects or genetic syndromes, necessitating age-appropriate diagnostic and therapeutic approaches tailored to the developmental context. 26. The intricate anatomy of the cardiac conduction system, involving specialized pathways through the atrioventricular node and Purkinje fibers, underpins its vulnerability to disturbances, where even minor alterations in anatomy or physiology can have significant arrhythmic consequences. 27. The multifactorial etiology of arrhythmias often includes electrolyte imbalances such as hypokalemia or hypercalcemia, underscoring the importance of maintaining adequate electrolyte homeostasis in both prevention and treatment regimens for cardiac rhythm disturbances. Lifestyle interventions, such as the beneficial effects in reducing the incidence of certain arrhythmias, promoting autonomic balance and cardiac fitness, when duly tailored to individual patient capabilities and risk profiles. The risk stratification for sudden cardiac death in individuals with potentially malignant arrhythmias involves assessing factors such as ejection fraction, presence of syncope, and familial history, guiding decisions on the appropriateness of implantable cardioverter defibrillators as prophylactic measures. Cardiac imaging techniques, including echocardiography and cardiac MRI, illuminate structural and functional status, providing essential information to correlate anatomical findings with arrhythmic potential, vital for comprehensive arrhythmia care planning. The pathogenesis of arrhythmias can sometimes be attributed to inflammatory processes, as observed in conditions like myocarditis or cardiac sarcoidosis, where inflammation-induced scarring can alter conductive pathways, necessitating both anti-inflammatory and rhythm management strategies. Clinical innovations, such as the development of bioengineered cardiac tissue grafts, hold promise for repairing arrhythmic substrates by restoring normal myocardial architecture and electrical continuity, offering a glimpse into future regenerative therapies for arrhythmia management. Polymorphic ventricular tachycardia, often associated with electrolyte disturbances or ischemic insult, typifies the diversity within arrhythmias, necessitating nuanced understanding and management approaches, including correction of precipitating conditions and pharmacological stabilization. The potential for asymptomatic arrhythmias to progress undetected adds an element of unpredictability to their management, emphasizing the value of regular cardiac evaluations, especially in high-risk populations, to mitigate possible adverse outcomes through proactive surveillance. The utilization of implantable loop recorders extends diagnostic capabilities over extended periods, capturing sporadic arrhythmic events that might otherwise go undiagnosed, enhancing the diagnostic yield in patients presenting with unexplained syncope or palpitations. Paroxysmal supraventricular tachycardia, PSVT, arises from reentrant circuits within the atria or atrioventricular node, often requiring acute interventions such as vagal maneuvers or adenosine administration, alongside long-term consideration of pharmacological or ablative strategies for persistent cases. The advent of telemedicine and virtual arrhythmia clinics has augmented patient access to specialized cardiac care, allowing remote consultations and monitoring that adapt to patient needs, optimizing management and follow-up in the evolving landscape of digital healthcare. Wolff-Parkinson-White syndrome, a pre-excitation disorder characterized by the presence of an accessory pathway, manifests in tachyarrhythmias due to abnormal electrical conduction, underscoring the importance of accurate ECG interpretation and patient-specific intervention planning. Not all arrhythmias convey the same clinical significance, with distinctions existing between benign ectopic beats and life-threatening tachyarrhythmias, thus imposing the need for differential diagnosis in the context of patient symptoms and overall cardiovascular risk. 40. Environmental factors, such as exposure to certain toxins or medications that prolong the QT interval, can precipitate arrhythmic events, necessitating awareness and mitigation strategies in both clinical and occupational contexts to prevent potential cardiac complications. Cardiac arrhythmias present gender-specific prevalence and risk factors, as hormonal influences and genetic predispositions may differ, warranting consideration of gender in both the research and clinical management paradigms of arrhythmic disorders. Technology-driven advancements in algorithms for arrhythmia detection leverage artificial intelligence to enhance the precision of diagnostic tools, transforming the landscape of non-invasive arrhythmia screening with the potential to improve early detection and intervention outcomes. The therapeutic landscape for arrhythmias continues to evolve with approaches such as gene therapy, targeting underlying molecular defects in inherited arrhythmogenic disorders, offering a frontier in personalized medicine that reaches beyond symptom control to address disease at its genetic root. Emotionally induced arrhythmias exemplify the direct link between mind and heart, where stress can precipitate acute arrhythmic events, highlighting the importance of integrating stress management techniques into comprehensive care plans for patients with cardiac susceptibility. Despite their potential diversity, arrhythmias share a common thread in their potential to affect cardiac output, emphasizing the interconnectedness of electrical dysrhythmia and hemodynamic compromise, necessitating a holistic grasp of cardiovascular physiology in clinical practice. The management of arrhythmias in patients with comorbid conditions, such as diabetes or chronic kidney disease, often involves additional layers of complexity due to interaction with existing therapies and potential alteration of drug metabolism, underscoring the importance of multidisciplinary care teams. Recent studies suggest that the gut microbiome may influence cardiac rhythm through mechanisms involving metabolic byproducts, opening intriguing possibilities for novel approaches to managing arrhythmic disorders via dietary modulation and microbiome-targeted therapies. In some instances, a pacemaker or implantable cardioverter defibrillator interaction with electromagnetic fields necessitates vigilance regarding potential interference, leading to patient education on avoiding certain environments to ensure device functionality remains uncompromised. Considering arrhythmias from a global health perspective unveils disparities in access to arrhythmia care, prompting efforts towards enhancing healthcare infrastructure and education in resource-limited settings to bridge gaps and improve patient outcomes. The use of risk prediction models in arrhythmia care, incorporating variables such as age, comorbidities, and lifestyle factors, facilitates a more tailored risk assessment approach, enhancing predictive accuracy and informing preventive strategies in clinical decision-making processes. Colon cancer, also known as colorectal cancer, is a form of malignancy that develops from the epithelial cells lining the colon or rectum. It often begins as benign polyps that can become cancerous over time, emphasizing the importance of early detection and intervention through routine screenings such as colonoscopies. The pathophysiology of colon cancer typically involves a series of genetic mutations, including those in the APC, KRAS, and P53 genes, which disrupt normal cell growth and regulatory mechanisms, facilitating uncontrolled cell division and tumor formation. Risk factors for colon cancer include age over 50, a family history of colorectal cancer, certain inherited syndromes such as Lynch syndrome, a diet high in red and processed meats, obesity, physical inactivity, and smoking, which collectively highlight the multifactorial nature of the disease. 4. Adenomatous polyps, especially those that are larger than 1 centimeter, possess a higher risk of malignancy due to their glandular origin, making regular monitoring crucial for individuals with these types of polyps to prevent progression to colon cancer. Five. Symptoms of colon cancer can vary but often include changes in bowel habits like diarrhea or constipation, stool consistency changes, rectal bleeding or blood in the stool, persistent abdominal discomfort, weakness or fatigue, and unexplained weight loss, necessitating medical evaluation for such presentations. Six. Diagnosis of colon cancer is typically confirmed through a combination of colonoscopy, which allows direct visualization and biopsy of suspicious lesions, and imaging techniques like CT scans or MRI to evaluate the extent of the disease and potential metastasis. 7. The staging of colon cancer, ranging from stage 1 to IV, is vital for treatment planning and is based on the extent of tumor invasion into the colon wall, involvement of regional lymph nodes, and the presence of distant metastasis, with more advanced stages requiring more aggressive treatment. 8. Surgical resection remains the primary treatment for localized colon cancer, aiming to completely remove the tumor and surrounding tissues. The surgical approach may include partial colectomy, segmental resection, or more extensive procedures depending on tumor location and stage. 9. Adjuvant chemotherapy, often involving drugs like 5-fluorouracil, leucovorin, and oxaliplatin, is commonly used post-surgery in cases of stage 3 and some stage 2 colon cancer to eradicate microscopic residual cancer cells and reduce recurrence risk. 10. Radiation therapy is not routinely used for colon cancer but is more commonly part of the treatment for rectal cancer, where it helps reduce the size of the tumor before surgery and improve local control, especially in higher stage disease. Targeted therapies, such as bevacizumab, which inhibits angiogenesis, and cetuximab and panitumumab, which target the epidermal growth factor receptor, EGFR, have expanded treatment options for metastatic colon cancer and are commonly used alongside traditional chemotherapy regimens. Immunotherapy, including drugs like pembrolizumab and nivolumab, has shown promise in the treatment of mismatch repair deficient or microsatellite instability high metastatic colon cancers, capitalizing on the concept of harnessing the body's immune system for tumor eradication. 13. The role of genetic testing in colon cancer, particularly looking for mutations such as those in the Lynch syndrome-associated mismatch repair genes, is crucial for identifying hereditary cancer syndromes and informing both treatment and screening strategies for patients and their families. 14. Regular colon cancer screening is recommended to begin at age 45 for average-risk individuals, using methods such as fecal occult blood tests, stool DNA testing, sigmoidoscopy, or colonoscopy, which are effective in reducing mortality by detecting precancerous polyps and early-stage cancers. 15. Lifestyle modifications, including a high-fiber diet rich in fruits, vegetables, and whole grains, regular physical activity, maintaining a healthy weight, and minimizing alcohol consumption and tobacco use, play a significant role in the prevention of colon cancer. 16. The recurrence of colon cancer post-treatment is a major concern, with follow-up protocols typically including regular surveillance colonoscopies, periodic imaging, and carcinoembryonic antigen (C) testing to monitor for disease return and ensure prompt intervention if needed. 17. The prognosis of colon cancer is highly stage-dependent, with localized disease, stage 1, having a 5-year survival rate exceeding 90%, while distant metastatic disease, stage 4, has a significantly reduced survival rate, underscoring the importance of early detection. 18. Palliative care in advanced colon cancer focuses on symptom management, such as pain control and addressing nutritional issues, to enhance the quality of life for patients rather than curing the disease, making it an integral part of comprehensive cancer care. 19. Research into the molecular and genetic underpinnings of colon cancer continues to be a vibrant field, with studies exploring novel biomarkers for early detection and new molecular targets for treatment, offering hope for more personalized and effective management strategies in the future. 20. The mucinous subtype of colon cancer, characterized by abundant extracellular mucin production, presents unique pathological features and is often associated with a poorer prognosis compared to the more common adenocarcinoma subtype, demanding specialized treatment considerations. 21. Colon cancer can metastasize to distant organs, with the liver and lungs being the most common sites, and managing such metastatic spread often involves systemic therapies and, in select cases, surgical resection or radiofrequency ablation of metastasis to prolong survival. 22. Colon cancer incidence shows considerable geographic and ethnic disparities, with higher rates in developed countries, possibly due to lifestyle factors and dietary patterns, although ongoing research is needed to unravel the complex interplay of genetics and environment in these trends. 23. Biomarker testing in colon cancer, such as for mutations in the KRAS, NRAS, and BRAF genes, guides the use of targeted therapies and provides important prognostic information, helping to tailor treatment plans for optimal patient outcomes. 24. Neoadjuvant chemotherapy or chemoradiation therapy before surgical resection has gained traction in advanced rectal cancer treatment, aiming to downstage the tumor and increase the likelihood of complete resection, thereby improving long-term survival rates. 25. Colon cancer in younger adults, while less common than in older populations, is on the rise, warranting increased awareness and consideration of hereditary syndromes, as well as lower screening age guidelines, to address this concerning trend effectively. 26. BRAF mutations in colon cancer are associated with a distinct clinical profile, often demonstrating more aggressive behavior and a poor response to conventional therapies, calling for innovative therapeutic approaches and clinical trials to improve outcomes for affected patients. 27. Inflammatory bowel diseases, such as Crohn's disease and ulcerative colitis, significantly increase the risk of developing colon cancer due to chronic inflammation and dysplasia, necessitating vigilant surveillance and perhaps earlier intervention in these at-risk populations. 28. Genetic counseling is an essential component for families with Lynch syndrome or familial adenomatous polyposis, providing information about cancer risks, the importance of surveillance, and preventive options, including prophylactic surgery, for mutation carriers. 29. The gut microbiome, a complex community of microorganisms residing in the colon, is increasingly recognized for its role in colon cancer, with dysbiosis and specific bacterial species being implicated in carcinogenesis, paving the way for innovative microbiome-targeted therapies. 30. Identifying circulating tumor DNA, ctDNA, in the blood offers a promising non-invasive method for monitoring colon cancer recurrence and treatment response, potentially providing real-time insights into tumor dynamics and guiding personalized treatment adjustments. 31. The MSI, microsatellite instability, testing status of colon cancer is a critical factor that impacts treatment decisions, as MSI-high tumors are more likely to respond to immunotherapy, offering a tailored approach that capitalizes on the tumor's unique molecular phenotype. 32. Advances in laparoscopic and robotic surgery have refined the surgical treatment of colon cancer, offering the benefits of minimally invasive techniques such as shorter recovery times, reduced postoperative pain, and smaller incisions, without compromising oncological outcomes. 3.3. The concept of field cancerization in colon cancer suggests that genetic and epigenetic alterations may occur over a large area of the colon epithelium, potentially leading to multiple primary cancers or recurrences, highlighting the need for thorough surveillance and intervention strategies. 34. Tumor budding, a histopathological feature characterized by isolated cells or small clusters at the invasive front of colon cancer, is emerging as a robust prognostic marker associated with poor clinical outcomes, and it may eventually guide therapeutic decisions in the clinical setting. 35. Tertiary lymphoid structures within the tumor microenvironment of colon cancer are increasingly recognized for their role in mounting anti-tumor immune responses, and their presence correlates with improved survival, representing an area of intense research interest in cancer immunology. 36. Colon cancer prevention may involve the use of chemopreventive agents such as aspirin and other nonsteroidal anti-inflammatory drugs, NSAIDs, which have been shown to reduce the risk of adenoma formation and colorectal cancer, although potential side effects must be carefully weighed. 37. Meditation and other forms of stress reduction may play a supportive role in colon cancer care, potentially influencing biomarkers of inflammation and immune function, although more research is required to solidify the evidence base regarding their impact on disease outcomes. 38. Polygenic risk scores, which combine the effects of multiple genetic risk variants, are under development to better predict colon cancer risk in individuals, facilitating personalized screening recommendations and potentially improving early detection rates for high-risk populations. 39. Aromatase inhibitors show promise as a potential treatment for a subset of colon cancers that express estrogen receptors, highlighting the ongoing exploration of hormone modulation as a novel therapeutic avenue in colorectal carcinogenesis. 40. The Warburg effect, characterized by increased glycolysis and lactate production even under normoxic conditions, is a key metabolic feature of colon cancer cells, and targeting this metabolic reprogramming offers a potential strategy for selective cancer therapy. 41. Serrated polyps, which include sessile serrated lesions and traditional serrated adenoma, have distinct molecular and histological features and are an important precursor to colon cancer, underscoring the need for their accurate identification and removal during colonoscopy. 42. The PI3K/AKT/mTOR signaling pathway is frequently dysregulated in colon cancer, contributing to tumor growth and survival, and it represents an attractive target for therapeutic intervention, although drug resistance remains a significant challenge in clinical applications. 43. Anti-angiogenic strategies in colon cancer focus on inhibiting the formation of new blood vessels necessary for tumor growth and metastasis, with agents like bevacizumab demonstrating efficacy in improving survival when combined with chemotherapy in advanced stage disease. 44. In the context of colon cancer, the CpG island methylator phenotype, CIMP, represents a subset with distinct clinical and pathological features, including silencing of tumor suppressor genes through hypermethylation, and has implications for prognosis and treatment responses. 45. Physical exercise is noted to be beneficial for colon cancer survivors, assisting in recovery, reducing fatigue, and potentially lowering recurrence risk through mechanisms involving improved insulin sensitivity, reduction of inflammatory markers, and modulation of metabolic pathways. 46. Research into exosomal communication in colon cancer suggests that these small extracellular vesicles can mediate intercellular transfer of molecules such as proteins, RNAs, and microRNAs, influencing tumor progression and metastasis, and opening avenues for targeted therapeutic manipulation. '47. The involvement of cancer-associated fibroblasts in the desmoplastic response within the tumor microenvironment of colon cancer highlights their role in promoting invasion and resistance to therapy, thus representing a potential target for novel anti-stromal therapeutic approaches. 48. Understanding the interplay between chronic inflammation, often driven by cytokines and inflammatory pathways like NF-κB, and colon carcinogenesis provides insights into potential preventive and therapeutic strategies aiming to modulate the inflammatory milieu in colorectal cancer. '49. The development of inhibitors targeting mutant forms of the APC protein, a tumor suppressor frequently altered in colon cancer, remains a significant research focus, as restoring or compensating for lost APC function could curb abnormal cell proliferation and reduce cancer progression. 50. Progress in organoid technology allows the cultivation of patient-derived colon cancer cells in three-dimensional cultures, offering powerful platforms for personalized drug screening, understanding tumor biology, and advancing precision medicine endeavors in colorectal cancer research. Alzheimer's disease is characterized by the progressive degeneration of cholinergic neurons within the cerebral cortex, leading to cognitive decline and a plethora of neuropsychiatric symptoms including memory loss, language deterioration, and diminished executive functioning, fundamentally impacting daily life activities. The key pathological hallmark of Alzheimer's disease is the accumulation of amyloid beta plaques and neurofibrillary tangles made of hyperphosphorylated tau protein within the brain, which disrupts cell communication, ultimately leading to neuron death and brain atrophy observed through imaging. Although the exact cause of Alzheimer's disease remains elusive, genetic factors such as mutations in the amyloid precursor protein, presenilin 1 and 2 genes, as well as environmental influences like head injuries and cardiovascular risk factors, significantly contribute to its development. Clinically, Alzheimer's disease is initially marked by mild cognitive impairment, primarily affecting recent memory, but as the disease progresses, a broad spectrum of cognitive and behavioral dysfunctions emerges, including impaired judgment, disorientation, and personality changes. The diagnosis of Alzheimer's disease largely relies on a detailed clinical history, cognitive assessments such as the Mini-Mental State Examination, and neuroimaging techniques like MRI or PET scans to observe characteristic brain changes, though definitive diagnosis is post-mortem. The management of Alzheimer's disease includes pharmacological treatments such as cholinesterase inhibitors like donepezil and N-methyl-D aspartate receptor antagonists like memantine aimed at temporarily improving cognitive symptoms, though they do not halt disease progression. Advancements in blood biomarkers, including plasma tau and amyloid beta levels, are showing promise in early diagnosis and prognosis of Alzheimer's disease, providing a less invasive and potentially cost-effective alternative to traditional cerebrospinal fluid analysis and imaging. Personalized medicine in Alzheimer's disease involves tailoring interventions including pharmacotherapy, lifestyle changes, and cognitive training based on an individual's genetic, biomarker, and phenotypic profiles to optimize therapeutic efficacy and improve quality of life. Alzheimer's disease disproportionately affects women, with approximately 2/3 of diagnosed cases being female, a discrepancy that may be attributed to hormonal differences, longevity, and specific genetic factors including the presence of the APOE4 allele. 10. The vascular hypothesis of Alzheimer's posits that cerebrovascular abnormalities contribute to neuronal injury by impairing blood flow and nutrient delivery in the brain, promoting amyloid deposition and neuroinflammation, which collectively exacerbate neurodegenerative processes. Immune system dysregulation plays a critical role in Alzheimer's pathophysiology, as microglial cells, the brain's resident immune cells, contribute to chronic inflammation and neuronal damage through the aberrant clearance of amyloid plaques and synaptic pruning. 12. Evidence suggests a bidirectional relationship between Alzheimer's disease and diabetes, where insulin resistance and hyperglycemia exacerbate amyloidogenesis in tau pathology, possibly through pathways involving oxidative stress and inflammatory mediators. 13. Neuroimaging advancements, such as tau PET and amyloid PET scans, are revolutionizing the field by enabling in vivo visualization and quantification of pathological aggregates, providing insights into disease progression and therapeutic response in Alzheimer's. 14. Lifestyle interventions, such as regular aerobic exercise, a Mediterranean diet rich in antioxidants and omega-3 fatty acids, and cognitive engagement, have been associated with improved cognitive function and reduced risk of Alzheimer's disease, suggesting modifiable lifestyle impacts. 15. Recent studies indicate a potential link between sleep disturbances and Alzheimer's, where poor sleep quality and sleep apnea may accelerate amyloid accumulation and tau phosphorylation, making sleep optimization a potential preventive target and therapeutic approach. 16. The gut-brain axis has emerged as a novel area of interest in Alzheimer's research, with studies investigating how dysbiosis, or imbalances in gut microbiota, may influence neuroinflammation, amyloid pathology, and cognitive function through metabolic and immune pathways. 17. The olfactory system is notably affected early in Alzheimer's disease, with loss of smell often preceding cognitive symptoms. Therefore, olfactory testing may serve as a valuable early biomarker for the detection and monitoring of disease progression. 18. A controversial but fascinating avenue of research in Alzheimer's disease involves investigating the potential infectious etiology, where certain pathogens such as herpes simplex virus type 1 might drive amyloid accumulation and neurodegeneration through chronic brain infections. 19. Cognitive remediation therapy, aimed at improving memory, attention, and problem-solving skills through repetitive systematic practice and strategies, is emerging as a non-pharmacological intervention to enhance cognitive reserve in individuals with early-stage Alzheimer's. 20. Alzheimer's disease's socioeconomic impact is profound, as it significantly increases healthcare expenditure due to the need for long-term care and leads to heavy emotional and financial burdens on caregivers, highlighting the urgent need for effective public health strategies. 21. The blood-brain barrier (BBB) dysfunction observed in Alzheimer's disease disrupts homeostasis by allowing neurotoxic molecules to enter and accumulate in the brain, exacerbating amyloid pathology and tau hyperphosphorylation, thereby contributing to neurodegeneration. 22. In Alzheimer's, altered synaptic plasticity and neurotransmitter imbalances, particularly affecting glutamate and acetylcholine levels, disrupt neural networks and cognitive processes, complicating communication between neurons and leading to memory deficits. 23. The concept of cognitive reserve explains why some individuals with significant Alzheimer's pathology can maintain cognitive function, as education, occupation, and intellectually stimulating activities are believed to enhance the brain's resilience to damage. 24. A promising area in Alzheimer's therapeutics involves monoclonal antibodies designed to target and clear amyloid beta or tau aggregates from the brain, with some demonstrating efficacy in slowing cognitive decline, though challenges remain in balancing immunotherapy risks. 25. Genomic studies have identified several risk loci and genes, such as CLU, PICALM, and CR1, associated with Alzheimer's disease pathogenesis, providing insights into novel biological pathways and potential targets for future therapeutic interventions. '26. Recent findings indicate that oxidative stress, characterized by an imbalance between free radicals and antioxidant defenses, contributes to the neuronal injury observed in Alzheimer's disease by damaging cellular components, accelerating neuronal death and synapse loss. '27. Hypertension, through mechanisms involving vascular injury and reduced cerebral perfusion, is strongly linked to an increased risk of Alzheimer's progression, emphasizing the importance of blood pressure control in preventive strategies for cognitive impairment. '28. The role of metals in Alzheimer's disease is under investigation, as dysregulated levels of zinc, copper, and iron may promote amyloid aggregation and oxidative stress, with chelation therapy being explored as a potential approach to mitigate these effects. '29. Neurotrophic factors like brain-derived neurotrophic factor, BDNF, responsible for neuron growth and survival, are diminished in Alzheimer's patients, paving the way for treatments aimed at enhancing neurotrophic signaling to support synaptic function and plasticity. '30. Lipid metabolism dysregulation is implicated in Alzheimer's disease pathology, with disturbances in cholesterol transport and distribution in the CNS being linked to amyloid processing abnormalities, offering new avenues for lipid-modulating therapeutic strategies. '31. Recent studies suggest that astrocytes, traditionally considered supportive glial cells, play active roles in Alzheimer's disease by modulating glutamate toxicity, releasing pro-inflammatory cytokines, and influencing amyloid plaque formation and clearance. '32. The exploration of non-invasive brain stimulation techniques, like transcranial magnetic stimulation, TMS, offers promise in modulating neural circuits implicated in cognition, potentially serving as adjunctive treatments to enhance cognitive function in Alzheimer's patients. '33. Research into the role of mitochondrial dysfunction has highlighted its contribution to Alzheimer's disease, where impaired energy metabolism, ROS production, and calcium homeostasis are implicated in facilitating neuronal death and cognitive decline. '34. Nutraceuticals, including curcumin, resveratrol, and omega-3 fatty acids, are being investigated for their potential neuroprotective properties in Alzheimer's disease, based on their anti-inflammatory and antioxidant effects, providing additional strategies for disease management. '35. In Alzheimer's disease, cerebrospinal fluid (CSF) analysis revealing decreased amyloid beta and elevated tau protein levels serves as a diagnostic marker, reflecting the dynamics of neurodegenerative changes and providing critical information for disease staging. '36. Epigenetic modifications, such as DNA methylation and histone acetylation, are implicated in Alzheimer's disease, affecting gene expression underlying neuronal integrity and disease susceptibility, opening doors to epigenetic therapies targeting these regulatory mechanisms. '37. Neuroprotection research in Alzheimer's disease focuses on safeguarding neurons from degenerative processes through mechanisms like antioxidant defenses, anti-inflammatory pathways, and the stabilization of cellular organelles, promising avenues for therapeutic advances. '38. The study of proteinopathies in Alzheimer's highlights how protein misfolding and aggregation into oligomers and fibrils interfere with cellular functions, leading to a toxic environment contributing to synaptic dysfunction and neurodegeneration. A novel dimension in Alzheimer's research is exploring the role of circadian rhythm disruptions, where abnormalities in sleep-wake cycles may exacerbate amyloid pathology, suggesting that circadian regulation could be a therapeutic target to retard disease progression. Therapeutic strategies in Alzheimer's are being designed to enhance autophagy and lysosomal degradation, promoting the clearance of misfolded proteins in damaged organelles, thus improving cellular homeostasis and attenuating neurodegenerative processes. The psychosocial aspects of Alzheimer's disease emphasize the need for comprehensive care strategies encompassing cognitive behavioral therapy, socialization activities, and caregiver support to address the complex emotional, behavioral, and cognitive challenges faced by patients and families. Innovative research in Alzheimer's involves the use of neuroimaging to study connectome reorganization, where aberrant neural network connectivity patterns can reflect disease state and progression, informing personalized therapeutic strategies and interventions. Gender-specific differences in Alzheimer's disease progression and pathology are being studied to better understand hormonal influences, especially the protective role of estrogen in cognitive resilience, offering insights into tailored interventions for females. Therapeutic vaccination approaches targeting amyloid beta or tau proteins aim to induce an adaptive immune response to facilitate the clearance of these pathological aggregates, presenting potential strategies to delay the onset and progression of Alzheimer's disease. The concept of neuroprotection in Alzheimer's disease involves using agents that prevent neuronal cell death by targeting oxidative stress, excitotoxicity, and neuroinflammation, highlighting the importance of early intervention to preserve cognitive functioning. In Alzheimer's disease, the impaired glymphatic clearance system, responsible for waste removal in the brain, contributes to the accumulation of toxic proteins, with current research exploring methods to enhance this system as a therapeutic approach. The study of functional genomics in Alzheimer's disease provides insights into gene activity and expression changes in different brain regions, offering critical data for understanding disease mechanisms and identifying novel therapeutic targets. Alzheimer's disease research is exploring the impact of early life exposures and experiences on cognitive aging, where education level, social engagement, and environmental factors may influence susceptibility, resilience, and age of onset of pathology. The involvement of metal-ion homeostasis in Alzheimer's is gaining attention, with copper, zinc, and iron transport abnormalities being linked to amyloid aggregation and oxidative damage, suggesting metal-based therapeutic targets to restore homeostasis. Various therapeutic approaches focusing on synaptic repair and regeneration are being explored in Alzheimer's, emphasizing restoring synaptic density and function through molecules enhancing synaptic proteins, potentially offering new hope in cognitive preservation and recovery. COPD, or chronic obstructive pulmonary disease, is a group of progressive lung disorders including emphysema and chronic bronchitis, primarily associated with prolonged smoking, characterized by persistent respiratory symptoms and airflow limitation due to airway and/or alveolar abnormalities usually caused by significant exposure to noxious particles or gases, prompting clinicians to advise early smoking cessation and lifestyle modifications as preventive measures. 2. Spirometry is the gold standard diagnostic test for COPD, requiring measurement of forced expiratory volume in 1 second, FEV1, and forced vital capacity, FVC, with an FEV1, FVC ratio of less than 0.70 post-bronchodilator, confirming persistent airflow limitation indicative of COPD, thus differentiating it from asthma and other respiratory conditions. Three. Emphysema, a form of COPD, involves destruction of the alveoli, reducing the surface area available for gas exchange, which leads to symptoms such as shortness of breath, exertional dyspnea, and barrel-shaped chest on physical examination, highlighting the importance of lung volume reduction strategies like smoking cessation and pulmonary rehabilitation. Four. Chronic bronchitis, another variant of COPD, is characterized by productive cough lasting at least 3 months in 2 consecutive years, with hypertrophy and hyperplasia of mucus-secreting glands in the airways leading to excessive mucus production, obstructed airflow, and a higher susceptibility to respiratory infections, thereby necessitating vaccination adherence and prompt treatment of infections. Five. The pathophysiology of COPD involves chronic inflammation of the airways, parenchyma, and pulmonary vasculature, resulting in structural changes, narrowing of small airways, and destruction of lung tissue, driven largely by cigarette smoke and other environmental pollutants, reinforcing the importance of environmental control measures, particularly in occupational settings. Six. Pharmacologic management of COPD primarily involves bronchodilators such as beta-2 agonists and anticholinergics, which work by relaxing airway smooth muscles and improving expiratory flow, often used in combination with inhaled corticosteroids in patients with frequent exacerbations to reduce inflammation and the frequency of acute episodes, aiming for better symptom control and quality of life. 7. Inhaled long-acting muscarinic antagonists, LAMAs, are effective components of COPD therapy, offering prolonged bronchodilation and symptom relief by blocking muscarinic receptors in the airway smooth muscle, which reduces the frequency of exacerbations and improves airflow, thereby becoming a cornerstone in the treatment of moderate to severe COPD. 8. Systemic corticosteroids are commonly used during acute exacerbations of COPD to reduce airway inflammation and hasten recovery, though their use should be limited to short courses due to potential adverse effects like osteoporosis and hyperglycemia, emphasizing the importance of monitoring and managing these risks in long-term COPD care. 9. The use of supplemental oxygen therapy is crucial in managing COPD patients with chronic hypoxemia, as it improves survival, exercise tolerance, and the quality of life in patients meeting criteria like resting PaO2 of 55 mm of mercury or below, or SaO2 of 88% or below, underscoring the need for regular arterial blood gas assessments. 10. Pulmonary rehabilitation is an integral part of COPD management, combining exercise training, education, and behavioral changes to improve the physical and psychological condition of people with COPD, enhancing their overall quality of life and reducing the frequency and severity of exacerbations through personalized care plans. 11. Alpha-1 antitrypsin deficiency is a genetic risk factor for COPD, especially in younger patients or non-smokers presenting with early-onset emphysema, marking the significance of familial screening and the potential benefit of augmentation therapy with plasma-purified human alpha-1 antitrypsin to slow disease progression. 12. Nutritional support is vital in COPD management, as malnutrition and weight loss are common concerns due to increased metabolic demands and reduced appetite from dyspnea, so maintaining a balanced diet with adequate caloric and protein intake is emphasized to optimize pulmonary function and overall health. 13. Smoking cessation is the most effective intervention for halting the progression of COPD and can lead to significant improvements in lung function over time, making support programs, counseling, and pharmacotherapies such as nicotine replacement therapy and varenicline critical components of long-term disease management. (14) COPD exacerbations are acute episodes of worsening respiratory symptoms with increased frequency, severity, or production of sputum, often triggered by viral or bacterial infections, necessitating prompt treatment with bronchodilators, systemic corticosteroids, and antibiotics if indicated, to reduce hospital admissions and improve patient outcomes. (15) The BODE index, which evaluates body mass index, airflow obstruction, dyspnea, and exercise capacity, is a multidimensional scoring system useful for predicting the prognosis of COPD patients by integrating clinical parameters to guide therapeutic decisions and discussions about disease progression and care plans. (16) Chronic inflammation in COPD contributes to systemic effects such as skeletal muscle dysfunction, cardiovascular disease, and osteoporosis, requiring a multidisciplinary approach for management, including regular monitoring, appropriate pharmacotherapy, lifestyle interventions, and optimization of comorbid conditions. (17) Regular vaccination against influenza and pneumococcal pathogens is recommended for COPD patients to reduce the risk of respiratory infections that can lead to exacerbations, hospitalization, and mortality, reinforcing the need for healthcare providers to prioritize immunizations as part of comprehensive COPD care. (18) Psychological distress is prevalent among COPD patients, with depression and anxiety significantly affecting their quality of life and disease outcomes, highlighting the necessity of routine mental health evaluations and the provision of appropriate support, counseling, or pharmacotherapy when needed to address these issues effectively. (19) Inhaler technique is critical in COPD management, as improper use can lead to suboptimal drug delivery and poor disease control, emphasizing the need for regular assessment and patient education on correct inhaler techniques to ensure maximum therapeutic benefit from prescribed medications. (20) Nebulized drug delivery systems offer an alternative for COPD patients struggling with inhaler coordination, providing medication through a fine mist that is easier to inhale, particularly for individuals with severe disease or during exacerbations, ensuring adequate drug deposition and symptom relief. (21) Dyspnea, or shortness of breath, is a hallmark symptom of COPD, often perceived as a constant or episodic air hunger by patients, which warrants timely assessment to differentiate from other potential causes, ensuring targeted interventions like pulmonary rehabilitation and optimized pharmacotherapy are implemented to enhance patient comfort and function. (22) Lung function decline in COPD occurs gradually, with annual reductions in FEV1 typically exceeding those seen with normal aging, thus highlighting the significance of early detection, consistent monitoring, and aggressive management strategies to slow disease progression and preserve lung capacity. (23) The Global Initiative for Chronic Obstructive Lung Disease (GOLD) guidelines provide a classification system for COPD severity based on the degree of airflow limitation, frequency of exacerbations, and patient-reported symptom burden, guiding the tailored pharmacological and non-pharmacological treatment approaches for individual patients. (24) Airway clearance techniques such as chest physiotherapy and the use of devices like the flutter valve or acapella are beneficial for COPD patients with chronic sputum production, facilitating mucus clearance and improving ventilation, hence preventing secondary infections and improving respiratory function. (25) Endoscopic lung volume reduction procedures, such as endobronchial valve placement, offer an innovative treatment option for patients with severe emphysema, aiming to collapse hyperinflated lung compartments and improve respiratory mechanics, thus enhancing exercise tolerance, pulmonary function, and quality of life. (26) Genetic factors alongside environmental exposures contribute to COPD development, with research indicating specific genetic variants influencing susceptibility to the disease, which underscores the potential for identifying at-risk individuals and developing novel prophylactic or therapeutic strategies through personalized medicine. (27) Breathlessness can exacerbate physical inactivity in COPD patients, resulting in a deconditioning cycle that worsens symptoms and disease outcomes, thus highlighting the importance of individualized exercise programs within pulmonary rehabilitation to break this cycle and promote better health and functionality. (28) Comorbidities such as cardiovascular disease, diabetes, and lung cancer are frequently associated with COPD, complicating disease management and prognosis, emphasizing the necessity for a comprehensive approach that includes routine screening, management of concurrent conditions, and coordinated patient care. (29) Exacerbations in COPD, characterized by a sudden worsening of symptoms, are multifactorial, with a large proportion attributed to respiratory infections and environmental pollutants, necessitating rapid management and preventive strategies, including medications and lifestyle interventions to reduce their occurrence. (30) COPD's economic burden is significant, impacting healthcare systems due to hospitalization, medication costs, and lost productivity, thereby stressing the importance of preventive measures, effective management strategies, and patient education to alleviate the financial burden associated with chronic disease. (31) Pulmonary function tests beyond spirometry, like diffusion capacity for carbon monoxide, DLCO, provide insights into gas exchange efficiency in COPD, which can help differentiate emphysema from other lung pathologies and tailor management strategies to the specific physiological impairments present in each patient. (32) Air pollution is a significant environmental risk factor for COPD exacerbations, with exposure to pollutants like particulate matter and ozone exacerbating symptoms, underscoring the need for strategies to minimize patient exposure and mitigate the health impacts of poor air quality on vulnerable populations. (33) A significant overlap exists between COPD and asthma, with some patients exhibiting characteristics of both, known as asthma-COPD overlap, ACO, necessitating a nuanced diagnostic and therapeutic approach that incorporates treatment regimens from both COPD and asthma guidelines for optimal management. (34) Opioid use in COPD for intractable dyspnea management should be carefully monitored due to the risk of respiratory depression, and is generally reserved for severe cases where other interventions have failed, requiring careful dose titration, monitoring, and evaluation to minimize potential adverse effects. (35) Combining long-acting beta-2 agonists, LABAs, and inhaled corticosteroids can be more effective for patients with frequent exacerbations and higher eosinophilic inflammation in managing COPD, working synergistically to improve lung function, quality of life, and reduce exacerbation frequency and severity. (36) Social support networks play an essential role in managing COPD, as they can provide emotional support, encourage adherence to treatment plans, and facilitate lifestyle changes, emphasizing the importance of engaging family members and care partners in the management process to optimize outcomes. (37) Sputum color and consistency in COPD can provide clues about potential infections, with changes often indicating bacterial colonization, thus guiding antibiotic selection when necessary, highlighting the necessity for healthcare providers to closely monitor these changes and adjust treatment accordingly. 38. Respiratory muscle training can improve respiratory muscle strength in COPD patients, enhancing exercise capacity and reducing the sensation of dyspnea, being an important component of pulmonary rehabilitation programs and contributing to better overall function and quality of life in these patients. 39. COPD can disrupt the sleep patterns of sufferers, often leading to poor sleep quality due to nocturnal breathlessness or frequent coughing, making the assessment and management of sleep disturbances an essential part of comprehensive COPD care to improve patient well-being and daytime functioning. 40. Individualized action plans for COPD patients detail steps to take in response to changes in symptoms or exacerbation warning signs, empowering patients to manage their condition proactively and reducing unnecessary emergency department visits, emphasizing the importance of patient education and engagement in COPD management. 41. Newer targeted therapies are being explored for COPD, focusing on the underlying inflammatory pathways and protease-antiprotease imbalances, which could offer future options to alter the disease process, although current management primarily revolves around symptom relief and exacerbation prevention. 42. Effective communication between COPD patients and their healthcare team is paramount, as it ensures a shared understanding of the disease, treatment goals, and management strategies, fostering adherence to complex therapeutic regimens, mitigating potential barriers, and enhancing patient autonomy and satisfaction. 43. Thromboembolic events are a known complication of COPD, likely due to systemic inflammation and hypoxia-related coagulation abnormalities, necessitating vigilance for signs of deep vein thrombosis or pulmonary embolism and the consideration of prophylactic anticoagulation in high-risk individuals to prevent adverse outcomes. 44. Gas trapping in COPD is a natural consequence of poor airflow and airway collapse during expiration, leading to hyperinflation which can impair respiratory mechanics and cardiac function, underscoring the need for treatments aimed at improving airflow and gas exchange to reduce hyperinflation and symptom burden. 45. Home monitoring devices, including pulse oximeters and spirometers, can empower COPD patients to track their health at home and facilitate early intervention for exacerbations, enhancing self-management skills and allowing for tailored adjustments to their treatment plans by healthcare professionals based on objective data. 46. COPD has a significant burden on mental health, heightening risks for anxiety and depression, which can exacerbate physical symptoms and hinder treatment adherence, necessitating regular psychological assessment and the integration of mental health support within the multidisciplinary care framework for optimal outcomes. 47. Exacerbations can be predicted in COPD by monitoring changes in symptoms, exposure to infection, or environmental pollutants, with machine learning models and wearable technology being developed to provide real-time risk assessment, enabling timely interventions and potentially reducing the frequency of these acute events. 48. Knowing the symptoms and etiology of COPD involves understanding the finely tuned balance of protease and antiprotease activity in the lungs which, when dysregulated due to smoking or genetic predisposition, leads to tissue destruction and the classical features of emphysema, stressing the complexity of pathophysiological pathways that require targeted interventions. 49. Comorbid respiratory infections can perpetuate COPD exacerbations, making the identification and management of pathogens, whether bacterial or viral, integral to reducing symptom burden and preventing further respiratory decline, necessitating vigilant diagnostic approaches and appropriate antimicrobial therapies. 50. The psychosocial aspects of living with COPD. such as the loss of independence and social isolation due to physical limitations, can greatly impact overall well-being, underscoring the importance of integrating social support services, therapy, and encouragement of self-efficacy within comprehensive COPD management programs. One, cardiovascular disease encompasses a range of heart and blood vessel disorders, with the most common being coronary artery disease, which can lead to myocardial infarction and is primarily caused by atherosclerosis, a complex pathophysiological process involving lipid deposition, inflammation, and endothelial dysfunction. 2. The heart's electrical system, crucial for maintaining regular cardiac rhythms, can be disrupted in arrhythmias like atrial fibrillation, which increase the risk of thromboembolism, often requiring anticoagulant therapy to prevent stroke and other serious cardiovascular events. Three, hypertension, often dubbed the silent killer due to its asymptomatic nature, exerts chronic pressure on the cardiovascular system, leading to left ventricular hypertrophy, heart failure, and increased risk for ischemic heart disease if not managed through lifestyle modification and pharmacotherapy. Four, heart failure is a clinical syndrome characterized by the heart's inability to pump sufficient blood to meet the body's needs, stemming from either systolic or diastolic dysfunction, and is often managed with a combination of ACE inhibitors, beta blockers, and diuretics to alleviate symptoms and improve survival. Five, lipoprotein, A, is a genetically determined molecule that plays a significant role as an independent risk factor for cardiovascular diseases due to its pro-atherogenic and prothrombotic properties, necessitating targeted therapeutic approaches like PCSK9 inhibitors in high-risk individuals. 6. Kawasaki disease is an acute, self-limited vasculitis primarily affecting children and poses a considerable risk for coronary artery aneurysms, requiring prompt treatment with high-dose intravenous immunoglobulin and aspirin to reduce cardiovascular complications and ensure long-term heart health. 7. The intricate process of atherosclerosis begins with endothelial injury followed by LDL cholesterol infiltration and oxidation, triggering a cascade of immune responses that culminate in plaque formation and potential rupture, necessitating lifestyle changes and statin therapy for risk reduction. 8. The ankle brachial index, ABI, is a simple, non-invasive diagnostic tool used to assess peripheral artery disease, wherein an ABI of less than 0.90 suggests a high likelihood of significant arterial obstruction and increased cardiovascular risk, guiding further diagnostic and therapeutic interventions. 9. Takotsubo cardiomyopathy, also known as stress-induced cardiomyopathy or broken heart syndrome, mimics acute coronary syndrome but typically resolves with supportive care, highlighting the profound impact of emotional and physical stress on cardiovascular function. 10. Coronary artery bypass grafting, CABG, is a surgical procedure that improves blood flow to the heart in cases of severe coronary artery disease by using grafts from other vessels to bypass blocked arteries, significantly enhancing quality of life and reducing mortality when medical therapy alone is insufficient. 11. In hypertrophic cardiomyopathy, genetic mutations lead to an abnormally thickened heart muscle, particularly the septum, resulting in outflow obstruction, arrhythmias, and sudden cardiac death, often requiring genetic counseling, lifestyle adjustments, and medications such as beta blockers or surgical intervention for management. 12. Angiotensin-converting enzyme inhibitors not only lower blood pressure but also exert protective effects on the cardiovascular system through mechanisms like reducing remodeling, preventing left ventricular hypertrophy, and improving endothelial function, making them a cornerstone in the treatment of heart failure and hypertension. 13. Peripheral artery disease is marked by atherosclerotic blockages in the arteries of the legs, leading to intermittent claudication, rest pain, or critical limb ischemia. Early diagnosis and treatment with exercise therapy, antiplatelet agents, and revascularization are crucial to prevent limb loss and cardiovascular events. Cardiac biomarkers, including high-sensitivity troponins, are pivotal in diagnosing myocardial infarction, as they are sensitive indicators of cardiac myocyte injury, guiding early treatment strategies such as anticoagulation, antiplatelet therapy, and reperfusion to improve patient outcomes. Rheumatic heart disease is a chronic sequela of rheumatic fever caused by group A streptococcal infection, resulting in progressive damage to the heart valves, predominantly the mitral valve, necessitating long-term antibiotics and potentially surgical valve repair or replacement to prevent cardiac failure. The baroreceptor reflex plays a critical role in short-term blood pressure regulation by adjusting heart rate and vascular tone in response to changes in arterial wall stretch, crucial in preventing rapid fluctuations in blood pressure that could lead to syncope or hypertension-related complications. Endothelial cells, lining the interior of blood vessels, are indispensable for maintaining vascular health by secreting substances like nitric oxide, which promote vasodilation, inhibit platelet aggregation, and improve blood flow, and their dysfunction is a pivotal event in the pathogenesis of cardiovascular diseases. One hallmark of chronic heart failure is neurohormonal activation, where systems like the renin-angiotensin-aldosterone system are upregulated, leading to detrimental effects such as vasoconstriction, sodium retention, and cardiac remodeling, which are targeted by life-saving medications like ACE inhibitors and aldosterone antagonists. The QT interval on an electrocardiogram is a critical measure of ventricular repolarization, and its prolongation is associated with an increased risk of life-threatening arrhythmias such as torsades de pointes, necessitating careful monitoring and correction of electrolyte imbalances and medication adjustments as needed. Pulmonary embolism, a potentially fatal cardiovascular emergency, results from a thrombus typically originating in the deep veins of the legs or pelvis, and manifests with acute dyspnea, chest pain, and hypoxemia. Rapid diagnosis via imaging and treatment with anticoagulation is essential for improving survival. The inflammatory biomarker C-reactive protein, CRP, is utilized in cardiovascular risk assessment, as elevated levels correlate with increased risks of atherosclerosis and heart attacks, prompting preventive measures such as lifestyle modifications and pharmacologic interventions aimed at reducing systemic inflammation. Valvular heart diseases, such as aortic stenosis or mitral regurgitation, result from structural abnormalities causing impaired valve function, leading to volume or pressure overload that can progress to heart failure, necessitating regular monitoring and interventions like valve repair or replacement when symptomatic. Essential hypertension is a complex, multifactorial disorder with contributions from genetic, environmental, and lifestyle factors, and it presents a major risk factor for cardiovascular morbidity and mortality, with treatment focused on achieving target blood pressures through lifestyle changes and evidence-based medication regimens. In acute coronary syndromes, prompt recognition and management through the door-to-balloon protocol for angioplasty within 90 minutes in ST elevation myocardial infarction significantly improve outcomes by restoring blood flow and minimizing cardiac muscle damage, emphasizing the importance of time-sensitive intervention. 25. The role of platelets extends beyond hemostasis. In vascular injury, activated platelets contribute to thrombus formation by releasing mediators like thromboxane A2 and inducing coagulation pathways, making antiplatelet therapy a cornerstone in the prevention of recurrent cardiovascular events after an initial infarction. '26. Myocarditis, an inflammation of the heart muscle often due to viral infections, can lead to dilated cardiomyopathy and heart failure, with clinical management ranging from supportive care and anti-inflammatory treatments to advanced therapies like mechanical circulatory support in severe cases. '27. B-type natriuretic peptide, BNP, and its precursor NT-proBNP are crucial diagnostic tools in distinguishing heart failure from other causes of dyspnea, as they are elevated in response to ventricular stretch, guiding the initiation and adjustment of heart failure therapies to optimize patient care. '28. The Framingham Heart Study provided invaluable insights into cardiovascular risk factors, establishing the association between cholesterol levels, hypertension, and smoking with coronary artery disease, thereby shaping modern preventive strategies through risk calculators and lifestyle interventions. '29. Coarctation of the aorta, a congenital narrowing of the aorta typically distal to the left subclavian artery, results in hypertension in the upper extremities and reduced perfusion to the lower body, requiring careful monitoring and surgical repair or balloon angioplasty to prevent long-term complications like heart failure. '30. Sudden cardiac death, often precipitated by ventricular arrhythmias, poses a significant risk in patients with coronary artery disease or cardiomyopathy, with implantable cardioverter defibrillators providing life-saving intervention by restoring normal heart rhythm upon detecting life-threatening disturbances. '31. Triglycerides, though primarily an energy source, are also implicated in atherosclerotic cardiovascular disease risk, with hypertriglyceridemia contributing to small, dense LDL particles and endothelial impairment, necessitating dietary modification and medications like fibrates in conjunction with statins for management. '32. The cardiac stress testing involves assessing the heart's response to exercise or pharmacologic stress, identifying ischemia and functional capacity, with imaging modalities like echocardiography or nuclear scans enhancing diagnostic accuracy for coronary artery disease assessment and guiding treatment strategies. '33. Heart rate variability, HRV, the physiological phenomenon of variation in the time interval between heartbeats, serves as a marker of autonomic nervous system function and cardiovascular health, with reduced HRV associated with increased risk of cardiovascular morbidity and mortality in various populations. '34. The concept of cardiometabolic risk encompasses the clustering of cardiovascular risk factors, including insulin resistance, hypertension, dyslipidemia, and central obesity, necessitating comprehensive management approaches oriented towards lifestyle modification and pharmacotherapy to reduce the risk of cardiovascular events and diabetes. '35. Alcohol consumption has a complex relationship with cardiovascular health, where moderate intake may confer cardioprotective effects through HDL elevation and anti-inflammatory actions, yet excessive use poses risks for hypertension, cardiomyopathy, and atrial fibrillation, informing guidelines for responsible consumption. '36. The intricate process of heart muscle contraction, governed by the sliding filament theory, involves the interaction of actin and myosin filaments within cardiac muscle cells, regulated by calcium ion flux and essential for effective cardiac output, highlighting the significance of calcium channel blockers in treating conditions like hypertension and angina. '37. Patent ductus arteriosus, a common congenital heart defect, results from the failure of the ductus arteriosus to close after birth, causing left-to-right shunting, leading to pulmonary overcirculation and heart failure if untreated, advocating early diagnosis and intervention with either pharmacologic closure or surgical repair. #38. The J-curve phenomenon in hypertension management illustrates the potential for excessively low blood pressure to increase cardiovascular risk, prompting careful titration of antihypertensive therapy to balance optimizing blood pressure control while mitigating the risk of hypotension-related adverse events. #39. The renin-angiotensin-aldosterone system plays a pivotal role in blood pressure regulation and fluid balance, with dysregulation contributing to pathologies like hypertension, heart failure, and chronic kidney disease, where inhibitors of this system, such as ACE inhibitors and ARBs, are the mainstays of treatment. #40. Novel cardiovascular imaging techniques like coronary CTA and cardiac MRI enhance diagnostic precision by non-invasively characterizing coronary artery disease, myocardial function, and structure, guiding personalized management and optimizing therapeutic outcomes in complex cardiovascular cases. #41. Physical inactivity is recognized as a modifiable risk factor for cardiovascular disease, with regular exercise promoting cardiovascular health by improving endothelial function, reducing blood pressure and LDL cholesterol levels, and enhancing insulin sensitivity, underscoring the importance of active lifestyle interventions for disease prevention. #42. The metabolic syndrome, characterized by a constellation of factors including abdominal obesity, dyslipidemia, insulin resistance, and hypertension, increases cardiovascular disease risk exponentially, necessitating multifaceted therapeutic strategies focusing on weight reduction, physical activity, and pharmacotherapy for optimal risk reduction. #43. Mitral valve prolapse, a condition where the valve leaflets bulge into the left atrium during systole, can lead to mitral regurgitation, arrhythmias, and in some cases, significant cardiovascular symptoms requiring surgical intervention, highlighting the importance of regular monitoring and risk stratification. #44. The sodium-potassium pump maintains cellular electrochemical gradients essential for cardiac function, and its impairment can lead to elevated intracellular sodium and calcium levels, affecting myocardial contractility and rhythm, with digoxin influencing this pump to manage heart failure and atrial fibrillation effectively. #45. Homocysteine, an amino acid, is implicated in cardiovascular disease pathogenesis when elevated, promoting endothelial dysfunction, oxidative stress, and thrombotic events, leading to consideration of folic acid supplementation and lifestyle changes as potential therapeutic strategies for reducing associated cardiovascular risks. #46. Cardiovascular risk reduction in diabetes patients extends beyond glucose control, emphasizing management of blood pressure, lipid profiles, and lifestyle factors, with SGLT2 inhibitors and GLP-1 receptor agonists showing promise in reducing cardiovascular events and enhancing overall heart health in this high-risk population. #47. Myocardial perfusion imaging involves the assessment of blood flow to the heart muscle using tracers, providing valuable insight into coronary artery disease severity and therapeutic response, informing decisions on revascularization strategies like PCI or CABG to improve symptom relief and survival outcomes. #48. The progression of left bundle branch block alters ventricular depolarization and is indicative of underlying structural heart disease, often necessitating further evaluation and intervention strategies, such as device implantation in heart failure patients to optimize synchronicity and improve clinical outcomes. #49. Cardiogenic shock, characterized by inadequate tissue perfusion secondary to severe cardiac dysfunction, poses a critical condition with high mortality, demanding prompt intervention with inotropes, mechanical circulatory support, and definitive treatment strategies like PCI or CABG to stabilize hemodynamics and enhance survival prospects. High-density lipoprotein, HDL, cholesterol, often referred to as good cholesterol, plays a vital role in reverse cholesterol transport and endothelial protection, with higher levels traditionally associated with decreased cardiovascular risk. Though recent studies suggest functionality may be equally critical, prompting ongoing research into therapeutic HDL targeting approaches. 1. COPD, or chronic obstructive pulmonary disease, is a group of progressive lung disorders including emphysema and chronic bronchitis, primarily associated with prolonged smoking, characterized by persistent respiratory symptoms and airflow limitation due to airway and/or alveolar abnormalities usually caused by significant exposure to noxious particles or gases, prompting clinicians to advise early smoking cessation and lifestyle modifications as preventive measures. 2. Spirometry is the gold standard diagnostic test for COPD, requiring measurement of forced expiratory volume in 1 second, FEV1, and forced vital capacity, FVC, with an FEV1-FVC ratio of less than 0.70 post-bronchodilator, confirming persistent airflow limitation indicative of COPD, thus differentiating it from asthma and other respiratory conditions. 3. Emphysema, a form of COPD, involves destruction of the alveoli, reducing the surface area available for gas exchange, which leads to symptoms such as shortness of breath, exertional dyspnea, and barrel-shaped chest on physical examination, highlighting the importance of lung volume reduction strategies like smoking cessation and pulmonary rehabilitation. 4. Chronic bronchitis, another variant of COPD, is characterized by productive cough lasting at least 3 months in 2 consecutive years, with hypertrophy and hyperplasia of mucus-secreting glands in the airways leading to excessive mucus production, obstructed airflow, and a higher susceptibility to respiratory infections, thereby necessitating vaccination adherence and prompt treatment of infections. 5. The pathophysiology of COPD involves chronic inflammation of the airways, parenchyma, and pulmonary vasculature, resulting in structural changes, narrowing of small airways, and destruction of lung tissue, driven largely by cigarette smoke and other environmental pollutants, reinforcing the importance of environmental control measures, particularly in occupational settings. 6. Pharmacologic management of COPD primarily involves bronchodilators such as beta-2 agonists and anticholinergics, which work by relaxing airway smooth muscles and improving expiratory flow, often used in combination with inhaled corticosteroids in patients with frequent exacerbations to reduce inflammation and the frequency of acute episodes, aiming for better symptom control and quality of life. 7. Inhaled long-acting muscarinic antagonists, LAMAs, are effective components of COPD therapy, offering prolonged bronchodilation and symptom relief by blocking muscarinic receptors in the airway smooth muscle, which reduces the frequency of exacerbations and improves airflow, thereby becoming a cornerstone in the treatment of moderate to severe COPD. 8. Systemic corticosteroids are commonly used during acute exacerbations of COPD to reduce airway inflammation and hasten recovery, though their use should be limited to short courses due to potential adverse effects like osteoporosis and hyperglycemia, emphasizing the importance of monitoring and managing these risks in long-term COPD care. 9. The use of supplemental oxygen therapy is crucial in managing COPD patients with chronic hypoxemia, as it improves survival, exercise tolerance, and the quality of life in patients meeting criteria like resting PaO2 of 55 mm of mercury or below, or SaO2 of 88% or below, underscoring the need for regular arterial blood gas assessments. 10. Pulmonary rehabilitation is an integral part of COPD management, combining exercise training, education, and behavioral changes to improve the physical and psychological condition of people with COPD, enhancing their overall quality of life and reducing the frequency and severity of exacerbations through personalized care plans. Alpha-1 antitrypsin deficiency is a genetic risk factor for COPD, especially in younger patients or non-smokers presenting with early-onset emphysema, marking the significance of familial screening and the potential benefit of augmentation therapy with plasma-purified human alpha-1 antitrypsin to slow disease progression. Nutritional support is vital in COPD management, as malnutrition and weight loss are common concerns due to increased metabolic demands and reduced appetite from dyspnea, so maintaining a balanced diet with adequate caloric and protein intake is emphasized to optimize pulmonary function and overall health. Smoking cessation is the most effective intervention for halting the progression of COPD and can lead to significant improvements in lung function over time, making support programs, counseling, and pharmacotherapy such as nicotine replacement therapy and varenicline critical components of long-term disease management. COPD exacerbations are acute episodes of worsening respiratory symptoms with increased frequency, severity, or production of sputum, often triggered by viral or bacterial infections, necessitating prompt treatment with bronchodilators, systemic corticosteroids, and antibiotics if indicated, to reduce hospital admissions and improve patient outcomes. The BODE index, which evaluates body mass index, airflow obstruction, dyspnea, and exercise capacity, is a multidimensional scoring system useful for predicting the prognosis of COPD patients by integrating clinical parameters to guide therapeutic decisions and discussions about disease progression and care plans. Chronic inflammation in COPD contributes to systemic effects such as skeletal muscle dysfunction, cardiovascular disease, and osteoporosis, requiring a multidisciplinary approach for management, including regular monitoring, appropriate pharmacotherapy, lifestyle interventions, and optimization of comorbid conditions. Regular vaccination against influenza and pneumococcal pathogens is recommended for COPD patients to reduce the risk of respiratory infections that can lead to exacerbations, hospitalization, and mortality, reinforcing the need for healthcare providers to prioritize immunizations as part of comprehensive COPD care. Psychological distress is prevalent among COPD patients, with depression and anxiety significantly affecting their quality of life and disease outcomes, highlighting the necessity of routine mental health evaluations and the provision of appropriate support, counseling, or pharmacotherapy when needed to address these issues effectively. Inhaler technique is critical in COPD management, as improper use can lead to suboptimal drug delivery and poor disease control, emphasizing the need for regular assessment and patient education on correct inhaler techniques to ensure maximum therapeutic benefit from prescribed medications. Nebulized drug delivery systems offer an alternative for COPD patients struggling with inhaler coordination, providing medication through a fine mist that is easier to inhale, particularly for individuals with severe disease or during exacerbations, ensuring adequate drug deposition and symptom relief. Dyspnea, or shortness of breath, is a hallmark symptom of COPD, often perceived as a constant or episodic air hunger by patients, which warrants timely assessment to differentiate from other potential causes, ensuring targeted interventions like pulmonary rehabilitation and optimized pharmacotherapy are implemented to enhance patient comfort and function. 22. Lung function decline in COPD occurs gradually, with annual reductions in FEV1 typically exceeding those seen with normal aging, thus highlighting the significance of early detection, consistent monitoring, and aggressive management strategies to slow disease progression and preserve lung capacity. 23. The Global Initiative for Chronic Obstructive Lung Disease (GOLD) guidelines provide a classification system for COPD severity based on the degree of airflow limitation, frequency of exacerbations, and patient-reported symptom burden, guiding the tailored pharmacological and non-pharmacological treatment approaches for individual patients. 24. Airway clearance techniques such as chest physiotherapy and the use of devices like the flutter valve or acapella are beneficial for COPD patients with chronic sputum production, facilitating mucus clearance and improving ventilation, hence preventing secondary infections and improving respiratory function. 25. Endoscopic lung volume reduction procedures, such as endobronchial valve placement, offer an innovative treatment option for patients with severe emphysema, aiming to collapse hyperinflated lung compartments and improve respiratory mechanics, thus enhancing exercise tolerance, pulmonary function, and quality of life. 26. Genetic factors alongside environmental exposures contribute to COPD development, with research indicating specific genetic variants influencing susceptibility to the disease, which underscores the potential for identifying at-risk individuals and developing novel prophylactic or therapeutic strategies through personalized medicine. 27. Breathlessness can exacerbate physical inactivity in COPD patients, resulting in a deconditioning cycle that worsens symptoms and disease outcomes, thus highlighting the importance of individualized exercise programs within pulmonary rehabilitation to break this cycle and promote better health and functionality. 28. Comorbidities such as cardiovascular disease, diabetes, and lung cancer are frequently associated with COPD, complicating disease management and prognosis, emphasizing the necessity for a comprehensive approach that includes routine screening, management of concurrent conditions, and coordinated patient care. 29. Exacerbations in COPD, characterized by a sudden worsening of symptoms, are multifactorial, with a large proportion attributed to respiratory infections and environmental pollutants, necessitating rapid management and preventive strategies, including medications and lifestyle interventions to reduce their occurrence. 30. COPD's economic burden is significant, impacting healthcare systems due to hospitalization, medication costs, and lost productivity, thereby stressing the importance of preventive measures, effective management strategies, and patient education to alleviate the financial burden associated with chronic disease. 31. Pulmonary function tests beyond spirometry, like diffusion capacity for carbon monoxide, DLCO, provide insights into gas exchange efficiency in COPD, which can help differentiate emphysema from other lung pathologies and tailor management strategies to the specific physiological impairments present in each patient. 32. Air pollution is a significant environmental risk factor for COPD exacerbations, with exposure to pollutants like particulate matter and ozone exacerbating symptoms, underscoring the need for strategies to minimize patient exposure and mitigate the health impacts of poor air quality on vulnerable populations. 3. A significant overlap exists between COPD and asthma, with some patients exhibiting characteristics of both, known as asthma-COPD overlap, ACO, necessitating a nuanced diagnostic and therapeutic approach that incorporates treatment regimens from both COPD and asthma guidelines for optimal management. 34. Opioid use in COPD for intractable dyspnea management should be carefully monitored due to the risk of respiratory depression, and is generally reserved for severe cases where other interventions have failed, requiring careful dose titration, monitoring, and evaluation to minimize potential adverse effects. 35. Combining long-acting beta-2 agonists, LABAs, and inhaled corticosteroids can be more effective for patients with frequent exacerbations and higher eosinophilic inflammation in managing COPD, working synergistically to improve lung function, quality of life, and reduce exacerbation frequency and severity. '36. Social support networks play an essential role in managing COPD, as they can provide emotional support, encourage adherence to treatment plans, and facilitate lifestyle changes, emphasizing the importance of engaging family members and care partners in the management process to optimize outcomes. 37. Sputum color and consistency in COPD can provide clues about potential infections, with changes often indicating bacterial colonization, thus guiding antibiotic selection when necessary, highlighting the necessity for healthcare providers to closely monitor these changes and adjust treatment accordingly. 38. Respiratory muscle training can improve respiratory muscle strength in COPD patients, enhancing exercise capacity and reducing the sensation of dyspnea, being an important component of pulmonary rehabilitation programs and contributing to better overall function and quality of life in these patients. 39. COPD can disrupt the sleep patterns of sufferers, often leading to poor sleep quality due to nocturnal breathlessness or frequent coughing, making the assessment and management of sleep disturbances an essential part of comprehensive COPD care to improve patient well-being and daytime functioning. 40. Individualized action plans for COPD patients detail steps to take in response to changes in symptoms or exacerbation warning signs, empowering patients to manage their condition proactively and reducing unnecessary emergency department visits, emphasizing the importance of patient education and engagement in COPD management. 41. Newer targeted therapies are being explored for COPD, focusing on the underlying inflammatory pathways and protease-antiprotease imbalances, which could offer future options to alter the disease process, although current management primarily revolves around symptom relief and exacerbation prevention. 42. Effective communication between COPD patients and their healthcare team is paramount, as it ensures a shared understanding of the disease, treatment goals, and management strategies, fostering adherence to complex therapeutic regimens, mitigating potential barriers, and enhancing patient autonomy and satisfaction. 43. Thromboembolic events are a known complication of COPD, likely due to systemic inflammation and hypoxia-related coagulation abnormalities, necessitating vigilance for signs of deep vein thrombosis or pulmonary embolism and the consideration of prophylactic anticoagulation in high-risk individuals to prevent adverse outcomes. 44. Gas trapping in COPD is a natural consequence of poor airflow and airway collapse during expiration, leading to hyperinflation which can impair respiratory mechanics and cardiac function, underscoring the need for treatments aimed at improving airflow and gas exchange to reduce hyperinflation and symptom burden. 45. Home monitoring devices, including pulse oximeters and spirometers, can empower COPD patients to track their health at home and facilitate early intervention for exacerbations, enhancing self-management skills and allowing for tailored adjustments to their treatment plans by healthcare professionals based on objective data. 46. COPD has a significant burden on mental health, heightening risks for anxiety and depression, which can exacerbate physical symptoms and hinder treatment adherence, necessitating regular psychological assessment and the integration of mental health support within the multidisciplinary care framework for optimal outcomes. 47. Exacerbations can be predicted in COPD by monitoring changes in symptoms, exposure to infection, or environmental pollutants, with machine learning models and wearable technology being developed to provide real-time risk assessment, enabling timely interventions and potentially reducing the frequency of these acute events. 48. Knowing the symptoms and etiology of COPD involves understanding the finely tuned balance of protease and antiprotease activity in the lungs which, when dysregulated due to smoking or genetic predisposition, leads to tissue destruction and the classical features of emphysema, stressing the complexity of pathophysiological pathways that require targeted interventions. 49. Comorbid respiratory infections can perpetuate COPD exacerbations, making the identification and management of pathogens, whether bacterial or viral, integral to reducing symptom burden and preventing further respiratory decline, necessitating vigilant diagnostic approaches and appropriate antimicrobial therapies. 50. The psychosocial aspects of living with COPD, such as the loss of independence and social isolation due to physical limitations, can greatly impact overall well-being, underscoring the importance of integrating social support services, therapy, and encouragement of self-efficacy within comprehensive COPD management programs. 1. In gastric cancer, the aberrant activation of the WNT beta-catenin signaling pathway significantly contributes to oncogenesis by promoting cellular proliferation, inhibiting apoptosis, and facilitating tumor invasion through down-regulated E-cadherin expression while enhancing vascular endothelial growth factor-mediated angiogenesis. 2. Precise staging in gastric cancer hinges on advancements in endoscopic ultrasonography, EUS, which surpasses conventional imaging methods by offering real-time, high-resolution evaluation of tumor invasion depth, T-stage, and regional lymph node involvement, end-stage, thereby guiding prognosis and therapeutic approach. 3. A Helicobacter pylori infection, a class 1 carcinogen, initiates chronic atrophic gastritis and mucosal inflammation, progressing to intestinal metaplasia and dysplasia before culminating in gastric adenocarcinoma, highlighting the bacterium's role in the precancerous cascade and underlining the significance of eradication programs. 4. Peritoneal dissemination, a frequent complication of gastric cancer metastasis, eludes conventional imaging techniques but can be sensitively detected through diagnostic laparoscopy, a crucial step in identifying non-visible carcinomatosis and avoiding futile surgical resections. 5. Tumor microenvironment alterations in gastric cancer encompass hypoxia-induced factor activation, leading to epithelial mesenchymal transition, EMT, and fostering resistance to chemotherapy while supporting immune evasion via upregulated programmed death ligand 1, PDL1, creating an immunosuppressive niche. 6. Despite its rarity in the Western Hemisphere, gastric cancer maintains a formidable global incidence, necessitating universal screening measures in high-risk regions such as East Asia, where endemic Helicobacter pylori prevalence and dietary carcinogens like nitrosamines prevail. 7. Immunotherapy, particularly the use of checkpoint inhibitors targeting PD-1 or PDL1, has emerged as a beacon of hope in advanced gastric cancer, offering durable responses in a subset of patients, although their efficacy is contingent upon biomarkers such as microsatellite instability, MSI, and tumor mutational burden. 8. Hereditary diffuse gastric cancer, HDGC, often resulting from germline mutations in the CDH1 gene encoding E-cadherin, mandates rigorous surveillance and consideration of prophylactic gastrectomy by age 40 for mutation carriers to preclude the development of signet ring cell carcinoma. 9. The application of next-generation sequencing, NGS, in gastric cancer has illuminated an array of actionable genomic alterations, providing a spectrum of targeted therapy options, including anti-HER2 therapies in ERBB2-amplified tumors and MET inhibitors in MET overexpressing cancers. Linitis plastica, a unique subtype of gastric cancer characterized by diffuse infiltration and thickening of the gastric wall leading to a stiff, non-distensible stomach, typically signals a poor prognosis with limited resectional success due to the pervasive tumor spread at diagnosis. Improved nutritional support, a critical component of gastric cancer management, involves multidisciplinary approaches focusing on preoperative optimization through enteral nutrition, essential for reducing postoperative complications and enhancing recovery in malnourished patients. Recent studies highlight the utility of liquid biopsies in gastric cancer, wherein circulating tumor DNA, ctDNA, serves as a non-invasive biomarker for early detection, monitoring treatment response, and identifying resistance mechanisms, fostering personalized, adaptive treatment strategies. Targeting angiogenesis in gastric cancer, notably through agents inhibiting VEGF signaling pathways, offers clinical value in subsets of patients, disrupting neovascularization crucial for tumor growth and metastasis, albeit with careful management of the associated thromboembolic risks. Palliative chemotherapy remains a cornerstone for managing advanced gastric cancer, prioritizing symptom relief and life quality improvement, with regimens such as FOLFOX and FOLFIRI leading the standard offerings supplemented with targeted biological agents in suitable genetic profiles. The integration of tumor-infiltrating lymphocyte (TIL) analyses within the histopathological evaluation of gastric cancer biopsies provides prognostic insights, with an abundant presence often correlating with improved survival outcomes and potential responsiveness to immunotherapeutic interventions. ROS-producing gastric cancer cells demonstrate an altered redox state, leveraging increased oxidative stress to activate survival pathways while promoting genomic instability. Thus, antioxidant defense targeting provides a promising therapeutic angle worth actively exploring. Patients with early gastric cancer detected through dedicated surveillance often benefit from endoscopic submucosal dissection (ESD), a minimally invasive technique ensuring curative resection with organ preservation in localized, non-ulcerated tumors confined to the mucosa and submucosa. Tumor-associated macrophages (TAMs) within the gastric cancer microenvironment exhibit plasticity, toggling between protumorigenic (M2) and anti-tumor (M1) phenotypes, thus serving as pivotal targets in immunomodulatory therapy perspectives geared toward reprogramming TAMs to suppress tumor progression. Gastric carcinogenesis in older adults often presents with distinctive molecular fingerprints and comorbid supportive care requirements, underscoring the importance of tailored therapeutic approaches balancing aggressiveness with the patient's physiological reserve and quality of life considerations. Lorien classification of gastric adenocarcinoma into intestinal and diffuse types remains crucial in prognosis determination and therapeutic decisions, given the differential response rates to conventional chemotherapeutic regimens and varying propensities for peritoneal dissemination. Neuroendocrine tumors of the stomach, though rare in comparison to adenocarcinomas, exhibit unique diagnostic markers such as chromogranin A and synaptophysin, necessitating specific management strategies including somatostatin analogs and surgical resection for localized disease. Heterogeneity in gastric cancer, governed by multiple histological and molecular subtypes, complicates treatment standardization. Hence, precise molecular profiling and histochemical analysis are crucial for tailoring individualized therapeutic regimens in the precision medicine paradigm. #23. The phenomenon of tumor budding, characterized by single cells or small clusters at the invasive front of gastric cancer, serves as a highly significant adverse prognostic predictor, correlating with aggressive behavior, lymphatic invasion, and early metastatic potential. #24. Specific perineural invasion in gastric cancer portends a graver prognosis, elucidating the tumor's predilection for local infiltration along nerve sheaths, necessitating vigilant histological assessment to inform comprehensive treatment planning and adjunctive radiotherapy consideration. #25. Tumor hypoxia in gastric cancer dynamically modulates crucial survival pathways such as HIF-1 alpha, promoting glycolytic metabolism, epithelial mesenchymal transition, and resistance to chemo and radiotherapy, unveiling potential vulnerabilities for therapeutic exploitation through hypoxia-modifying agents. #26. Non-invasive breath tests investigating volatile organic compounds, VOX, have been proposed as innovative diagnostic tools for gastric cancer, exploiting metabolic changes to differentiate cancer patients from healthy individuals, pending further validation for clinical implementation. #27. Gastric cancer-associated fibroblasts, CAF, foster a supportive stromal environment conducive to cancer cell proliferation and invasion by secreting growth factors, matrix remodeling enzymes, and modulating extracellular matrix components, marking them as key targets for stroma-disruptive therapies. #28. Radiofrequency ablation, RFA, for gastric cancer liver metastasis adds a minimally invasive option to local control strategies, significantly prolonging survival in selected cases and synergizing with systemic chemotherapy to enhance overall management outcomes. #29. Microsatellite instability, MSI, high status in gastric cancer not only predicts responsiveness to immune checkpoint inhibitors but also correlates with improved prognoses and distinct clinicopathological features, advocating for routine incorporation of MSI testing in diagnostic workups. #30. Complementary therapies such as traditional Chinese medicine, TCM, have shown promise in adjunctive gastric cancer management, achieving symptom palliation and quality of life improvement, underscoring the importance of integrating evidence-based complementary approaches within mainstream oncology practice. #31. Amplified research into the gut microbiota gastric cancer axis posits that dysbiosis can modulate immune responses and therapeutic outcomes, suggesting the vast potential of microbiome-targeted interventions to enhance patient prognoses and therapy efficacies. #32. The prophylactic use of aspirin in patients at high risk for gastric cancer is undergoing investigation, hinged on its anticarcinogenic properties achieved through cyclooxygenase 2, COX2, inhibition, albeit balanced against gastrointestinal bleeding risks necessitating thorough risk assessments. #33. Positive Epstein-Barr virus, EBV, status in gastric cancer has emerged as a distinct molecular subtype associated with lymphoepithelioma-like histology, heavy lymphoid infiltration, and exclusive therapeutic vulnerabilities amenable to immune-modulating agent exploitation. #34. The innovative use of artificial intelligence algorithms in gastric cancer has unlocked novel pathways for enhancing diagnosis accuracy, prognostic modeling, and treatment stratification, exemplifying a pioneering frontier in augmenting oncological clinical decision support systems. #35. Vitamin and micronutrient supplements, particularly vitamin D and selenium, are subjects of ongoing inquiry into their potential roles in gastric cancer risk reduction and survivorship care, reflecting a growing focus on lifestyle interventions in cancer prevention paradigms. 36. Synchronous and metachronous gastric cancer involvement necessitates stringent surveillance post-resection, with ongoing follow-up endoscopy to detect secondary malignancies, providing early intervention opportunities that may bolster long-term survival prospects. 37. Predictive nomograms in gastric cancer integrate diverse clinical, pathological, and molecular markers, formulating individualized survival and recurrence estimations, which can be instrumental in informing patient-centric therapeutic decision-making and care planning. 38. Photodynamic therapy, PDT, offers a novel technique for superficial gastric cancer ablation, employing light-activated photosensitizers to selectively induce cytotoxicity, thereby furnishing an option for patients ineligible for standard surgical procedures or as palliative treatment. 39. The CHEK2 gene mutation, associated with heightened cancer susceptibility, extends its implications to gastric cancer predisposition, requiring vigilant genetic counseling and monitoring in affected families to preemptively address emergent malignancies. 40. Intratumor heterogeneity in gastric cancer, manifested by distinct subclonal populations, influences treatment responsiveness and therapeutic resistance, necessitating comprehensive sampling and advanced sequencing approaches to effectively tailor multimodal interventions. 41. The implementation of enhanced recovery after surgery, ERAS, protocols in gastric cancer resection aims to minimize hospital stays, expedite functional recovery, and curb postoperative complications via multidisciplinary tactical measures harmonizing patient perioperative care. 42. P53 mutation status in gastric cancer represents a crucial determinant in prognostication, potentially guiding therapeutic selections, as its loss of function often signals aggressive behavior and poor clinical outcomes, pointing to the importance of integrating genetic profiling in routine diagnosis. 43. The identification and manipulation of long non-coding RNAs, LNCRNAs, in gastric cancer research have uncovered a wealth of novel biomarkers and therapeutic targets, spotlighting their role in oncogenic signaling cascades, metastasis, and chemoresistance, thereby enriching innovative therapy development. 44. Ethnopharmacological investigations into natural compounds, notably curcumin and resveratrol, demonstrate tentative anticancerous effects against gastric cancer cell lines, proposing an expansive trajectory for phytochemicals in complementary therapy refining and integrative cancer management. 45. Gastric cancer treatment paradigms continue to evolve, embracing hyperthermic intraperitoneal chemotherapy, HIPEC, as an adjunct to cytoreductive surgery in peritoneal metastasis, showing promise in prolonging survival and restricting local recurrence in meticulously selected patient cohorts. 46. The HER2 positivity in gastric adenocarcinomas, markedly present among a subset of patients, is capitalized upon in precision oncology through the administration of trastuzumab-based regimens, vindicating the stratification of patients by HER2 status to enhance targeted treatment efficacy. 47. CD44, a prominent stem cell marker, defines a self-renewing subpopulation in gastric cancer that drives tumorigenicity and therapeutic resistance, substantiating urgent research into CSC-targeted strategies intended to thwart gastric cancer relapse and metastasis. 48. Telemedicine platforms offer burgeoning potential in gastric cancer care, enabling remote patient monitoring, continuity of care, and prompt management of treatment adverse effects, thus extending healthcare accessibility, particularly in underserved and geographically isolated populations. 49. Exploring epigenetic regulations, such as DNA methylation and histone modification angles in gastric cancer, unfolds an intricate landscape of silenced tumor suppressors and activated oncogenes, providing fertile ground for devising epigenetic modifier-based treatments with precision. 50. Altered glucose metabolism in gastric cancer, underscored by elevated aerobic glycolysis, known as the Warburg effect, marks a physiological advantage for tumor growth and survival under hypoxic conditions, channeling intrigue toward metabolism-targeted therapies for effective cancer elimination. 1. Parkinson's disease, a neurodegenerative disorder, primarily results from the death of dopamine-producing neurons in the substantia nigra, a region of the midbrain crucial for controlling smooth movements, leading to the hallmark symptoms of tremors, rigidity, bradykinesia, and postural instability. 2. Traditional diagnosis of Parkinson's disease relies heavily on clinical evaluation, where neurologists observe motor symptoms and response to dopaminergic therapy, but innovative approaches now include the use of DAT-scan imaging to visualize dopamine transporter levels and differentiate Parkinson's from other movement disorders. 3. The pathophysiology of Parkinson's disease includes the misfolding and aggregation of alpha-synuclein proteins, forming Lewy bodies in neurons, which disrupt cellular processes and contribute to neuronal degeneration and the progressive nature of the disease. 4. Levodopa, a precursor to dopamine, remains the gold standard for symptomatic treatment of Parkinson's disease, its effectiveness rooted in its ability to replenish depleted dopamine levels in the brain, though long-term use may lead to motor complications such as dyskinesias. 5. Parkinson's disease non-motor symptoms, such as depression, anxiety, sleep disturbances, and cognitive decline, often precede motor symptoms and are increasingly recognized as key aspects of disease management due to their significant impact on quality of life. 6. Deep brain stimulation, DBS, an innovative surgical treatment for Parkinson's disease, involves the implantation of electrodes in the brain, typically targeting the subthalamic nucleus or globus pallidus internus, which modulates abnormal electrical impulses and alleviates motor symptoms. 7. Genetic factors play a critical role in Parkinson's disease, with mutations in genes such as LRRK2, PARK7, and GBA identified as contributors to familial cases, while emerging research explores gene therapy as a means to target these genetic components directly to slow disease progression. 8. The Braak staging model theorizes that Parkinson's disease pathology begins in the gut and olfactory system, moving upward to affect brain regions responsible for motor control, suggesting a potential biomarker in the early gastrointestinal symptoms for early diagnosis. 9. Exercise has been shown to have neuroprotective effects in Parkinson's disease by promoting neuroplasticity and improving motor function, with studies indicating that regular physical activity may slow the progression of the disease and enhance quality of life for patients. 10. The role of oxidative stress and mitochondrial dysfunction in Parkinson's disease pathogenesis is highlighted by evidence showing that impaired mitochondrial respiratory chain activity leads to increased production of reactive oxygen species, contributing to neuronal damage and disease progression. 11. Epidemiological studies have identified several environmental risk factors for Parkinson's disease, including exposure to pesticides, heavy metals, and industrial solvents, all of which are thought to inhibit mitochondrial function and contribute to neuronal cell death. 12. Impulsive and compulsive behaviors, known as impulse control disorders, are potential side effects of Parkinson's disease medications, particularly dopaminergic therapy, emphasizing the need for careful monitoring and potential behavioral interventions in susceptible individuals. 13. Neuroinflammation, characterized by activated microglia and increased levels of pro-inflammatory cytokines, is posited as a contributing factor in Parkinson's disease pathophysiology, offering a target for future therapeutic strategies aiming to dampen inflammatory responses in the brain. Alpha-synuclein, a protein central to Parkinson's disease pathology, is not only involved in Lewy body formation but also in the disruption of synaptic vesicle trafficking and neurotransmitter release, which contributes to the complex network dysfunction observed in affected individuals. 15. The progression of Parkinson's disease is highly variable among individuals, with some experiencing rapid motor decline while others show a more gradual progression, underscoring the importance of personalized medicine approaches to tailor treatment plans and improve outcomes. 16. Retinal changes in Parkinson's disease, detectable through non-invasive optical coherence tomography, provide insights into neurodegenerative processes and have been proposed as potential biomarkers for early disease detection and monitoring of therapeutic effects. 17. Autophagy, the cellular process of degrading and recycling damaged components, is impaired in Parkinson's disease, leading to the accumulation of toxic proteins in damaged organelles, and therapeutic strategies aimed at enhancing autophagy are being explored as a means to halt disease progression. 18. Voice and speech disturbances, such as hypophonia and dysarthria, are common in Parkinson's disease due to the impact on motor coordination and respiratory control, and targeted speech therapy can significantly improve communication abilities and patient quality of life. 19. The gut-brain axis in Parkinson's disease is an emerging field of study, with research indicating that intestinal microbiota dysbiosis may influence neuroinflammation and alpha-synuclein propagation, offering potential therapeutic avenues that target gut health. 20. Neuroprotective strategies in Parkinson's disease focus on slowing disease progression through interventions that enhance neuronal survival, such as the use of antioxidants, anti-inflammatory compounds, and agents that stabilize mitochondrial function and cellular energy production. 21. LRRK2 inhibitors are a promising class of drugs under investigation in Parkinson's disease, aiming to mitigate the hyperactivity of the LRRK2 protein, which is implicated in both familial and sporadic cases, thereby reducing neuronal damage and potentially slowing the disease course. 22. Cognitive decline in Parkinson's disease, known as Parkinson's disease dementia, PDD, is associated with cortical and subcortical changes, with cholinesterase inhibitors like rivastigmine being utilized to manage cognitive symptoms and improve daily functioning in affected individuals. 23. The non-invasive technique of transcranial direct current stimulation, TDCS, is being explored as a therapeutic option in Parkinson's disease, with studies suggesting it can modulate cortical excitability and enhance motor learning, offering a complementary approach to traditional therapies. 24. Olfactory dysfunction is one of the earliest non-motor symptoms of Parkinson's disease, occurring in up to 90% of patients, and the loss of smell may precede the onset of motor symptoms by several years, providing a potential early marker for disease diagnosis. 25. Monoamine oxidase B, MAO-B, inhibitors, such as selegiline and rasagiline, improve Parkinson's disease motor symptoms by blocking the breakdown of dopamine in the brain, thereby prolonging its action and enhancing the efficacy of other dopaminergic treatments. 26. Dysphagia, or difficulty swallowing, affects approximately 50% of Parkinson's disease patients, posing significant risks of aspiration and malnutrition, and comprehensive management including dietary modifications and swallowing therapy is crucial for patient safety and quality of life. 27. REM sleep behavior disorder, RBD, is a sleep disorder commonly associated with Parkinson's disease, characterized by vivid dreams and lack of muscle atonia during REM sleep, and may serve as a prodromal marker indicating increased risk for developing Parkinson's or related neurodegenerative diseases. 28. Neurotrophic factors such as glial cell line-derived neurotrophic factor, GDNF, are being investigated for their ability to support neuron survival and axon growth in Parkinson's disease, with clinical trials exploring their potential as disease-modifying therapies. The concept of freezing of gait in Parkinson's disease, where patients experience sudden episodes of immobility, is thought to arise from impaired neural circuits involved in locomotion, and rehabilitative strategies such as rhythmic auditory cues are employed to overcome these episodes. 30. Functional MRI, fMRI, studies in Parkinson's disease reveal altered connectivity patterns in brain networks responsible for motor and cognitive function, offering insights into disease progression and potential targets for non-pharmacological interventions such as cognitive training. 31. Histone deacetylase (HDAC) inhibitors are being explored as potential therapeutic agents in Parkinson's disease, aiming to modulate gene expression and protect neurons from degeneration by promoting a neuroprotective histone acetylation state. 32. The link between sleep disturbances and Parkinson's disease progression is being scrutinized, with poor sleep quality exacerbating both motor and non-motor symptoms, and interventions targeting sleep hygiene and disorders are shown to improve overall patient outcomes. 3. Balance dysfunction and fall risk in Parkinson's disease are linked to alterations in proprioceptive feedback and postural control, prompting the development of balance training programs that incorporate elements such as Tai Chi and dance to improve stability and reduce falls. 34. The fascinating phenomenon of neuroplasticity in Parkinson's disease, where the brain adapts to changes brought about by neurodegeneration, is being harnessed through interventions like cognitive behavioral therapy and task-specific rehabilitation to enhance functional outcomes. 35. Advances in wearable technology provide real-time monitoring of Parkinson's disease symptoms, enabling clinicians to obtain objective data on movement patterns, medication effectiveness, and disease progression, thus paving the way for personalized management strategies. 36. Anosmia, or loss of smell, in Parkinson's disease is thought to result from early deposition of alpha-synuclein in the olfactory bulb, providing a unique diagnostic clue that combines clinical observation with pathophysiological insight into the disease's early manifestations. 37. Neurovascular dysfunction in Parkinson's disease, characterized by alterations in the blood-brain barrier and cerebral blood flow, is proposed as a contributing factor in disease pathogenesis, prompting research into therapeutic strategies that target vascular health. 38. Apomorphine, a potent dopamine agonist, is used in Parkinson's disease to manage sudden, off episodes where motor symptoms re-emerge due to fluctuating medication levels, administered either subcutaneously or via continuous infusion for rapid symptom relief. 39. The role of iron accumulation and its interaction with alpha-synuclein in Parkinson's disease is garnering attention, as excess iron in the substantia nigra is thought to exacerbate oxidative stress and promote neurodegeneration, highlighting the potential for iron-targeted therapies. 40. Gastrointestinal dysfunction in Parkinson's disease, such as constipation and gastroparesis, is prevalent due to autonomic nervous system involvement, necessitating comprehensive management including dietary adjustments, prokinetic agents, and fiber supplements to alleviate symptoms. 41. The concept of neuroinflammation in Parkinson's disease extends beyond microglial activation, encompassing the detrimental role of peripheral immune system alterations, which may contribute to the progression of neurodegeneration and provide new avenues for therapeutic intervention. 42. The phenomenon of neurogenesis, or the generation of new neurons, remains impaired in Parkinson's disease, particularly in regions such as the hippocampus, prompting exploration of pharmacological and lifestyle interventions designed to stimulate this process and support brain regeneration. 43. Disruption in calcium homeostasis is implicated in Parkinson's disease pathophysiology, as abnormalities in calcium signaling and mitochondrial calcium overload are associated with neuronal death, and calcium channel blockers are being investigated for their neuroprotective potential. 44. Sexual dysfunction in Parkinson's disease, affecting both men and women, can result from a combination of neurochemical imbalances, medication side effects, and psychological factors, warranting a multidisciplinary approach that encompasses medical, psychological, and relationship counseling. 45. The use of cannabis derivatives, such as CBD oil, is under study for Parkinson's disease symptom management, with anecdotal evidence suggesting potential benefits for alleviating motor symptoms and anxiety, though rigorous clinical trials are needed to validate efficacy and safety. 46. The phenomenon of anosognosia, where patients with Parkinson's disease exhibit a lack of awareness of their motor impairments, may stem from altered neural connectivity in self-monitoring networks, complicating disease management and underscoring the need for caregiver support. 47. The gut microbiota's role in Parkinson's disease is a burgeoning area of research, with associations between specific bacterial strains and symptom severity suggesting that modulating gut flora through diet or probiotics may influence disease trajectory and improve patient outcomes. 48. Agonists targeting the adenosine A2A receptor are being developed for Parkinson's disease to exert neuroprotective effects, showing promise in reducing neuroinflammation and improving motor symptoms, potentially complementing existing dopaminergic therapies. 49. The emergence of wearable exoskeletons provides an innovative approach to assisting individuals with Parkinson's disease in maintaining mobility and independence, offering mechanical support and enhancing motor function through collaborative movement control. 50. Advances in precision medicine for Parkinson's disease focus on unraveling the individual genetic, environmental, and lifestyle factors contributing to disease variability, enabling the development of tailored treatment regimens that optimize therapeutic outcomes and mitigate side effects. 1. Non-alcoholic fatty liver disease, NAFLD, the hepatic manifestation of metabolic syndrome, is characterized by excessive fat accumulation in liver cells, often due to insulin resistance, and is the most common cause of chronic liver disease worldwide, affecting nearly 1 billion individuals and potentially leading to more severe liver conditions such as non-alcoholic steatohepatitis, NASH, fibrosis, cirrhosis, or hepatocellular carcinoma if left unchecked over the years. 2. The pathophysiology of fatty liver disease involves a two-hit hypothesis where the first hit is the accumulation of triglycerides in the hepatocytes, creating a state vulnerable to lipotoxicity, and the second hit involves oxidative stress, cytokines, and mitochondrial dysfunction that progress hepatic inflammation and fibrosis, emphasizing the complexity and multifactorial nature of this condition. 3. Magnetic resonance imaging, MRI, proton density fat fraction, PDFF, is emerging as a non-invasive gold standard for quantifying hepatic steatosis in NAFLD, providing a comprehensive assessment of liver fat content that is more precise than ultrasound and CT and lacking the invasiveness and risks associated with liver biopsy, thus contributing to better disease management and monitoring of therapeutic responses. 4. The primary treatment approach for non-alcoholic fatty liver disease focuses on lifestyle interventions, primarily weight loss through dietary modifications and increased physical activity, with evidence showing that a modest reduction of 5 to 10% in body weight can significantly reduce liver fat, ameliorate inflammation and fibrosis, and improve overall liver function, often reversing fatty liver changes. Five. The use of vitamin E as a therapeutic agent in non-alcoholic steatohepatitis has gained traction due to its antioxidant properties, with studies demonstrating that high-dose vitamin E supplementation can improve liver histology, reduce hepatic inflammation, and increase indices of liver function in non-diabetic NASH patients, although caution is advised regarding long-term use and potential cardiovascular risks. 6. In NAFLD, the liver enzyme alanine aminotransferase (ALT) is often elevated. However, normal ALT levels do not exclude the presence of significant liver damage, emphasizing the importance of considering a full panel of liver function tests alongside imaging techniques and histological assessment when diagnosing and monitoring this stealthy and often silent hepatic condition. 7. Advances in our understanding of gut-liver axis dysregulation in NAFLD have highlighted the role of dysbiosis and intestinal permeability in promoting hepatic fat accumulation and inflammation, pointing to the therapeutic potential of probiotics, prebiotics, and fecal microbiota transplantation in modulating gut microbiota composition and function as a novel avenue for treatment. Eight. Insulin resistance is a crucial player in the pathogenesis of non-alcoholic fatty liver disease, where excessive lipolysis and increased free fatty acid influx into the liver, driven by hyperinsulinemia, play a pivotal role in hepatic fat deposition, reinforcing the interconnectivity between metabolic disturbances and liver health, and supporting the utilization of insulin-sensitizing agents like metformin in some patient populations. 9. Hepatocyte apoptosis, mediated by pathways involving endoplasmic reticulum stress and death receptor activation, is a significant contributor to liver injury and progression in NAFLD, suggesting that agents targeting these apoptotic pathways could offer novel therapeutic benefits by interrupting this self-perpetuating cycle of liver cell death and fibrogenesis. 10. Detection of genetic polymorphisms such as in the PNPLA3 gene highlights a genetic predisposition that significantly influences individual susceptibility to fatty liver disease in its progression, thus directing research towards personalized medicine approaches where genetic screening could inform risk assessment, prognosis, and tailored therapeutic strategies. 11. Bariatric surgery, particularly Roux-en-Y gastric bypass, has emerged as a highly effective treatment for morbidly obese patients with NAFLD, resulting in substantial and sustained weight loss, resolution of hepatic steatosis, and regression of fibrosis, positioning it as a viable option in severe cases where conservative management has failed and the risk of progression is high. 12. The mitochondrial dysfunction observed in NAFLD stems from impaired oxidative phosphorylation and an increase in reactive oxygen species, which contribute to steatosis, cellular damage, and fibrosis, indicating a potential therapeutic role for agents aimed at enhancing mitochondrial function and protecting against oxidative stress in the treatment landscape. 13. Obstructive sleep apnea, OSA, has been identified as a contributing factor to the progression of NAFLD through mechanisms involving intermittent hypoxia and sympathetic activation, making the treatment of OSA with continuous positive airway pressure, CPAP, a potentially beneficial adjunct in slowing disease progression and improving liver health. 14. Although traditionally associated with alcohol, steatohepatitis can develop in non-drinkers who consume excessive fructose, which is metabolized in the liver, resulting in de novo lipogenesis and increased triglyceride synthesis, underlining the impact of dietary choices on liver health and the importance of reducing fructose intake for NAFLD patients. 15. The concept of metabolic-associated fatty liver disease, MAFLD, has been proposed to more accurately reflect the metabolic underpinnings and multisystem involvement of fatty liver disease, emphasizing the transition towards a diagnostic approach that integrates metabolic risk factors, allowing for better stratification and management in clinical practice. 16. Emerging evidence suggests that certain medications, such as statins and SGLT2 inhibitors, not only manage associated metabolic conditions but also provide ancillary benefits for liver health, including reductions in liver fat and fibrosis, showcasing the potential of repurposing existing cardiometabolic medications to tackle the hepatic sequelae of metabolic syndrome. (17) Choline, an essential nutrient found in eggs, meat, and fish, plays an important role in preventing liver steatosis by assisting in lipoprotein assembly and VLDL secretion, reinforcing the nutritional importance of adequate choline intake and the potential consequences of deficiency in exacerbating fatty liver conditions. (18) Hepatic macrophages, or Kupffer cells, are key drivers of inflammation in fatty liver disease through the production of pro-inflammatory cytokines, which contribute to the exacerbation of liver injury and fibrosis. Thus, modulating the activity of these immune cells represents a promising therapeutic avenue to mitigate liver inflammation and progression. (19) Ethnic variations in the prevalence and severity of NAFLD suggest that genetic, lifestyle, and environmental factors intersect to influence disease distribution, with studies demonstrating higher susceptibility among Hispanic individuals, highlighting the need for culturally tailored interventions and awareness campaigns that address specific risks and misconceptions. (20) Omega-3 fatty acids, abundant in fish oils, have been shown to reduce liver fat, inflammation, and triglyceride levels, indicating their potential as a supportive therapy in NAFLD management, especially for individuals who may not respond adequately to lifestyle changes alone, and underscoring the importance of dietary management in liver health. (21) The endocannabinoid system is increasingly recognized as a crucial modulator of hepatic energy storage, inflammation, and fibrosis in NAFLD, thus emerging as a potential target for treatment. Cannabinoid receptor antagonists, despite controversy, offer exciting possibilities for intervening in this pathway and controlling disease progression. (22) The presence of liver fibrosis in NAFLD significantly increases the risk of adverse outcomes, making fibrosis staging vital in risk stratification and management decisions, with non-invasive biomarkers and elastography techniques offering reliable alternatives to liver biopsy, providing accessible and safer methods for assessing fibrosis risk. (23) Identifying and managing comorbid conditions such as type 2 diabetes, hypertension, and dyslipidemia is crucial in NAFLD management, as these conditions share underlying pathophysiological links with liver disease and can exacerbate NAFLD progression, necessitating a comprehensive and multidisciplinary approach for optimal outcomes. (24) Alcoholic fatty liver disease and non-alcoholic fatty liver disease share similar histological features, making clinical distinction based on history and risk factors essential for diagnosis, with alcohol abstinence serving as a critical and effective intervention for those with alcohol-related liver disease, whereas lifestyle changes remain foundational for NAFLD. (25) Given the silent nature of early-stage NAFLD, routine screening for fatty liver in patients with obesity, metabolic syndrome, or type 2 diabetes is recommended to facilitate early diagnosis and intervention, underscoring the importance of awareness and vigilance in primary care and the potential benefit of periodic liver assessments in at-risk populations. (26) Leptin resistance, often noted in individuals with obesity, contributes to steatosis by impairing the regulation of appetite and energy expenditure and promoting pro-inflammatory cytokines that exacerbate liver inflammation and fibrosis, presenting a target for novel therapies aimed at restoring leptin sensitivity and breaking the cycle of metabolic dysregulation. 27. The prevalence of pediatric NAFLD is rising alarmingly, mirroring the increase in childhood obesity, with studies indicating that early onset of fatty liver can predispose youth to severe liver complications in adulthood, highlighting the urgency for public health interventions focusing on diet, physical activity, and lifestyle in childhood and adolescence. The gut-derived hormone fibroblast growth factor 19, FGF19, is implicated in the regulation of bile acid synthesis and glucose metabolism. Its therapeutic modulation offers intriguing prospects for correcting metabolic dysfunction and reducing liver fat content in patients with NAFLD, representing a promising area for novel therapeutic development. 29. Studies on liver fat quantification techniques have illuminated the efficacy of controlled attenuation parameter, CAP, via transient elastography, which provides a reliable, non-invasive, and widely accessible method for assessing hepatic steatosis, facilitating early diagnosis and monitoring while circumventing the risks and discomfort of liver biopsy. 30. Gender differences in NAFLD reveal that men tend to develop the disease earlier, while women, particularly postmenopausal women, face a higher risk of disease progression, suggesting the influence of hormonal factors in disease dynamics and underlining the importance of gender-specific research and treatment approaches. 31. Pharmacological interventions targeting the insulin pathway, such as thiazolidinediones, are undergoing investigation to address insulin resistance in NAFLD patients, offering potential benefits in reducing liver fat, inflammation, and fibrosis, although balanced against potential side effects such as weight gain and cardiovascular risk. 32. Ectopic fat deposition, not only in the liver but also in muscles and the pancreas, constitutes an important aspect of the metabolic disturbances associated with NAFLD, highlighting the interconnected nature of metabolic health and the necessity for interventions that address overall body composition and systemic insulin sensitivity. 3. Oxidative stress biomarkers such as melandialdehyde and 8-isoprostane provide valuable insights into the oxidative damage occurring in NAFLD, serving as potential diagnostic and prognostic tools for assessing the severity and progression of the disease and guiding antioxidant-based therapeutic strategies. 34. Emerging research into the role of bile acids and the farnesoid X receptor, FXR, in NAFLD pathogenesis underscores their influence on lipid metabolism, hepatic inflammation, and fibrosis, identifying FXR agonists as promising candidates in the development of targeted therapeutics aimed at mitigating disease progression. 35. The utilization of artificial intelligence and machine learning in analyzing electronic health records and imaging data holds great promise for enhancing the accuracy of NAFLD diagnosis and risk stratification, expediting the identification of high-risk individuals, and optimizing personalized treatment plans in a rapidly evolving healthcare landscape. 36. The increase in lipotoxic intermediates such as diacylglycerol and ceramides in the liver has been linked to insulin resistance and hepatic inflammation, pointing to these lipid species as potential therapeutic targets in efforts to reduce liver fat accumulation and improve insulin sensitivity in patients with NAFLD. 37. Advanced glycation end products, AGEs, accumulate in NAFLD due to high blood sugar levels and oxidative stress, contributing to liver inflammation and fibrosis, and emphasizing the importance of managing glycemic control and reducing dietary AGE intake as part of a comprehensive liver health strategy. 38. Studies indicate a pivotal shift in lipid droplet biology and homeostasis within hepatocytes during NAFLD, with proteins involved in droplet formation and breakdown offering insights into novel therapeutic targets focused on normalizing lipid storage and mobilization processes within the liver. 39. Visceral adiposity is closely linked to NAFLD, with evidence suggesting that reduction of visceral fat through targeted interventions such as aerobic and resistance exercise significantly diminishes liver fat and inflammation, reinforcing the importance of managing central obesity as a cornerstone of NAFLD prevention and treatment. 40. Various cellular types within the liver, including hepatic stellate cells and ductular reaction cells, contribute to fibrogenesis in NAFLD through the secretion of extracellular matrix proteins, highlighting the diverse cellular contributions to liver fibrosis and the need for therapies targeting multiple cellular and molecular pathways. Plasma biomarkers like cytokeratin 18 fragments offer non-invasive means of diagnosing steatohepatitis in NAFLD patients by reflecting hepatocyte apoptosis, providing an important diagnostic alternative that may guide treatment decisions and evaluate responses without resorting to invasive liver biopsy techniques. 42. Disruption of circadian rhythms, often due to modern lifestyle patterns like shift work and poor sleep hygiene, can exacerbate metabolic disorders such as NAFLD by altering hepatic glucose and lipid metabolism, underlining the potential benefits of chronotherapeutic approaches that align treatment and lifestyle modifications with natural circadian rhythms. 43. Using dietary supplements like berberine, an alkaloid derived from plants, has shown promise in improving insulin sensitivity, reducing hepatic steatosis, and exerting overall beneficial metabolic effects, suggesting an additional, complementary role in managing NAFLD when combined with lifestyle interventions. 44. Iron overload, often detected through elevated serum ferritin levels in NAFLD patients, has been associated with increased hepatic inflammation and fibrosis, advocating for the assessment of iron status in NAFLD management and considering therapeutic phlebotomy or iron chelation as potential interventions in cases of significant iron burden. 45. The inconspicuous clinical course of NAFLD contrasts with its potential for serious complications, necessitating vigilant, regular follow-ups, including metabolic health assessments and liver function tests, to promptly identify transitions to more advanced liver disease and initiate timely interventions. 46. Genetic studies of NAFLD have also identified contributions from variants like TM6SF2 and GCKR, further elucidating the complex heritability and genetic risk factors involved in susceptibility and progression, reinforcing the potential for future genetic screening approaches to personalize and optimize patient management. 47. Pharmacological advances in the form of dual peroxisome proliferator activated receptor (PPAR) agonists are currently under investigation as potential NAFLD treatments due to their capacity to modulate lipid metabolism, reduce inflammation, and improve insulin sensitivity, offering a promising multifaceted approach to care. 48. Inflammation in NAFLD is driven not just by classic cytokines like TNF-alpha but also by novel mediators like TGF-beta and IL-1-beta, highlighting the importance of targeted anti-inflammatory strategies that can halt the progressive nature of this disease and address underlying molecular inflammations. 49. The measurement of liver stiffness via elastography provides an indirect yet valuable assessment of liver fibrosis in NAFLD patients, offering a non-invasive diagnostic tool that stratifies fibrosis risk and guides clinical decision-making in managing the disease without the need for invasive procedures. 50. Emerging therapeutic strategies for NAFLD include targeting microRNAs, which regulate gene expression involved in lipid metabolism, fibrogenesis, and inflammation, representing a new frontier in the molecular treatment of NAFLD and offering exciting possibilities for future pharmacologic development. 51. 1. Liver cirrhosis, a condition often resulting from chronic alcohol consumption or viral hepatitis, is characterized by irreversible scarring of liver tissue, impairing its ability to detoxify the blood and produce vital proteins, which can result in a range of complications from ascites to hepatic encephalopathy, a state of confusion and altered mental status caused by the accumulation of toxins in the brain not processed by the failing liver. 2. The pathophysiology of liver cirrhosis involves progressive fibrosis, where the deposition of collagen by stellate cells in the liver disrupts normal architecture, leading to nodules that impede blood flow and induce portal hypertension, a dangerous rise in blood pressure within the portal vein system that can lead to esophageal varices and life-threatening bleeding. 3. Liver cirrhosis can be clinically diagnosed through a combination of patient history, physical examination, blood tests showing elevated liver enzymes and bilirubin, imaging studies revealing nodular liver surfaces, and confirmed by liver biopsy, which shows the extent of fibrosis and architectural distortion fundamental to staging the disease. 4. In patients with liver cirrhosis, portal hypertension can trigger the development of varices, particularly in the esophagus and stomach, where the increased pressure forces blood into collateral vessels, posing a risk for rupture and extensive upper gastrointestinal bleeding, which requires preventive treatment with beta blockers or endoscopic band ligation. 5. One crucial aspect of managing liver cirrhosis is monitoring for signs of hepatic encephalopathy, an often reversible complication characterized by cognitive decline, personality changes, and motor disturbances, which can be precipitated by factors like gastrointestinal bleeding, infection, or electrolyte imbalances, and is commonly treated with lactulose and rifaximin to decrease ammonia levels. 6. Ascites, the accumulation of fluid in the abdominal cavity due to liver cirrhosis, is primarily caused by portal hypertension and hypoalbuminemia, and can lead to abdominal distension and discomfort. Treatment strategies include salt restriction, diuretics such as spironolactone and furosemide, and possibly paracentesis or transjugular intrahepatic portosystemic shunt, TIPS, in refractory cases. 7. Although liver transplantation remains the definitive treatment for liver cirrhosis in selected patients, the development of newer antifibrinogen therapies focusing on halting or reversing the fibrotic process is a promising frontier in cirrhosis management, potentially changing the natural history of the disease by targeting pathways involved in stellate cell activation and fibrogenesis. 8. One innovative approach in treating liver cirrhosis involves utilizing mesenchymal stem cells, which exhibit an anti-inflammatory and antifibrotic potential, providing hope in reducing liver fibrosis by modulating the immune response, reducing collagen deposition, and promoting regeneration of damaged hepatic tissue through paracrine signals. 9. Non-alcoholic steatohepatitis, NASH, a subtype of non-alcoholic fatty liver disease, NAFLD, can progress to cirrhosis through ongoing inflammation and steatosis-driven fibrosis, underscoring the importance of lifestyle modifications, such as weight loss and dietary interventions, in slowing disease progression and reducing liver transplant needs. 10. Recent advancements in imaging techniques, such as elastography, which uses ultrasound or MRI to measure liver stiffness, offer a non-invasive means of assessing liver fibrosis and approximating cirrhosis severity, guiding treatment decisions and reducing the reliance on invasive liver biopsy procedures for ongoing disease monitoring. 11. Patients with liver cirrhosis should be regularly screened for hepatocellular carcinoma, HCC, since chronic liver damage significantly increases the risk of developing primary liver cancer, with surveillance protocols typically including ultrasound examinations and alpha-fetoprotein, AFP, blood levels every 6 months to detect malignancy at an early, potentially curable stage. 12. Hepatorenal syndrome, a serious consequence of liver cirrhosis characterized by renal failure, arises due to alterations in blood flow and vascular resistance within the kidneys from severe portal hypertension and splanchnic vasodilation, necessitating interventions to restore hemodynamics, such as albumin infusion and the use of vasoconstrictors like terlipressin. The Child-Pugh score, a pivotal tool in the management of liver cirrhosis, stratifies patients based on clinical and laboratory findings, including bilirubin, albumin levels, ascites presence, encephalopathy grade, and prothrombin time, into categories indicating disease severity and aiding in predicting prognosis and guiding therapeutic interventions. Cirrhosis management extends beyond liver-focused treatments, emphasizing the importance of managing comorbid conditions like malnutrition, vitamin deficiencies, particularly fat-soluble vitamins, and metabolic bone disease, as impaired liver function affects nutrient metabolism, highlighting the need for comprehensive nutritional assessments and interventions. Emerging genetic studies in liver cirrhosis have identified various single nucleotide polymorphisms, SNPs, associated with an increased propensity for fibrosis progression, offering a personalized medicine approach wherein genetic predispositions can guide surveillance and potentially targeted interventions to delay or prevent cirrhosis. In cirrhotic patients with coagulopathy, a misunderstood aspect of liver pathology, the complex changes in coagulation factors can result in a paradoxical hemostatic profile, where they are prone to both bleeding and thrombosis. Thus, careful evaluation of coagulation status and careful use of anticoagulants is critical, particularly during surgical procedures. Alcohol cessation, a cornerstone in the management of alcoholic liver cirrhosis, not only halts further liver damage but also provides the liver with the opportunity for partial regeneration and improvement in liver function, with robust alcohol counseling and support systems playing a crucial role in patient adherence and successful outcomes. The gut-liver axis, a concept highlighting the bidirectional relationship between the liver and the intestinal microbiota, plays a significant role in the pathogenesis of liver cirrhosis, where dysbiosis and increased intestinal permeability may contribute to bacterial translocation, inflammation, and disease progression, suggesting the potential of probiotics and antibiotics in therapeutic strategies. The MELD, Model for End-Stage Liver Disease, score provides an objective method for assessing the severity of liver disease and prioritizing liver transplantation candidates based on laboratory results, such as serum creatinine, bilirubin, and INR, emphasizing its role in predicting short-term survival and guiding treatment strategies. Cirrhotic cardiomyopathy, a condition of impaired cardiac response to stressors in liver cirrhosis, is characterized by diastolic dysfunction, electrophysiological abnormalities, and impaired cardiac contractile function, necessitating awareness and appropriate cardiovascular management to prevent exacerbation of heart failure symptoms in advanced liver disease. When caring for patients with liver cirrhosis, understanding the significance of small for size syndrome, which can occur following liver resection or transplantation, is crucial, as inadequate liver mass may not meet the metabolic demands of the body, leading to postoperative liver dysfunction, thus requiring careful preoperative assessment of liver volume and regenerative capacity. The interplay between iron homeostasis and liver cirrhosis is complex, with secondary iron overload being a risk factor in certain patients. Careful assessment of serum ferritin and transferrin saturation levels is essential to guiding iron chelation therapy or phlebotomy to prevent additional hepatic injury or progression. 23. Pulmonary complications in liver cirrhosis, such as hepatopulmonary syndrome and portopulmonary hypertension, result from vascular changes and impaired oxygenation, requiring vigilant screening, diagnostic imaging, and the possibility of liver transplantation consideration, as these conditions significantly impact overall patient prognosis. 24. New insights into autophagy, a cellular process responsible for recycling damaged organelles and proteins, suggest its role in liver cirrhosis progression, where dysfunctional autophagy may exacerbate fibrosis, making it a potential target for drug therapies aimed at restoring this intracellular homeostasis and improving liver health. 25. In patients with liver cirrhosis, pruritus or itching represents a common and perplexing symptom potentially linked to elevated bile acids or endogenous opioid levels, often necessitating treatment with antihistamines, bile acid sequestrants, or opioid antagonists like naltrexone to alleviate this distressing condition and improve quality of life. 26. Bone health in cirrhotic patients is of significant concern due to increased risk for osteoporosis and fractures, primarily due to malabsorption of vitamin D, hypogonadism, and chronic inflammation. Therefore, regular bone density assessments and the use of calcium and vitamin D supplements or bisphosphonates are crucial in management plans. 27. Wilson's disease, a genetic disorder leading to excessive copper accumulation, can result in hepatic cirrhosis among its various manifestations. The diagnosis is clinched by low serum ceruloplasmin levels, high urinary copper, and treatment focuses on reducing copper load through agents like penicillamine or the zinc-based regimen to prevent liver and neurological damage. 28. The impact of liver cirrhosis extends to the endocrine system, where hypogonadism, adrenal insufficiency, and thyroid derangements may be present, necessitating regular endocrine evaluations and potential hormone replacement therapies to address these hormonal imbalances and their associated symptoms. 29. Vascular thrombosis, manifesting as portal vein thrombosis, is an underappreciated complication in liver cirrhosis, wherein blood clots form in the portal vein, exacerbating portal hypertension and impeding blood flow, often necessitating anticoagulation therapy despite the complex coagulopathy in cirrhotic patients to improve vascular patency. 30. Secondary bacterial peritonitis, an infection of the acidic fluid occurring due to bacterial translocation, presents a life-threatening emergency in cirrhotic patients that demands prompt diagnosis via paracentesis, revealing neutrophil counts above 250 cells (UL), and initiation of empirical antibiotics, such as cefotaxime, to combat likely pathogens. 31. Growth hormone resistance and resultant insulin-like growth factor 1, IGF-1, deficiency observed in liver cirrhosis may contribute to muscle wasting and sarcopenia, affecting patient outcomes. Hence, nutritional interventions and exercise programs are critical in mitigating these catabolic effects and improving physical performance and survival. 32. Antidiuretic hormone dysregulation in cirrhosis contributes significantly to hyponatremia, a common electrolyte imbalance, where water retention is inappropriately increased despite reduced effective circulating volume, necessitating careful management through fluid restriction or the use of vasopressin receptor antagonists, also known as VAPTANs. 3. Collateral circulations, such as caput medusae and the recanalization of umbilical veins, represent compensatory mechanisms observable in advanced liver cirrhosis caused by portal hypertension, often visible on clinical examination as abdominal wall varicosities, but also indicated in imaging studies used to gauge disease severity. 34. By understanding the metabolic and enzymatic disruptions in liver cirrhosis, especially altered drug metabolism due to impaired cytochrome P450 activity, healthcare providers can better tailor pharmacological regimens, adjusting dosages of medications to avoid potential toxicity or subtherapeutic efficacy in this vulnerable patient population. (35) Liver cirrhosis has systemic effects evident in the central nervous system, exemplified by an increased risk of seizures, possibly due to metabolic imbalances, medication effects, or undiagnosed hepatic encephalopathy, warranting proactive neurophysiological assessments and cautious anti-seizure medication use. (36) The role of mitochondrial dysfunction in liver cirrhosis is gaining traction, with studies implicating impaired energy production and increased oxidative stress as underlying factors exacerbating hepatocyte injury and fibrosis, promising a new avenue for targeting mitochondrial pathways to potentially ameliorate liver damage and disease progression. (37) Copeptin, a stable byproduct of arginine vasopressin (AVP) breakdown, is emerging as a promising biomarker in liver cirrhosis for assessing disease severity and predicting patient outcomes, offering the potential to track disease progression and tailor individualized treatment strategies in cirrhotic patients. (38) With the use of sophisticated molecular imaging techniques like PET scans, emerging research in liver cirrhosis seeks to visualize ongoing fibrogenesis in real time by deploying radiolabeled tracers targeting fibrogenic pathways, thus allowing for earlier intervention and monitoring the efficacy of antifibrotic therapies. (39) Autoimmune hepatitis, which can advance to cirrhosis if untreated, is dominated by a T-cell-mediated immune attack on hepatocytes, diagnosed through autoantibody profiles and elevated serum Ig levels, requiring timely administration of immunosuppressive agents such as corticosteroids and azathioprine to prevent irreversible liver injury. (40) Exploring the gut-liver-brain axis in liver cirrhosis uncovers its contribution to neurocognitive dysfunction through the production of neuroactive substances by altered gut microbiota, accentuating the importance of gut health on brain function and opening avenues for microbiome-targeted therapies to ameliorate hepatic encephalopathy. (41) The metabolic reprogramming in hepatic stellate cells, favoring glycolysis over oxidative phosphorylation in liver cirrhosis, underscores its role in perpetuating fibrogenesis, steering research towards metabolic intervention strategies that could impair stellate cell activation and alter the course of fibrosis and cirrhosis progression. (42) Osteodystrophy in liver cirrhosis, characterized by diminished bone strength due to unhealthy liver function impacting calcium and vitamin D metabolism, necessitates bisphosphonate therapy alongside optimized nutritional support to combat the increased risk of fractures and enhance bone mineral density. (43) The emergence of microRNA profiles offers an innovative diagnostic and prognostic tool in liver cirrhosis by shedding light on specific dysregulated microRNA patterns linked to disease progression, paving the way for personalized medicine approaches that leverage these biomarkers for risk stratification and targeted therapeutic interventions. (44) Leveraging artificial intelligence, AI, in the realm of liver cirrhosis promises enhanced diagnostic accuracy through image analysis, particularly in interpreting complex imaging studies to identify cirrhosis severity, variceal risk, and nuanced changes in liver parenchyma, ultimately refining clinical decision-making processes. (45) Gut-derived endotoxemia, resulting from increased intestinal permeability and bacterial translocation in liver cirrhosis, is a critical focal point for new therapeutic approaches, aiming to stabilize the gut barrier and reduce systemic inflammatory responses through probiotics, prebiotics, and specialized nutritional formulations. (46) Lipoprotein metabolism alterations in liver cirrhosis make patients prone to dyslipidemia and cardiovascular disease, highlighting the necessity for regular monitoring and potentially lipid-lowering therapies to mitigate cardiovascular risks, even in the setting of reduced hepatic synthesis of certain lipoproteins. '47. Leveraging the role of extracellular vesicles as mediators of intercellular communication in liver cirrhosis offers a promising strategy to modulate fibrogenic and regenerative pathways, tapping into the potential for using extracellular vesicles in novel therapeutic applications to influence liver repair processes. '48. In liver cirrhosis, the clinical relevance of genetic liver diseases like hemochromatosis comes into play, where excessive iron deposition can accelerate fibrosis and cirrhosis, necessitating genetic screening in at-risk populations and implementing iron-reducing therapies to prevent additional liver complications. '49. Harnessing the potential of epigenetic modulators in liver cirrhosis treatment reflects a groundbreaking avenue that targets specific histone modifications and DNA methylation patterns that drive fibrogenesis, offering a targeted approach to halt disease progression and foster hepatic healing mechanisms. '50. The complexity of central obesity's impact on liver cirrhosis risk reveals its role, as visceral adiposity promotes systemic inflammation and alters adipokine profiles, necessitating targeted interventions focusing on weight reduction and metabolic health optimization as preventative strategies against cirrhosis development. '1. Hepatitis C, a viral infection primarily affecting the liver, is caused by the hepatitis C virus, HCV, and can progress silently over decades, leading to chronic liver disease in approximately 50 to 80% of infected individuals due to the virus's ability to evade immune detection and establish a persistent infection. '2. The hepatitis C virus is predominantly transmitted through blood-to-blood contact, with intravenous drug use being the most common route, and despite substantial reductions in transmission rates thanks to blood screening, unsafe medical practices in some parts of the world remain a significant risk factor for new infections. '3. Diagnosis of hepatitis C involves both serological and molecular tests, where an initial enzyme immunoassay detects antibodies to the virus, followed by a confirmatory PCR test to measure the viral load and assess if the infection is active and requires treatment intervention. '4. Chronic hepatitis C infection can lead to complications such as cirrhosis and hepatocellular carcinoma due to ongoing liver inflammation and fibrosis, making regular screening and monitoring essential for those at risk or diagnosed, to ensure timely intervention and reduce the risk of severe liver damage. '5. Direct-acting antivirals, DAAs, have revolutionized the treatment of hepatitis C, offering over 90% cure rates with oral medications that target different stages of the viral life cycle, providing shorter, more effective treatment courses with fewer side effects compared to older interferon-based therapies. '6. Hepatitis C exhibits 6 different genotypes, with genotype 1 being the most prevalent worldwide, and identifying the genotype is crucial in the tailoring of antiviral treatment plans that consider genotype-specific efficacy, optimizing therapeutic outcomes for the patient. '7. The liver injury from hepatitis C is characterized by immune-mediated mechanisms where the virus persists within hepatocytes, evading immunity and creating an inflammatory state that drives progressive liver damage and potential fibrosis, ultimately affecting liver function and health. 8. Liver fibrosis staging is essential in managing hepatitis C, where non-invasive tests like elastography can assess liver stiffness, reducing the need for liver biopsies and helping to guide treatment decisions and predict progression to more severe liver disease, such as cirrhosis. 9. Hepatitis C is not only a liver disease but also has systemic implications, with extrahepatic manifestations including type 2 diabetes, glomerulonephritis, and lymphoma, affecting multiple organ systems and significantly impacting the quality of life and prognosis of affected patients. The natural history of chronic hepatitis C infection varies greatly among individuals, with factors such as host genetics, viral genotype, and environmental influences like alcohol consumption playing critical roles in disease progression and liver damage severity over time. Horizontal transmission of hepatitis C can occur through sexual contact, though it is less efficient than other routes, making it essential for patients and partners to take preventative measures, especially those with high-risk behaviors that increase exposure likelihood. Effective public health strategies for hepatitis C control focus on harm reduction methods like needle exchange programs, safe blood supply practices, and awareness campaigns that aim to reduce transmission and promote early detection and treatment in high-risk populations. Hepatitis C infection can lead to an alteration in liver enzyme levels, commonly presenting as elevated aminotransferases on routine laboratory tests, which can trigger further investigation into the viral status when considered in conjunction with appropriate clinical risk factors. The introduction of universal hepatitis C screening guidelines for adults born between 1945 and 1965 significantly enhanced early detection of chronic infections within this cohort, who are believed to be at higher risk due to past healthcare practices that may have exposed them to the virus. While there is currently no vaccine for hepatitis C, ongoing research is focused on developing strategies to induce robust immune responses capable of protective immunity, with the hope of one day preventing HCV infections and reducing the global burden of this liver disease. In patients with chronic hepatitis C, co-infections with other blood-borne viruses, such as HIV or hepatitis B, can exacerbate liver injury, complicating management, and necessitating careful coordination of treatment regimens to address the interplay between these infections. Reinfection with hepatitis C is a concern, particularly in high-risk populations, as past infection or clearance does not confer immunity, underlining the importance of continuous preventive efforts even after successful treatment, to avoid relapse or new infections. Steatosis, or fatty liver, is a common histological feature in chronic hepatitis C, particularly with genotype 3 infections, and contributes to liver injury and progression of fibrosis by increasing hepatic inflammation and oxidative stress within the liver tissue. Autoimmune phenomena are associated with hepatitis C, as the virus can trigger immune dysregulation, leading to conditions such as mixed cryoglobulinemia, which presents with a triad of purpura, arthralgia, and weakness, requiring integrated management strategies. Despite universal precautions, occupational exposure to hepatitis C remains a calculated risk for healthcare workers, especially in situations involving needle stick injuries or direct contact with blood, highlighting the importance of post-exposure protocols and early intervention. FibroScan is a valuable non-invasive diagnostic tool in hepatitis C management, using transient elastography to provide an accurate measure of liver stiffness, facilitating the assessment of fibrosis without the need for invasive biopsies, which can be costly and painful. In hepatitis C patients, alcohol consumption accelerates liver damage, promoting fibrosis and increasing the risk of cirrhosis, making abstinence from alcohol a critical recommendation for lifestyle modification to prevent complications and improve treatment outcomes. 23. Hepatitis C and pregnancy require special attention, as vertical transmission rates during childbirth are approximately 5%, with risk enhanced by high viral loads, necessitating strategies to minimize this transmission risk and ensure prompt evaluation of newborns. 24. Chronic hepatitis C has been linked to neurocognitive dysfunction, affecting memory, concentration, and mood, a condition known as hepatic encephalopathy, which can occur even in the absence of cirrhosis, impacting daily function and quality of life for patients. 25. Combination therapies for hepatitis C that utilize multiple direct-acting antiviral agents are designed to prevent viral resistance by targeting different viral proteins, ensuring a higher barrier to resistance and increasing the likelihood of treatment success. 26. The presence of hepatitis C antibodies in laboratory tests indicates exposure to the virus, but confirmatory RNA testing is required to distinguish between past, resolved infections and active infections that necessitate treatment to prevent liver damage. 27. The discovery of the hepatitis C virus in the late 1980s, a triumph of molecular biology, closed a historical gap in understanding non-A, non-B hepatitis, catalyzing research and development of diagnostics, treatment options, and a clearer understanding of transmission. 28. Chronic hepatitis C impacts glucose metabolism, increasing the risk of insulin resistance and development of type 2 diabetes, which contributes to liver fibrosis and further complicates the management of liver disease in affected individuals. 29. The Common Fibrosis 4 (FIB4) score, calculated from routine lab data such as age, liver enzymes, and platelet count, serves as a useful and widely accessible tool for assessing liver fibrosis in hepatitis C infected individuals, guiding clinical decision-making. 30. Hepatitis C coinfection with HIV poses unique challenges, as both viruses share transmission pathways and exacerbate one another's effects on liver disease progression, requiring a cohesive treatment approach to address both infections effectively. 31. Successful eradication of hepatitis C with antiviral therapy has been shown to reduce the incidence of liver-related complications and improve survival rates, underscoring the importance of achieving a sustained virologic response as the primary goal of treatment. 32. Hepatitis C-associated mixed cryoglobulinemia can manifest as vasculitis, impacting the skin, kidneys, and peripheral nerves, driven by immune complexes and necessitating treatment that addresses both the viral cause and symptomatic relief of vasculitic symptoms. 3. Identifying liver histopathology, such as lymphoid aggregates or bile duct injury alongside steatosis and inflammation, helps refine the diagnosis of hepatitis C and its staging, offering critical insights into the degree of liver damage and guiding therapeutic strategies. 34. Hepatitis C genotype 3 confers an increased risk of hepatic steatosis and faster progression to cirrhosis compared to other genotypes, leading to tailored treatment regimens and vigilant monitoring for this subgroup to prevent rapid liver deterioration. 35. The global distribution of hepatitis C genotypes reflects historical and geographical patterns of human migration and behavior, influencing research strategies that focus on region-specific genotypic prevalence to optimize treatment efficacy and accessibility. 36. The advent of DAAs has changed the landscape of hepatitis C epidemiology, allowing for treatment plans that accommodate diverse populations with varying healthcare access, aiming to eliminate diagnostic and therapeutic disparities and reduce the overall disease burden. 37. In hepatitis C, advanced liver fibrosis correlates with increased risk of hepatocellular carcinoma, warranting surveillance strategies that include regular imaging and laboratory assessments post-therapy to catch any malignancy early and manage it effectively. Host genetic factors, such as polymorphisms in the IL-28B gene, influence treatment response and spontaneous clearance rates of hepatitis C, providing personalized risk assessment and therapy customization that predict patient-specific therapeutic outcomes. 39. Chronic hepatitis C has complex effects on lipid metabolism, often resulting in dyslipidemia, which may contribute to cardiovascular risk profiles and necessitate a comprehensive approach to managing not only liver health but also associated systemic comorbidities. 40. Hepatitis C-related hepatic inflammation and fibrosis may be modulated by certain cytokines, such as TGF-beta, which promotes fibroblast activation and scar formation in the liver, offering potential targets for antifibrotic therapies under exploration. 41. Socioeconomic factors significantly impact hepatitis C outcomes, as populations with limited healthcare access or education may experience delayed diagnoses and inconsistent treatment adherence, challenging public health efforts to control and eliminate the virus. 42. The hepatitis C virus's ability to mutate rapidly aids its evasion of host immune responses, contributing to chronic infection and highlighting the need for multifaceted therapeutic approaches that target multiple viral elements to achieve sustained clearance. 43. While liver transplantation may be necessary for end-stage liver disease resulting from hepatitis C, recurrence of the virus in the new liver is common without successful viral clearance pre- or post-transplantation, informing the timing and strategies of antiviral regimens. 44. Understanding the natural reservoirs and evolutionary origins of hepatitis C involves studying related hepiciviruses in non-human primates, which may offer insights into viral transmission dynamics and inform future approaches to vaccine development and public health strategies. 45. The role of cellular apoptosis in hepatitis C-related liver injury involves both hepatocyte and immune cell pathways, emphasizing a complex interplay where therapeutic strategies aim to limit cell death and preserve liver health by mitigating ongoing immune-driven damage. 46. Hepatitis C can mediate changes in the gut-liver axis, impacting microbiome balance and cytokine release that contribute to systemic inflammation, necessitating strategies that consider gut health in the holistic management of chronic liver diseases. 47. Advances in biomarkers for hepatitis C have facilitated the classification of liver disease severity and response to treatment, enhancing patient management by allowing more personalized approaches to therapy based on dynamic, accessible, and non-invasive measurements. 48. With hepatitis C eradication being achievable in many patients, follow-up care remains pivotal to ensuring long-term health, as previously infected individuals may still face residual risks of liver disease complications or comorbid conditions that require ongoing monitoring. 49. The psychosocial aspects of living with hepatitis C include stigma and mental health challenges, underscoring the necessity of comprehensive care models that incorporate psychological support alongside medical treatment to support patient resilience and enhance quality of life. 50. The development of pangenotypic antivirals for hepatitis C has brought forth a new era of simplified treatment regimens that transcend genotypic boundaries, offering therapy options with wide-ranging efficacy across all genotypes and reducing the barriers to successful viral eradication. 1. Cardiac arrhythmias, often resulting from disruptions in the heart's electrical conduction system, can lead to symptoms such as palpitations, dizziness, and syncope, while potentially increasing the risk for more serious conditions like stroke and heart failure. Hence, understanding the complexities of atrial and ventricular arrhythmias is crucial for effective clinical management. 2. Diagnosing cardiac arrhythmias often involves the use of electrocardiograms, ECGs, as a primary tool, where healthcare providers analyze the electrical activity of the heart through P, QRS, and T waves, which can reveal patterns indicative of atrial fibrillation, tachycardia, or other arrhythmic conditions. Three. Although antiarrhythmic drugs like amiodarone, beta blockers, and calcium channel blockers are integral to the medical management of various cardiac arrhythmias, they come with their own set of pharmacokinetic challenges and side effects, necessitating careful patient monitoring and individualized treatment plans. 4. Atrial fibrillation, one of the most common types of arrhythmias, is characterized by rapid and irregular beating of the atria and is often associated with an increased risk of thromboembolic events, which calls for anticoagulation strategies in addition to rhythm or rate control therapies. 5. The pathophysiology of ventricular arrhythmias can involve abnormalities in ion channel functioning within myocardial cells, leading to conditions such as ventricular tachycardia or fibrillation, which are particularly serious due to their potential to precipitate sudden cardiac arrest. 6. Holter monitoring, which involves continuous ECG recording typically over 24 to 48 hours, is a valuable diagnostic method for identifying transient arrhythmic episodes that may not be captured during a standard ECG test in a clinical setting. 7. In certain cases of refractory arrhythmias or when medical management is insufficient, catheter ablation procedures might be considered. These involve the targeted destruction of arrhythmic foci within the heart tissue via radiofrequency or cryoablation techniques, aiming to restore normal cardiac rhythm. 8. Breach of cellular homeostasis and calcium ion handling in cardiomyocytes can contribute to arrhythmic phenomena, highlighting the importance of calcium channel function in maintaining proper myocardial contraction and electrical stability, often factored into pharmacotherapeutic interventions. 9. Genetic predispositions, sometimes linked to inherited channelopathies such as long QT syndrome or Brugada syndrome, can underpin the development of arrhythmias, indicating the need for genetic counseling and screening in at-risk populations to guide preventive and therapeutic strategies. (10) Cardiac arrhythmias in the context of ischemic heart disease can arise from scarring and fibrosis post-myocardial infarction, which disrupts electrical conduction pathways, thereby necessitating not only direct arrhythmia management but also comprehensive cardiovascular care to mitigate underlying ischemic burden. 11. Lifestyle factors such as excessive caffeine or alcohol consumption, smoking, and stress can exacerbate or trigger arrhythmic episodes, suggesting that a holistic approach to arrhythmia management must include patient education and lifestyle modifications alongside medical interventions. 12. The occurrence of arrhythmias during pregnancy presents unique clinical challenges due to physiologic changes and the need to consider fetal health, often requiring collaborative multidisciplinary care to address rhythm disturbances while minimizing risks to mother and child. 13. For individuals experiencing symptomatic bradyarrhythmias, potentially due to sinus node dysfunction or atrioventricular block, implantation of a pacemaker can provide effective rhythm management, thereby alleviating symptoms and reducing the risk of complications associated with low heart rates. 14. Unlike mere heart rate increase or decrease, arrhythmias involve the intricate disturbance of the heart's electrical impulses, necessitating attentive risk factor stratification in patient-specific treatment protocols, considering the vast array of underlying etiological mechanisms in each case. 15. A comprehensive history and physical examination remain pivotal in the initial assessment of patients presenting with suspected arrhythmias, for symptoms such as palpitations, fatigue, or dyspnea can stem from a vast differential diagnosis, thereby helping clinicians to triage and guide further investigations efficiently. (16) The role of the autonomic nervous system in modulating cardiac rhythms is significant, where imbalances in sympathetic and parasympathetic tone can precipitate arrhythmic events. Clinical interventions sometimes involve modulation of autonomic inputs to stabilize cardiac function. 17. Antiarrhythmic drug therapy carries potential proarrhythmic risk, necessitating diligent monitoring for QT interval prolongation or other adverse effects, especially in drugs that alter ion channels, underscoring the complexity of striking a balance between therapeutic benefits and possible toxicities. (18) Emerging non-invasive technologies like wearable ECG monitors provide continuous cardiac rhythm surveillance, empowering patients with real-time insights and facilitating early detection of arrhythmic phenomena outside of traditional clinical environments, fostering proactive management. 19. Pathological hypertrophy and dilation of cardiac chambers, often seen in conditions such as left ventricular hypertrophy or cardiomyopathies, can induce arrhythmic electrical conduction, highlighting the intersection between structural myocardial changes and electrophysiological disturbance. (20) Psychoemotional factors, including anxiety and depression, have been noted to influence the presentation and perceived burden of arrhythmias, thereby requiring a biopsychosocial model of care that integrates mental health support in managing patients with cardiac arrhythmias. (21) The electrophysiological study, EPS, serves as a cornerstone diagnostic tool for elucidating the mechanisms of arrhythmias, whereby intracardiac electrode catheters help in mapping the heart's electrical activity and understanding specific arrhythmic circuits for targeted therapeutic decisions. (22) The electrophysiology of the cardiac conduction system involves synchronized depolarization and repolarization events, with the sinoatrial and atrioventricular nodes playing critical roles. Disruptions here can result in inefficient cardiac cycles and highlight areas of potential electrophysiological intervention. (23) Structural heart conditions such as valvular diseases may predispose patients to arrhythmias due to resultant atrial enlargement and pressure overload, demonstrating the interconnected nature of mechanical and electrical heart dynamics in arrhythmogenesis. (24) Synchronization of ventricular contraction and improved hemodynamics are the goals of cardiac resynchronization therapy, CRT, used in select cases of heart failure with arrhythmias where biventricular pacing can dissolve dyssynchrony and ameliorate symptoms. (25) Pediatric arrhythmias demand careful consideration, as they may manifest differently than in adults, with common etiologies including congenital heart defects or genetic syndromes, necessitating age-appropriate diagnostic and therapeutic approaches tailored to the developmental context. (26) The intricate anatomy of the cardiac conduction system, involving specialized pathways through the atrioventricular node and Purkinje fibers, underpins its vulnerability to disturbances, where even minor alterations in anatomy or physiology can have significant arrhythmic consequences. (27) The multifactorial etiology of arrhythmias often includes electrolyte imbalances such as hypokalemia or hypercalcemia, underscoring the importance of maintaining adequate electrolyte homeostasis in both prevention and treatment regimens for cardiac rhythm disturbances. (28) Lifestyle interventions, such as the incorporation of regular graded exercise, have shown beneficial effects in reducing the incidence of certain arrhythmias, promoting autonomic balance and cardiac fitness, when duly tailored to individual patient capabilities and risk profiles. 29. The risk stratification for sudden cardiac death in individuals with potentially malignant arrhythmias involves assessing factors such as ejection fraction, presence of syncope, and familial history, guiding decisions on the appropriateness of implantable cardioverter defibrillators as prophylactic measures. Cardiac imaging techniques, including echocardiography and cardiac MRI, illuminate structural and functional status, providing essential information to correlate anatomical findings with arrhythmic potential, vital for comprehensive arrhythmia care planning. The pathogenesis of arrhythmias can sometimes be attributed to inflammatory processes, as observed in conditions like myocarditis or cardiac sarcoidosis, where inflammation-induced scarring can alter conductive pathways, necessitating both anti-inflammatory and rhythm management strategies. Clinical innovations, such as the development of bioengineered cardiac tissue grafts, hold promise for repairing arrhythmic substrates by restoring normal myocardial architecture and electrical continuity, offering a glimpse into future regenerative therapies for arrhythmia management. Polymorphic ventricular tachycardia, often associated with electrolyte disturbances or ischemic insult, typifies the diversity within arrhythmias, necessitating nuanced understanding and management approaches, including correction of precipitating conditions and pharmacological stabilization. The potential for asymptomatic arrhythmias to progress undetected adds an element of unpredictability to their management, emphasizing the value of regular cardiac evaluations, especially in high-risk populations, to mitigate possible adverse outcomes through proactive surveillance. The utilization of implantable loop recorders extends diagnostic capabilities over extended periods, capturing sporadic arrhythmic events that might otherwise go undiagnosed, enhancing the diagnostic yield in patients presenting with unexplained syncope or palpitations. Paroxysmal supraventricular tachycardia, PSVT, arises from reentrant circuits within the atria or atrioventricular node, often requiring acute interventions such as vagal maneuvers or adenosine administration, alongside long-term consideration of pharmacological or ablative strategies for persistent cases. The advent of telemedicine and virtual arrhythmia clinics has augmented patient access to specialized cardiac care, allowing remote consultations and monitoring that adapt to patient needs, optimizing management and follow-up in the evolving landscape of digital healthcare. Wolff-Parkinson-White syndrome, a pre-excitation disorder characterized by the presence of an accessory pathway, manifests in tachyarrhythmias due to abnormal electrical conduction, underscoring the importance of accurate ECG interpretation and patient-specific intervention planning. Not all arrhythmias convey the same clinical significance, with distinctions existing between benign ectopic beats and life-threatening tachyarrhythmias, thus imposing the need for differential diagnosis in the context of patient symptoms and overall cardiovascular risk. Environmental factors, such as exposure to certain toxins or medications that prolong the QT interval, can precipitate arrhythmic events, necessitating awareness and mitigation strategies in both clinical and occupational contexts to prevent potential cardiac complications. Cardiac arrhythmias present gender-specific prevalence and risk factors, as hormonal influences and genetic predispositions may differ, warranting consideration of gender in both the research and clinical management paradigms of arrhythmic disorders. Technology-driven advancements in algorithms for arrhythmia detection leverage artificial intelligence to enhance the precision of diagnostic tools, transforming the landscape of non-invasive arrhythmia screening with the potential to improve early detection and intervention outcomes. 43. The therapeutic landscape for arrhythmias continues to evolve with approaches such as gene therapy, targeting underlying molecular defects in inherited arrhythmogenic disorders, offering a frontier in personalized medicine that reaches beyond symptom control to address disease at its genetic root. 44. Emotionally induced arrhythmias exemplify the direct link between mind and heart, where stress can precipitate acute arrhythmic events, highlighting the importance of integrating stress management techniques into comprehensive care plans for patients with cardiac susceptibility. 45. Despite their potential diversity, arrhythmias share a common thread in their potential to affect cardiac output, emphasizing the interconnectedness of electrical dysrhythmia and hemodynamic compromise, necessitating a holistic grasp of cardiovascular physiology in clinical practice. 46. The management of arrhythmias in patients with comorbid conditions, such as diabetes or chronic kidney disease, often involves additional layers of complexity due to interaction with existing therapies and potential alteration of drug metabolism, underscoring the importance of multidisciplinary care teams. 47. Recent studies suggest that the gut microbiome may influence cardiac rhythm through mechanisms involving metabolic byproducts, opening intriguing possibilities for novel approaches to managing arrhythmic disorders via dietary modulation and microbiome-targeted therapies. 48. In some instances, a pacemaker or implantable cardioverter defibrillator interaction with electromagnetic fields necessitates vigilance regarding potential interference, leading to patient education on avoiding certain environments to ensure device functionality remains uncompromised. 49. Considering arrhythmias from a global health perspective unveils disparities in access to arrhythmia care, prompting efforts towards enhancing healthcare infrastructure and education in resource-limited settings to bridge gaps and improve patient outcomes. 50. The use of risk prediction models in arrhythmia care, incorporating variables such as age, comorbidities, and lifestyle factors, facilitates a more tailored risk assessment approach, enhancing predictive accuracy and informing preventive strategies in clinical decision-making processes. 1. Ischemic heart disease, primarily caused by atherosclerosis, reduces blood flow to myocardial tissues, often resulting in angina pectoris and increasing the risk of myocardial infarction, thus necessitating prompt clinical intervention to prevent irreversible myocardial damage. 2. Understanding the pathophysiology of ischemic heart disease involves recognizing the complex interplay of endothelial dysfunction, lipid accumulation, inflammation, and thrombosis that ultimately compromises coronary artery blood flow and myocardial perfusion. 3. The diagnostic process for ischemic heart disease involves tools such as electrocardiograms to detect street segment changes, stress tests for evaluating exercise-induced ischemia, and coronary angiography, which provides direct visualization of coronary artery obstruction. 4. Medical management of ischemic heart disease often includes antiplatelet agents like aspirin, which reduce thrombotic events, statins to lower LDL cholesterol and stabilize atherosclerotic plaques, and nitrates to alleviate chest pain by dilating coronary vasculature. 5. Lifestyle modifications, such as smoking cessation, dietary changes to reduce saturated fats, and regular aerobic exercise, play a crucial role in managing ischemic heart disease by mitigating risk factors and supporting cardiovascular health. 6. Coronary artery bypass grafting presents a surgical option for patients with severe ischemic heart disease, creating alternative pathways for blood to reach the myocardium by grafting veins or arteries to bypass occluded coronary vessels. 7. Percutaneous coronary intervention, often involving the placement of a stent, is a minimally invasive procedure that reopens narrowed coronary arteries, restoring adequate blood flow and reducing the incidence of angina in ischemic heart disease patients. Eight. Advanced imaging modalities, such as cardiac MRI and CT angiography, provide detailed anatomical and functional assessment of coronary arteries, myocardial tissue, and perfusion deficits, enhancing diagnostic accuracy in ischemic heart disease. Nine. Ischemic preconditioning, where brief episodes of ischemia make myocardial tissue more resistant to subsequent ischemic episodes, offers a fascinating area of research with potential therapeutic implications for ischemic heart disease management. 10. The role of inflammation in ischemic heart disease is increasingly recognized, with biomarkers like C-reactive protein serving as indicators of systemic inflammation and potential targets for therapeutic intervention to reduce cardiovascular risk. Despite the predominance of atherosclerosis in ischemic heart disease, coronary microvascular dysfunction also contributes significantly, particularly in women, highlighting the need for gender-specific diagnostic and therapeutic approaches. 12. Silent ischemia presents a diagnostic challenge in ischemic heart disease, as patients exhibit myocardial ischemia without typical anginal symptoms, necessitating vigilance and regular monitoring in high-risk patient populations. 13. Genetic factors contribute to an individual's susceptibility to ischemic heart disease, with polygenic risk scores and family history aiding in risk stratification and personalized preventive strategies tailored to genetic profiles. 14. The phenomenon of coronary artery spasm, wherein transient vasoconstriction leads to ischemic events, underscores the importance of identifying and managing triggers such as stress, cold exposure, and vasoconstrictive drugs in ischemic heart disease. 15. Ischemic heart disease disproportionately affects individuals with comorbid conditions like diabetes mellitus, which accelerates atherosclerosis through mechanisms such as glycation and oxidative stress, necessitating rigorous glycemic control. 16. Heart rate variability analysis provides insights into autonomic dysfunction in ischemic heart disease, where reduced variability signals sympathetic predominance and heightened risk for adverse cardiovascular events. 17. Advances in regenerative medicine, such as stem cell therapy, hold promise for repairing ischemic damage in the heart by regenerating myocardial tissue and improving cardiac function post-myocardial infarction. 18. The role of mental health in ischemic heart disease is gaining attention, with conditions such as depression and anxiety linked to increased cardiovascular risk through stress-related pathophysiological mechanisms like hypercortisolemia. 19. Hyperhomocystinemia, an elevated blood level of homocysteine, is a modifiable risk factor for ischemic heart disease, emphasizing the importance of dietary interventions and supplementation with folic acid and B vitamins for cardiovascular prevention. 20. The potential cardioprotective effects of omega-3 fatty acids in ischemic heart disease are attributed to their anti-inflammatory properties, which help reduce plaque formation, improve endothelial function, and lower triglyceride levels. 21. Remote ischemic conditioning, involving repetitive episodes of limb ischemia to confer organ protection against ischemic injury, represents a novel non-invasive intervention with potential applicability in ischemic heart disease. 22. The use of ambulatory blood pressure monitoring in ischemic heart disease patients provides valuable insights into nocturnal hypertension and blood pressure variability, correlating with cardiovascular outcomes and guiding antihypertensive therapy. 23. Pulmonary hypertension can complicate ischemic heart disease, impairing right ventricular function and exacerbating heart failure symptoms, necessitating vigilant assessment and management of both pulmonary and cardiac components. 24. The phenomenon of hibernating myocardium, where myocardial contractility is reversibly impaired due to chronic ischemia, highlights the importance of revascularization in restoring myocardial function and optimizing heart performance. 25. Cardiac rehabilitation programs, combining supervised exercise, nutritional guidance, and psychological support, enhance recovery and quality of life for ischemic heart disease patients, reducing recurrent cardiovascular events. 26. The endothelial glycocalyx, a protective layer lining blood vessels, plays a crucial role in maintaining vascular health, and its disruption in ischemic heart disease contributes to atherogenesis and endothelial dysfunction. 27. Myocardial stunning refers to the transient post-ischemic dysfunction of myocardial tissue, despite restored blood flow, necessitating careful differential diagnosis from irreversible myocardial damage in ischemic heart disease cases. 28. The gut-heart axis explores the interplay between gut microbiota and cardiovascular health, where dysbiosis may contribute to ischemic heart disease via inflammatory pathways and microbial metabolites such as TMAO. 29. Identifying and managing obstructive sleep apnea is essential in ischemic heart disease, as untreated apnea exacerbates hypertension, sympathetic activation, and inflammation, further elevating cardiovascular risk. 30. Antianginal medications like beta blockers and calcium channel blockers not only alleviate ischemic symptoms but also provide prognostic benefits by reducing myocardial oxygen demand and preventing arrhythmias. 31. Utilization of dual antiplatelet therapy, particularly after percutaneous coronary intervention, is critical in ischemic heart disease to prevent stent thrombosis and ensure sustained patency of revascularized vessels. 32. Oxidative stress, characterized by an imbalance between reactive oxygen species and antioxidants, accelerates atherosclerosis and endothelial dysfunction in ischemic heart disease, supporting the exploration of antioxidant therapies. 3. Early intervention with fibrinolytic therapy in acute myocardial infarction, particularly in settings without percutaneous coronary intervention availability, saves myocardium by rapidly dissolving thrombi, restoring coronary perfusion. 34. Cardiac troponin levels serve as a pivotal biomarker in diagnosing acute coronary syndromes, with high-sensitivity assays providing early detection and risk stratification in ischemic heart disease emergencies. 35. Systemic lupus erythematosus and other autoimmune conditions increase ischemic heart disease risk due to accelerated atherosclerosis linked to chronic inflammation, necessitating vigilant cardiovascular monitoring in autoimmune populations. 36. The concept of residual inflammatory risk in ischemic heart disease, despite optimal lipid management, highlights the ongoing quest for therapies targeting persistent inflammation in plaque stabilization and event reduction. 37. Platelet hyperreactivity in ischemic heart disease contributes to thrombotic complications, with pharmacogenomics guiding personalized antiplatelet strategies to prevent adverse outcomes and optimize dual antiplatelet therapy. 38. The interplay between hypercoagulability and ischemic heart disease necessitates consideration of anticoagulant therapy, especially in patients with concomitant atrial fibrillation, to balance thrombosis prevention with bleeding risk. 39. Investigating the impact of systemic nitric oxide availability in ischemic heart disease reveals its crucial role in vasodilation and endothelial function, with therapeutic implications for enhancing nitric oxide pathways. 40. The metabolic syndrome synergistically amplifies ischemic heart disease risk through interconnected components like abdominal obesity, insulin resistance, dyslipidemia, and hypertension, requiring a comprehensive approach to management. 41. Emerging research on the Klotho protein suggests a protective role against cardiovascular aging and ischemic heart disease, highlighting potential therapeutic avenues for promoting longevity and vascular health. 42. Heat shock proteins, induced by stressors, serve protective roles in myocardial cells by preventing protein aggregation and enhancing survival pathways during ischemic events, with potential therapeutic exploitation in cardioprotection. 43. Chronic kidney disease exacerbates ischemic heart disease through mechanisms such as hypertension, mineral metabolism disturbances, and uremic toxins, necessitating joint nephrological and cardiovascular management strategies. 44. Advances in nanotechnology aim to revolutionize ischemic heart disease treatment through targeted drug delivery systems, enhancing therapeutic efficacy and minimizing off-target effects in the cardiovascular system. 45. The association between migraines and ischemic heart disease underscores shared pathophysiological pathways like endothelial dysfunction, auguring the need for integrated care in patients presenting with both conditions. 46. Exploring proteomics in ischemic heart disease can unveil novel biomarkers and therapeutic targets, offering insights into disease mechanisms and individualized treatment approaches tailored to proteomic profiles. 47. Cardiac amyloidosis complicates ischemic heart disease by infiltrating and stiffening myocardial tissue, posing diagnostic and therapeutic challenges in distinguishing from primary ischemic cardiomyopathies. 48. Transthoracic echocardiography remains a non-invasive cornerstone in assessing cardiac structure and function in ischemic heart disease, aiding in evaluation of ventricular size, wall motion abnormalities, and ejection fraction. 49. The promise of gene editing technologies, such as CRISPR-Cas9, beckons an era of precision medicine for ischemic heart disease, potentially correcting genetic predispositions and ushering tailored therapeutic interventions. 50. Understanding the circadian patterns of ischemic heart disease events, where peak incidence occurs in the morning, informs timing of medication administration and lifestyle modifications to align with biological rhythms for optimal outcomes. One. Hepatitis C is a liver infection caused by the hepatitis C virus, HCV, which primarily spreads through exposure to blood contaminated with the virus, often through sharing needles or medical equipment, making early detection crucial in preventing liver damage and complications. 2. The pathophysiology of hepatitis C involves the HCV triggering chronic inflammation in the liver, causing liver cells to die and be replaced with fibrous scar tissue, which can eventually lead to cirrhosis, impairing liver function and increasing the risk for liver cancer. 3. Direct-acting antivirals, DAAs, have revolutionized the treatment of hepatitis C, offering cure rates above 90% with typically few side effects, although the choice of a specific DAA regimen depends on the viral genotype and presence of liver disease complications. 4. Hepatitis C can remain asymptomatic for years, making routine screening for people at risk vital because early diagnosis allows for timely initiation of antiviral therapy to prevent progression to severe liver disease. Five. There are 6 genotypes of hepatitis C virus, each affecting treatment choices and duration, with genotype 1 being the most common in the United States and often requiring a different therapeutic approach compared to other genotypes. Six. The diagnosis of hepatitis C involves initial screening with an HCV antibody test, followed by a confirmatory HCV RNA test if antibodies are detected, to determine whether there is an active infection needing treatment. 7. Chronic hepatitis C infection is a leading cause of liver transplants globally due to its potential to cause cirrhosis or liver cancer, emphasizing the importance of antiviral treatment in preventing these severe outcomes. 8. Despite there being no vaccine for hepatitis C, preventive measures such as avoiding needle sharing and ensuring safe blood transfusion practices are crucial to reduce the transmission of this virus. 9. The liver damage from hepatitis C can cause complications like portal hypertension, characterized by increased blood pressure in the portal vein, leading to varices or ascites, highlighting the importance of regular monitoring in chronic cases. 10. Advanced hepatitis C with cirrhosis is a known risk factor for hepatocellular carcinoma, making regular liver ultrasounds and alpha-fetoprotein tests essential in the surveillance for liver cancer in these patients. Some patients with hepatitis C might experience extrahepatic manifestations such as mixed cryoglobulinemia, a condition causing systemic vasculitis, often requiring additional treatments like immunosuppressive therapy. Certain lifestyle modifications, like avoiding alcohol which can exacerbate liver damage, are crucial in managing hepatitis C, as alcohol consumption accelerates the progression to cirrhosis. 13. A liver biopsy, though less commonly used now, can be helpful in assessing the extent of liver damage in hepatitis C, including the degree of inflammation and fibrosis, which can guide treatment decisions. 14. While hepatitis C attacks liver cells preferentially, it can also affect organs outside the liver, potentially leading to complications such as renal disease or lymphomas, underscoring the need for comprehensive care. 15. The sustained virologic response, SVR, is the goal of hepatitis C treatment, indicating that the virus remains undetectable in the blood 12 weeks after completing therapy, which is equated to a cure. 16. In the era of DAAs, treatment regimens for hepatitis C have become shorter, typically ranging from 8 to 12 weeks, marking a significant advancement over prior treatments that could last up to a year with inferior outcomes. Hepatitis C virus can undergo genetic mutations, aiding its evasion from the immune system and the development of resistance to antiviral treatments, which necessitates the use of combination drug therapies. 18. Blood donor screening and the introduction of direct-acting antivirals have significantly reduced new hepatitis C infections, yet public health efforts continue to bridge gaps in diagnosis and treatment accessibility. 19. Hepatitis C is more infectious than HIV but less than hepatitis B in terms of blood-borne pathogens, stressing the importance of public health interventions to remain vigilant in controlling its spread. 20. During acute hepatitis C infection, only a minority of people will exhibit symptoms such as jaundice, fatigue, or abdominal pain, which often resolve spontaneously but still require medical evaluation due to the risk of progression to a chronic state. 21. Reinfection with hepatitis C is possible even after successful treatment, particularly in individuals who continue engaging in behaviors that expose them to the virus, emphasizing the importance of preventive education. 22. During pregnancy, there is a low risk of mother-to-child transmission of hepatitis C, but women with chronic infection should be monitored and counseled accordingly to minimize risk and plan for management. 23. In patients co-infected with HIV and hepatitis C, treating both conditions is crucial as they can exacerbate each other's progression, with newer direct-acting antivirals greatly improving cure rates for HCV in such cases. 24. Certain rare genetic conditions might affect the progression and treatment outcomes in hepatitis C infection, with ongoing research aiming to better understand these genetic factors and their role in personalized medicine. 25. The introduction of second-generation direct-acting antivirals marked a milestone in the management of hepatitis C, as these drugs target multiple stages of the viral life cycle, offering improved efficacy and tolerability compared to older treatments. 26. The hepatitis C virus can survive outside the body for several weeks, which highlights the importance of environmental cleaning and sterilization procedures, particularly in settings like healthcare facilities. 27. Besides liver damage, patients with chronic hepatitis C may develop insulin resistance and type 2 diabetes, necessitating diligent monitoring and management of these metabolic disorders as part of comprehensive care. 28. The global burden of hepatitis C is substantial, with millions affected across diverse geographies, necessitating international collaboration and tailored strategies to effectively manage and eliminate the disease. '29. Recent advancements in blood testing technology allow for early detection of hepatitis C, including the use of rapid diagnostic tests, which enhance screening efforts particularly in resource-limited settings. 30. Injection drug use remains the most significant risk factor for hepatitis C transmission in high-income countries, driving initiatives aimed at harm reduction, such as needle exchange programs to mitigate disease spread. 31. Chronic hepatitis C infection can affect mental health, contributing to cognitive impairment or depression, which calls for an integrative treatment approach that includes psychosocial support services. 32. Healthcare workers are at occupational risk for hepatitis C due to potential needle stick injuries, making adherence to standard precautions and the use of safety-engineered devices vital to prevent transmission. 3. Antiviral resistance in hepatitis C treatment is rare but can occur in poorly adherent patients or those with prior treatment experience, making rigorous follow-up and education on adherence crucial for achieving optimal outcomes. 34. Given that hepatitis C can lead to hepatic encephalopathy, a condition characterized by confusion and altered consciousness due to liver dysfunction, monitoring and preventive strategies, including supplemental treatment to manage ammonia levels, are critical. 35. Exposure to hepatitis C does not confer protective immunity as seen in some other viral infections, thus individuals remain susceptible to future reinfections and should continue adopting preventive measures post-treatment. 36. Hepatitis C virus belongs to the Flaviviridae family, possessing a single-stranded RNA genome, with its genotype and viral load influencing clinical manifestation, natural progression, and response to treatment. 37. In patients with hepatitis C cirrhosis, careful management and regular monitoring of liver function are essential, as portal hypertension can lead to life-threatening variceal hemorrhage if not controlled properly. Direct-acting antivirals targeting protease, nucleotide polymerase, and NS5A proteins are the cornerstone of modern hepatitis C treatment regimens, disrupting viral replication at different stages to achieve sustained virologic response. Co-infection with hepatitis B and hepatitis C complicates clinical management as both viruses have the potential to cause liver damage, necessitating individualized treatment strategies and careful monitoring for reactivation. Hepatitis C testing is recommended for all individuals born between 1945 and 1965 in the United States, as this cohort, often termed baby boomers, demonstrates a significantly higher prevalence of the infection. Although previously thought incurable, advancements in hepatitis C research have highlighted the critical role of the host immune system, leading to innovative therapies exploiting both direct-acting antivirals and immunomodulatory effects. Individuals with advanced liver fibrosis from chronic hepatitis C are at an increased risk for cardiovascular diseases such as myocardial infarction, pointing to the need for comprehensive health monitoring beyond just liver function. Adequate nutritional support is paramount in managing hepatitis C, with an emphasis on maintaining healthy body weight, optimizing liver function, and potentially reducing inflammation through a well-balanced diet. In pediatric hepatitis C infections, though rare, early diagnosis and treatment are key to preventing disease progression and ensuring long-term liver health, as children generally respond well to direct-acting antiviral regimens. Researchers continue to explore potential therapeutic vaccines for hepatitis C, focusing on stimulating the body's immune response to prevent infection or aiding in viral clearance in those already infected. Hepatitis C treatment adherence remains crucial in achieving viral eradication, as missing doses or incomplete therapy can lead to suboptimal outcomes and increased risk of developing drug-resistant virus strains. While telemedicine has expanded access to hepatitis C care, contributing to improved treatment uptake in remote or underserved areas, ongoing challenges include ensuring adequate patient follow-up and managing compliance. The social stigma associated with hepatitis C can be a barrier to diagnosis and treatment. Therefore, public health initiatives must address misconceptions and educate communities to foster an environment conducive to seeking care. Recent efforts in mapping the hepatitis C genome have provided insights into viral diversity and mechanisms of persistence, paving the way for more effective and targeted therapies that could potentially lead to the virus's eradication. Understanding the role of liver stiffness measurement via transient elastography offers a non-invasive method to assess liver fibrosis in hepatitis C patients, aiding in diagnosis and monitoring disease progression without the need for liver biopsy. Cardiovascular disease, often abbreviated as CVD, encompasses a range of heart and blood vessel disorders, including coronary artery disease, heart failure, and hypertension, which are primarily caused by atherosclerosis, a condition characterized by the buildup of fatty plaques on the arterial walls, leading to compromised blood flow and potential myocardial infarction or stroke. The heart's electrical system controls the rhythm of your heartbeats. Any disruption in the normal conduction pathways can result in arrhythmias, which are abnormal heart rhythms that can range from benign, such as premature ventricular contractions, to life-threatening, such as ventricular fibrillation, requiring prompt medical intervention like defibrillation or antiarrhythmic drugs. Three. Hypertension, or high blood pressure, is termed the silent killer because it often presents without symptoms but leads to significant damage to the cardiovascular system over time, contributing to the hardening of arteries, increased workload on the heart, and eventually leading to complications such as stroke, heart attack, and chronic kidney disease. 4. Atherosclerosis is the progressive buildup of plaques composed of cholesterol, fatty substances, cellular waste products, calcium, and fibrin within the inner lining of the arteries, resulting in narrowed and stiffened arteries, which reduce blood flow and oxygen supply to vital organs, and is a major underlying cause of cardiovascular diseases like coronary artery disease. 5. Heart failure is a chronic condition where the heart muscle becomes weakened and cannot pump blood efficiently to meet the body's needs, often resulting from damage from coronary artery disease, long-standing high blood pressure, or cardiomyopathy, leading to symptoms such as shortness of breath, fatigue, and fluid retention. 6. Angina pectoris is a clinical syndrome characterized by episodes of chest pain or discomfort due to myocardial ischemia, which occurs when the coronary arteries are unable to supply sufficient blood flow to the heart muscle, typically triggered by physical exertion or emotional stress, and is often relieved with rest or nitroglycerin. 7. The Framingham Risk Score is a widely used tool to estimate an individual's 10-year risk of developing coronary heart disease, based on factors such as age, sex, cholesterol levels, blood pressure, smoking status, and the presence of diabetes, thereby guiding clinician decision-making regarding interventions to reduce cardiovascular risk. 8. The gold standard for diagnosing coronary artery disease is coronary angiography, an invasive imaging procedure which involves injecting a contrast dye into the coronary arteries through a catheter, typically inserted via the femoral or radial artery, allowing for direct visualization of any stenosis or blockages that may require treatment such as angioplasty or coronary artery bypass grafting. 9. Statins are a class of lipid-lowering medications that inhibit HMG-CoA reductase, an enzyme involved in cholesterol synthesis in the liver, thereby effectively reducing LDL cholesterol levels in the bloodstream, stabilizing atherosclerotic plaques, and significantly decreasing the risk of major cardiovascular events such as heart attacks and strokes. 10. Echocardiography, a non-invasive imaging technique utilizing ultrasound waves, provides detailed information about the heart's structure and function, enabling clinicians to assess parameters such as ejection fraction, wall motion abnormalities, valve abnormalities, and any presence of pericardial effusions, thus guiding diagnosis and management in cardiovascular conditions. 11. Peripheral artery disease (PAD) is a circulatory problem in which narrowed arteries reduce blood flow to the limbs, usually caused by atherosclerosis, and typical symptoms include cramping, pain, or fatigue in the leg or hip muscles during activity, known as claudication, which often improves with rest, but may require medical management and lifestyle modifications. 12. Myocardial infarction, commonly known as a heart attack, results from the complete blockage of blood flow to a part of the heart muscle, often due to a ruptured atherosclerotic plaque and subsequent blood clot formation, leading to irreversible myocardial injury unless promptly treated, usually with reperfusion therapy such as thrombolysis or percutaneous coronary intervention. 13. The renin-angiotensin-aldosterone system, RAS, plays a critical role in regulating blood pressure and fluid balance, and its overactivity can contribute to the development of hypertension and heart failure, with medications such as ACE inhibitors and angiotensin receptor blockers effectively used to interrupt this pathway and manage these conditions. 14. Cardiac rehabilitation is a medically supervised program designed to improve the cardiovascular health of patients who have experienced a heart attack, heart failure, or undergone heart surgery, encompassing exercise training, education on heart-healthy living, and counseling to reduce stress, thereby significantly enhancing quality of life and reducing recurrence risk. #15. Sudden cardiac death is a catastrophic event caused by the abrupt loss of heart function, often due to ventricular tachyarrhythmias triggered by structural heart diseases or coronary artery disease, and can sometimes be prevented with the use of implantable cardioverter defibrillators in high-risk individuals with known heart conditions. #16. Biomarkers such as troponins are proteins released into the bloodstream during myocardial injury, and their measurement is critical in the early detection and diagnosis of acute coronary syndromes, as elevated levels of cardiac-specific troponins provide a sensitive and specific indication of myocardial infarction, guiding timely therapeutic strategies. #17. The DASH diet, which stands for Dietary Approaches to Stop Hypertension, emphasizes the consumption of fruits, vegetables, whole grains, lean proteins, and low-fat dairy products while reducing salt, red meat, and added sugars, and has been shown to be effective in lowering blood pressure and reducing overall cardiovascular risk when incorporated into daily life. #18. Anomalous coronary arteries, a congenital defect occurring when a coronary artery originates from an improper location, can lead to compromised blood supply, especially under increased cardiac demand, and although often asymptomatic, they can result in myocardial ischemia and sudden cardiac death, requiring surgical correction in symptomatic cases. #19. The ankle brachial index, ABI, is a simple, non-invasive test used to assess the presence of peripheral artery disease, calculated by dividing the systolic blood pressure in the ankle by the systolic blood pressure in the brachial artery, with an ABI of less than 0.9 indicating significant arterial narrowing that warrants further investigation or intervention. #20. Atrial fibrillation is the most common cardiac arrhythmia and is characterized by rapid and irregular beating of the atria, often leading to poor blood flow, increased risk of thromboembolism, and stroke, necessitating management strategies including rate control, rhythm control, and anticoagulation to mitigate associated risks and complications. #21. Lipoprotein A is an independent risk factor for cardiovascular disease, with elevated levels contributing to atherosclerosis and thrombosis due to its pro-inflammatory and pro-atherogenic properties, and although not routinely tested in standard lipid panels, it is considered in patients with premature heart disease or a family history of cardiovascular events. #22. Cardiac catheterization is a diagnostic procedure where a catheter is inserted into a blood vessel and threaded to the heart under fluoroscopic guidance, used to evaluate coronary artery blockages, measure pressures within the heart chambers, and examine cardiac function, often serving as a precursor to interventions like stenting or balloon angioplasty. #23. High-sensitivity C-reactive protein, HSCRP, is an inflammatory biomarker used to assess cardiovascular risk, with elevated levels indicating systemic inflammation and an increased likelihood of atherosclerotic cardiovascular disease, prompting lifestyle changes and possibly pharmacotherapy to reduce inflammation and prevent adverse cardiovascular events. #24. The heart's preload, a concept referring to the ventricular end diastolic volume, influences cardiac output by affecting the degree of myocardial fiber stretch prior to contraction, with conditions such as hypovolemia reducing preload, whereas fluid overloads or valvular disorders may increase it, impacting overall cardiac performance and hemodynamics. #25. Coronary artery bypass grafting, CABG, is a surgical procedure employed to restore adequate blood flow to the heart by bypassing blocked coronary arteries using a graft, typically harvested from the saphenous vein or internal mammary artery, improving symptoms of angina and reducing the risk of myocardial infarction in patients with severe coronary artery disease. (26) The cardiac conduction system comprises specialized tissue that controls the heart's rhythmic beating, beginning at the sinoatrial node, the natural pacemaker, transmitting impulses through the atrioventricular node, bundle of His and Purkinje fibers, ensuring coordinated contraction of the atria and ventricles necessary for efficient blood pumping. 27. Erectile dysfunction, though primarily a sexual health issue, often serves as an early indicator of cardiovascular disease, as endothelial dysfunction affecting blood vessel health impairs vasodilatory responses, mirroring similar changes in coronary circulation, thus warranting cardiovascular evaluation in patients presenting with this condition. Lipid profile testing measures the levels of various types of cholesterol and triglycerides in the blood, including HDL, LDL, and total cholesterol, providing valuable information regarding an individual's risk for atherosclerosis and cardiovascular disease, and guiding treatment plans to achieve target lipid levels through dietary, lifestyle, and pharmacologic means. The heart's afterload refers to the resistance the left ventricle must overcome during systole to eject blood, heavily influenced by systemic vascular resistance and arterial pressure, with conditions such as hypertension significantly increasing afterload, contributing to left ventricular hypertrophy and ultimately impairing overall cardiac efficiency. Hypertrophic cardiomyopathy is a genetic condition characterized by abnormal thickening of the heart muscle, often affecting the septum between the ventricles, leading to impaired diastolic function, potentially causing outflow obstruction, arrhythmias, or sudden cardiac death, with management focusing on symptom control and risk reduction via medication or surgery. Carotid artery disease, involving the narrowing or blockage of the major arteries in the neck caused by atherosclerosis, poses a significant risk for transient ischemic attacks, TIAs, or strokes due to reduced cerebral perfusion or embolization of plaque material to the brain, necessitating management with antiplatelet therapy, lifestyle modifications, and sometimes surgical intervention like carotid endarterectomy or stenting. Aortic stenosis is a condition characterized by the narrowing of the aortic valve opening, limiting blood flow from the left ventricle into the aorta, often due to age-related calcification or congenital bicuspid valve deformities, leading to symptoms such as chest pain, syncope, or heart failure, and typically managed with valve replacement surgery when severe. Cardiac magnetic resonance imaging (MRI) is a non-invasive diagnostic tool that uses powerful magnets and radio waves to create detailed images of the heart, allowing for precise evaluation of cardiac structure, function, tissue characterization, and assessment of myocardial scarring or fibrosis, often employed in the diagnosis of cardiomyopathies, congenital abnormalities, or post-infarct recovery assessment. Kawasaki disease, primarily affecting children under 5 years old, is an acute, self-limited vasculitis that can lead to coronary artery aneurysms if untreated, presenting with symptoms such as prolonged fever, rash, conjunctivitis, and swollen lymph nodes, and is typically managed with early intravenous immunoglobulin and aspirin therapy to prevent cardiac complications. Venous thromboembolism (VTE) refers to the formation of blood clots in the venous system, manifesting as deep vein thrombosis (DVT) or pulmonary embolism (PE), posing significant cardiovascular risk due to potential embolization to the lungs, and typically managed through anticoagulation therapy such as heparin or warfarin to prevent complications or recurrence. Rheumatic heart disease, a consequence of rheumatic fever following untreated group A streptococcal infections, leads to chronic damage of cardiac valves, particularly the mitral and aortic valves, causing stenosis or regurgitation, resulting in heart failure over time, and is preventable through prompt antibiotic treatment of streptococcal infections and prophylaxis in those with a history of rheumatic fever. '37. Cocaine use exerts significant cardiovascular consequences due to potent stimulation of the sympathetic nervous system, resulting in increased heart rate, blood pressure, and risk of myocardial ischemia or infarction, arrhythmias, and sudden cardiac death even in young users, emphasizing the need for recognition and management of substance use in patients with cardiovascular presentations. '38. Pericarditis is the inflammation of the pericardium, the double-layered sac surrounding the heart, and can present with sharp chest pain, pericardial friction rub, and ECG changes such as diffuse street segment elevation, managed with anti-inflammatory treatments and monitoring for complications like pericardial effusion or constrictive pericarditis, which may require surgical intervention. '39. Beta blockers, a class of medications that reduce heart rate and myocardial oxygen demand, are commonly used in the management of various cardiovascular conditions including hypertension, ischemic heart disease, and heart failure, and have a secondary role in reducing the risk of sudden cardiac death in patients with heart failure or post-myocardial infarction. '40. Mitral valve prolapse (MVP) is a disorder involving the improper closure of the valve between the left atrium and left ventricle due to redundant or elongated valve leaflets, often causing regurgitation of blood into the atrium, with a majority of cases being asymptomatic but some presenting with palpitations or atypical chest pain, managed through regular monitoring and symptomatic treatment. '41. Diabetic cardiomyopathy is a distinct form of heart disease in diabetes patients, not directly related to other cardiovascular conditions, characterized by myocardial dysfunction due to chronic hyperglycemia, leading to fibrosis, left ventricular hypertrophy, and ultimately heart failure, emphasizing the importance of strict glycemic control and heart failure risk factor management in diabetic populations. '42. Electrophysiological studies, EPS, are invasive procedures used to diagnose and evaluate arrhythmias by recording electrical activity and mapping conduction pathways in the heart, guiding treatment decisions for complex cases of recurrent arrhythmias, often leading to therapeutic interventions like catheter ablation to correct abnormal rhythm sources. '43. Endothelial dysfunction is an early marker of vascular disease wherein the inner lining of blood vessels fails to regulate vascular tone, coagulation, and inflammation effectively, often triggered by risk factors like smoking, insulin resistance, hypertension, and hyperlipidemia, and plays a critical role in the pathogenesis of atherosclerosis and related cardiovascular events. '44. Valvular heart disease comprises abnormalities of one or more heart valves leading to stenosis, where the valve doesn't open fully, or regurgitation, where it doesn't close completely, often progressing due to degenerative changes, rheumatic heart disease, or infective endocarditis, potentially necessitating medical management or surgical repair, replacement to restore normal hemodynamics. '45. Metabolic syndrome is a cluster of conditions including abdominal obesity, dyslipidemia, hypertension, and insulin resistance, significantly increasing the risk for cardiovascular diseases and type 2 diabetes, necessitating comprehensive lifestyle interventions and possibly pharmacotherapy to reduce these risk factors and prevent associated cardiovascular outcomes. '46. The heart's systolic function is the ability of the ventricles to contract and generate enough pressure to eject blood into the circulation, commonly assessed by left ventricular ejection fraction, LVEF, during imaging studies, with reduced systolic function often indicating heart failure with reduced ejection fraction, HFrEF, and requiring targeted therapeutic strategies to improve cardiac performance. 47. Unstable angina, a form of acute coronary syndrome, is characterized by new or worsening chest pain that occurs at rest or with minimal exertion, indicative of acute myocardial ischemia due to transient reduction in coronary blood flow, requiring urgent medical attention and treatment with anticoagulants, antiplatelets, and possibly coronary revascularization to stabilize the condition. 48. The coronary calcium score, obtained via non-invasive CT scanning, quantifies the extent of calcified plaque in coronary arteries and serves as a predictive marker for future cardiovascular events, aiding in risk stratification and the decision to implement preventive strategies for patients with intermediate risk of atherosclerotic cardiovascular disease. The vagus nerve plays a pivotal role in modulating heart rate through the parasympathetic nervous system, promoting a decrease in heart rate and blood pressure, thus providing a counterbalance to the sympathetic system, with vagal maneuvers or vagus nerve stimulators being utilized in clinical settings to manage certain tachyarrhythmias by enhancing parasympathetic tone. 50. Cardiogenic shock is a critical condition marked by inadequate cardiac output to meet metabolic demands, typically resulting from extensive myocardial infarction or decompensated heart failure, leading to severe hypotension, organ hypoperfusion, and metabolic acidosis, necessitating prompt recognition and aggressive medical interventions such as inotropes, mechanical circulatory support, or revascularization to restore hemodynamic stability. 1. Brain tumors can be classified into primary and secondary types, with primary tumors originating within the brain itself, while secondary tumors, known as metastatic brain tumors, result from cancer cells spreading to the brain from other parts of the body such as the lungs, breasts, or kidneys, which makes their management and prognosis considerably different from primary brain tumors. 2. The grading of brain tumors is essential in predicting their behavior and prognosis. Tumors are classified by the World Health Organization, WHO, on a scale of I to IV, with grade 1 tumors being the least aggressive, often benign and slow-growing, while grade 4 tumors, such as glioblastomas, are highly malignant, invasive, and associated with poor survival rates. 3. The most common type of malignant primary brain tumor in adults is glioblastoma multiforme, also known as grade 4 astrocytoma, characterized by rapid growth, high invasiveness, and resistance to conventional therapies, leading to an average survival rate of approximately 15 months despite aggressive treatment. 4. Imaging techniques, particularly magnetic resonance imaging, MRI, using contrast agents, are the cornerstone in the diagnosis and characterization of brain tumors, allowing for detailed visualization of the tumor's size, location, and effect on surrounding brain structures, thereby guiding the surgical and therapeutic approach. 5. Symptoms of brain tumors can vary widely depending on their size, type, and location within the brain, with common symptoms including headaches, seizures, cognitive or personality changes, nausea, vomiting, vision or speech problems, and focal neurological deficits, which necessitate prompt medical evaluation and intervention. 6. Surgical intervention is a primary treatment modality for brain tumors, aiming to reduce tumor mass, relieve intracranial pressure, obtain tissue for histological diagnosis, and improve neurological function, with the extent of resection often positively correlating with improved patient outcomes and survival. 7. Radiotherapy, including stereotactic radiosurgery and fractionated external beam radiation, plays a key role in the management of brain tumors, particularly when complete surgical removal is not possible, as it targets tumor cells while sparing normal brain tissue, thereby helping to control tumor growth and enhance survival rates. 8. Chemotherapy for brain tumors involves the use of cytotoxic or targeted drugs to kill or inhibit the growth of cancer cells, with temozolomide being a commonly used oral alkylating agent that crosses the blood-brain barrier, improving survival particularly in patients with certain genetic profiles such as MGMT promoter methylation. 9. Advances in molecular genetics have transformed the understanding and classification of brain tumors, with genetic and epigenetic alterations such as IDH mutations, 1p19q co-deletions, and TERT promoter mutations providing insights into tumor behavior, prognosis, and guiding personalized therapeutic strategies. Pediatric brain tumors differ significantly from those in adults, with types like medulloblastoma and pilocytic astrocytoma being more common, and treatment often involves a multimodal approach of surgery, radiotherapy, and age-adjusted chemotherapy, balancing the need for effective disease control with minimizing long-term developmental and neurological sequelae. Brain tumor recurrence is a significant challenge and can occur even after initial aggressive treatment, requiring ongoing surveillance with imaging studies and clinical evaluation, and often necessitating repeat interventions such as surgery, modified radiotherapy protocols, or second-line chemotherapy regimens to manage recurrent disease. Steroids like dexamethasone are frequently administered to brain tumor patients to reduce peritumoral edema, thereby alleviating symptoms such as headache or neurological deficits, as they decrease inflammation and intracranial pressure, although careful management is required to avoid potential long-term side effects of steroid use. The role of immunotherapy is evolving in the treatment landscape of brain tumors, with approaches like checkpoint inhibitors, cancer vaccines, and chimeric antigen receptor T-cell (CAR T-cell) therapies showing promise in enhancing the immune system's ability to recognize and target tumor cells, although their effectiveness and safety continue to be areas of active research. Cognitive rehabilitation and supportive care are integral components of managing patients with brain tumors, addressing the cognitive, emotional, and functional impairments that can result from the tumor or its treatment, thereby improving quality of life and facilitating better adjustment and coping for patients and their families. A multidisciplinary approach is essential in the treatment of brain tumor patients, involving collaboration among neurosurgeons, neuro-oncologists, radiologists, pathologists, radiation oncologists, and palliative care teams, to tailor personalized treatment plans that are based on the unique aspects of each patient's tumor and their own health status. The blood-brain barrier presents a significant challenge in the treatment of brain tumors, as it selectively restricts the passage of most drugs into the brain. Thus, ongoing research is directed at developing novel drug delivery systems such as nanoparticles or convection-enhanced delivery to improve drug penetration into the central nervous system. Perfusion and diffusion MRI techniques provide additional information about brain tumors beyond conventional imaging, with perfusion MRI assessing blood flow within the tumor, which can indicate its aggressiveness, while diffusion MRI evaluates the movement of water molecules in tissue, aiding in the differentiation between tumor types and treatment effects. Seizure management is a crucial aspect in the care of brain tumor patients, as seizures can be both a presenting symptom and a complication, often necessitating the use of anti-epileptic drugs to prevent recurrence, although careful selection and monitoring of medication is required to balance efficacy with potential side effects. Psychosocial support and mental health interventions are vital for brain tumor patients, as the diagnosis and treatment journey can significantly impact mental well-being, with psychological counseling, support groups, and social services playing a role in addressing anxiety, depression, and the psychosocial burden associated with chronic illness management. 20. The distinct vascular networks of some brain tumors, particularly gliomas, can lead to angiogenesis, the formation of new blood vessels, which supports their growth and survival, thereby making anti-angiogenic therapies like bevacizumab an additional treatment option for targeting these vascular-rich tumors and improving tumor control. #21. Prophylactic administration of anti-seizure medication is sometimes considered in brain tumor management to preemptively minimize the risk of seizures in patients with a high likelihood of developing them, particularly when undergoing surgical interventions, although the routine use of such prophylaxis remains a topic of debate in clinical practice. #22. The ketogenic diet, characterized by high fat and low carbohydrate intake, has been investigated as a potential adjuvant therapy for some types of brain tumors, with the hypothesis that the diet's metabolic effects may preferentially starve tumor cells reliant on glucose for energy, although further studies are needed to substantiate its efficacy and safety. #23. Ocular and visual symptoms can be indicative of the presence of a brain tumor, especially those located near the optic pathways or cranial nerves, resulting in issues like visual field defects, loss of visual acuity, or even double vision, thus necessitating comprehensive ophthalmologic assessments as part of the diagnostic evaluation. #24. Brain metastasis are a common complication in cancer patients, particularly those with aggressive systemic cancers. The management of brain metastasis often involves a combination of surgical resection, whole brain radiation therapy, stereotactic radiotherapy, and systemic therapies based on the primary cancer type, with prognosis contingent upon the number, size, and control of primary disease. #25. Exploratory clinical trials and compassionate use programs offer brain tumor patients access to cutting-edge therapies and investigational drugs not yet widely available, providing an opportunity to potentially benefit from novel treatment approaches when standard therapies have been exhausted, although this requires careful assessment of potential risks and benefits. #26. Paraneoplastic syndromes, which involve remote effects of cancer, can occasionally occur in brain tumor patients, presenting with a variety of neurological symptoms due to mechanisms such as immune-mediated damage to the nervous system, often requiring additional evaluation to differentiate them from direct effects of the tumor itself. #27. Epigenetic changes in brain tumors, such as DNA methylation patterns, histone modifications, and non-coding RNA expression, have gained attention as important factors influencing tumor behavior, treatment response, and patient prognosis, and are currently being investigated as potential therapeutic targets and biomarkers for personalized treatment. #28. Tumor Treating Fields, TT fields, therapy is a novel, non-invasive treatment for glioblastomas that uses alternating electric fields to disrupt cell division, and when combined with traditional chemotherapy, has shown to improve progression-free and overall survival rates, offering an innovative approach to managing this aggressive cancer. #29. The incidence and prevalence of brain tumors have been increasing, possibly due to factors such as enhanced diagnostic imaging capabilities and environmental influences, making epidemiological studies essential for understanding risk factors, potential preventive measures, and resource allocation in healthcare systems globally while addressing this growing health concern. #30. Endocrine dysfunction, particularly pituitary hormone imbalances, can arise from brain tumors located near or affecting the hypothalamic pituitary axis, necessitating endocrinological evaluation and hormone replacement therapy to manage symptoms of hormone deficiencies or excess that can significantly impact the patient's health and well-being. #31. The challenges of pediatric brain tumor treatment involve not only addressing the tumor itself but also preserving the child's neurodevelopmental potential. Thus, treatment protocols often emphasize minimizing exposure to aggressive therapies like cranial radiation in very young children and emphasize the use of less toxic chemotherapeutic agents. 32. Emerging research on liquid biopsies for brain tumors involves analyzing circulating tumor DNA or other biomarkers in blood or cerebrospinal fluid, offering a non-invasive approach to tumor diagnosis, monitoring treatment response, and detecting early signs of recurrence, potentially transforming the standard care and management paradigms of brain tumors. Post-surgical rehabilitation for brain tumor patients focuses on enhancing recovery, promoting independence, and improving quality of life, involving individualized therapy plans that address deficits in motor skills, speech, language, and cognitive functions through practices like physical, occupational, and speech therapy. 34. The rapidly evolving field of personalized medicine in brain tumor treatment capitalizes on advancements in genomic and proteomic technologies to tailor therapeutic interventions based on the unique molecular characteristics of an individual's tumor, paving the way for more effective, targeted therapies and better patient outcomes. 35. Research into the use of artificial intelligence in brain tumor diagnosis and management is showing promise, with machine learning algorithms being developed to analyze medical imaging data and predict treatment responses or survival outcomes, enhancing the precision and efficiency of clinical decision-making processes. 36. Venous thromboembolism, VTE, is a known complication in brain tumor patients, with factors like immobility, surgery, and the hypercoagulable state induced by the tumor contributing to the risk. Hence, prophylactic measures including anticoagulation therapy are often considered to prevent the occurrence of potentially life-threatening blood clots. 37. Brain tumors can cause hydrocephalus, a condition where excess cerebrospinal fluid accumulates in the brain, leading to increased intracranial pressure and symptoms like headache, nausea, and cognitive disturbances. Treatment may require surgical interventions such as ventriculoperitoneal shunting to drain the fluid and alleviate pressure. 38. The resection of brain tumors near eloquent areas, those parts of the brain responsible for essential functions like language and movement, requires meticulous planning and intraoperative neuromonitoring to maximize tumor removal while preserving critical neurological functions, often involving the use of awake craniotomies or pre-surgical mapping techniques. 39. Meningiomas are the most common benign brain tumors, typically slow-growing and arising from the meninges, with surgical resection being the primary treatment especially for symptomatic tumors, though radiotherapy is also an option particularly for residual or inoperable meningiomas, with most patients having favorable outcomes. 40. Genetic syndromes such as neurofibromatosis and Li-Fraumeni syndrome predispose individuals to developing brain tumors, with these hereditary conditions causing increased surveillance and early intervention to detect and manage tumors as soon as possible, often involving a comprehensive care team specialized in genetic disorders. 41. Palliative care is a crucial aspect of brain tumor management, focusing on providing relief from symptoms and improving the quality of life for patients and their families through supportive treatments, effective pain management, psychosocial support, and advanced care planning, especially when dealing with progressive or terminal stages of the disease. 42. Intraoperative MRI is a cutting-edge technology that offers neurosurgeons real-time imaging during brain tumor surgery, allowing for immediate assessment of the extent of tumor resection and facilitating adjustments to surgical strategies, ultimately increasing the potential for more complete removals and better patient outcomes. 43. Environmental exposure to certain industrial chemicals or ionizing radiation has been implicated as a risk factor in the development of brain tumors, prompting ongoing research into identifying carcinogenic agents and implementing policies to reduce occupational and environmental risks associated with these hazardous exposures. 44. Brain tumors present unique ethical considerations in clinical trials, given the often grave prognosis and the need to balance experimental therapy access with patient safety, requiring rigorous protocols, informed consent, and ethical oversight to ensure the rights and well-being of participants are protected throughout the research process. The development of drug resistance in brain tumors, particularly in glioblastomas, poses a significant challenge, with mechanisms such as the expression of drug efflux transporters, genetic mutations, and microenvironmental factors contributing to resistance and highlighting the necessity for research into novel therapeutic approaches and combination therapies. The early detection of brain tumors, although challenging, remains a key focus in improving patient outcomes, with advancements in neuroimaging, biomarker discovery, and public awareness campaigns playing a role in promoting earlier diagnosis and timely intervention before tumors reach an advanced or inoperable stage. Brain tumor survivors may experience long-term effects such as neurocognitive deficits, endocrine disorders, and psychosocial challenges, requiring continuous follow-up care and rehabilitation to manage these outcomes effectively and support survivors in achieving optimal functioning and quality of life post-treatment. Surgical advances in the use of laser interstitial thermal therapy (LITT) offer a minimally invasive option for treating certain brain tumors, utilizing laser-induced heat to ablate tumor tissue, guided by real-time MRI, providing an alternative for tumors in difficult-to-access locations or for patients unable to undergo traditional surgery. Nutritional support and management are fundamental in the care of brain tumor patients, addressing issues like weight loss, appetite changes, and treatment-related side effects, with dietitians playing a key role in providing tailored dietary recommendations to optimize the patient's nutritional status and overall well-being during and after treatment. Public awareness and education about brain tumors are crucial for early detection and improving treatment outcomes, with initiatives focused on educating people about the signs and symptoms, encouraging timely medical evaluation, and promoting research funding to foster advancements in diagnosis, treatment, and ultimately, survival rates for brain tumor patients. Hepatitis B is a viral infection caused by the hepatitis B virus that primarily affects the liver, leading to both acute and chronic disease states, with symptoms such as jaundice, fatigue, and abdominal pain often seen in acute cases, while chronic infection can progress to cirrhosis or liver cancer over several years if left untreated, highlighting the importance of early diagnosis and intervention. The hepatitis B virus is a small, enveloped DNA virus belonging to the Hepatnaviridae family, and it replicates through an RNA intermediate using reverse transcription, which is a unique feature among DNA viruses and contributes to its ability to establish a persistent infection in the host liver cells. Diagnosis of hepatitis B infection involves serological testing for surface antigens, HBsAg, surface antibodies, anti-HBs, and core antibodies, anti-HBc, which together help to determine the infection status, such as acute, chronic, or resolved infection, and vaccination response. Hepatitis B surface antigen, HBsAg, is often the first marker to appear in the blood following infection and serves as an indicator of active viral replication, while the persistence of HBsAg beyond 6 months usually indicates progression to chronic hepatitis B infection. The presence of hepatitis B antigen, HBsAg, in the blood is associated with higher levels of viral replication and infectivity, and its conversion to anti-HBe antibodies, HBe seroconversion, often signifies a reduction in viral activity and an improved prognosis in chronic hepatitis B patients. In chronic hepatitis B, liver histopathology may reveal varying degrees of inflammation, fibrosis, or cirrhosis, and liver biopsy remains a useful diagnostic tool to assess the extent of liver damage and guide therapeutic decisions, although non-invasive tests are increasingly used to evaluate liver fibrosis. 7. The primary treatment goals in managing chronic hepatitis B are to prevent disease progression such as cirrhosis or hepatocellular carcinoma, reduce viral load to undetectable levels, and enhance the patient's quality of life. These are achieved through antiviral therapy with drugs like tenofovir or entecavir. 8. Antiviral medications like tenofovir disoproxil fumarate or entecavir are recommended as first-line therapy for chronic hepatitis B due to their high barrier to developing viral resistance, potent suppression of viral replication, and satisfactory safety profile, though patient monitoring for potential renal or bone side effects is necessary. 9. Pegylated interferon alpha therapy can be an alternative treatment option for some patients with chronic hepatitis B, particularly in those with genotype A infection or younger patients, as it may lead to higher rates of HB-Zag clearance, representing functional cure, though the treatment is limited by its considerable side effects. 10. The prevention of hepatitis B transmission relies heavily on vaccination, with the hepatitis B vaccine, consisting of purified HB-Zag, being highly effective at inducing protective immunity and recommended for all infants at birth, healthcare workers, and other high-risk groups to curb the spread of the virus. 11. Mother-to-child transmission of hepatitis B can be significantly reduced by administering the hepatitis B vaccine and hepatitis B immune globulin, HBIG, to newborns within 12 hours of birth, especially if the mother is HB-Zag positive, thereby preventing the development of chronic hepatitis B in the infant. 12. Chronic hepatitis B infection is a major global health issue, with over 296 million people estimated to be infected worldwide, leading to significant morbidity and mortality as it causes liver-related complications such as cirrhosis and hepatocellular carcinoma, highlighting the importance of public health measures for prevention and control. 13. Hepatitis B virus can be transmitted in several ways, including through unprotected sexual contact, exposure to infected blood, perinatal transmission from an infected mother to her child, and through unsafe injections or blood transfusions, necessitating comprehensive prevention strategies to reduce transmission rates. 14. The incubation period for hepatitis B ranges from 30 to 180 days, during which time the virus proliferates in liver cells, leading to symptoms of acute hepatitis as the immune system mounts a response. Symptoms include malaise, anorexia, nausea, and jaundice, which often indicate liver inflammation. 15. In early acute hepatitis B infection, liver enzymes such as alanine aminotransferase (ALT) and aspartate aminotransferase (AST) are elevated, reflecting liver cell injury, while the return of these enzymes to normal levels often indicates recovery, although chronic infection may develop in a minority of cases. 16. The interplay between the hepatitis B virus and the host immune system plays a crucial role in determining the outcome of infection. The virus employs various mechanisms to evade immune detection, and the strength of the host's immune response influences whether the infection resolves spontaneously or becomes chronic. 17. Regular monitoring of individuals with chronic hepatitis B involves periodic assessments of liver enzymes, hepatitis B viral DNA levels through PCR testing, and imaging studies to screen for liver cancer, which helps guide treatment decisions and detect complications such as cirrhosis or hepatocellular carcinoma at an early stage. 18. Hepatitis B infection management has evolved with guidelines recommending risk stratification based on factors like age, family history of liver disease or cancer, and the presence of cirrhosis, which help tailor treatment approaches to individual patients for optimizing outcomes and preventing liver complications. Hepatitis B immunity can be conferred by past infection or vaccination, with the presence of anti-HBs antibodies indicating protective immunity, while individuals lacking these antibodies after successful vaccination may benefit from booster doses if they remain at high risk of exposure to the virus. Hepatitis B-related liver cancer is one of the leading causes of cancer-related deaths worldwide, and the development of hepatocellular carcinoma, HCC, is more common in patients with ongoing viral replication, co-infections with hepatitis C or D, or lifestyle factors like heavy alcohol consumption, emphasizing the need for routine HCC screening in high-risk populations. Hepatitis B DNA polymerase enzyme is a key target for antiviral drugs as it is essential for viral replication. Nucleose T-ide analogs inhibit this enzyme effectively, leading to suppression of viral replication and reduction of liver inflammation and fibrosis in treated individuals, although therapy may be lifelong in some cases. Chronic hepatitis B can progress through different phases, including immune tolerance, immune clearance, inactive carrier state, and reactivation, with each phase characterized by distinct viral replication levels and liver inflammation profiles, which inform monitoring and treatment strategies for managing the infection. Co-infection with hepatitis D virus, HDV, can occur in patients with hepatitis B, leading to more severe liver disease, as HDV requires hepatitis B surface antigen for replication. This combination requires specialized management as it poses a higher risk for rapid progression to cirrhosis and liver cancer. Pregnancy in women with chronic hepatitis B requires careful management, with antiviral therapy recommended in the third trimester for mothers with high viral loads to decrease the risk of mother-to-child transmission, alongside routine neonatal vaccination and administration of HBIG to at-risk newborns. Many individuals with occult hepatitis B infection have undetectable HBsAg despite being carriers of the virus, posing a diagnostic challenge. These individuals often demonstrate the presence of HBV DNA in liver or serum samples and are at increased risk for the development of liver disease, particularly if co-infected with HCV or HIV. Hepatitis B can cause a wide range of extrahepatic manifestations such as polyarthritis nodosa, glomerulonephritis, and vasculitis, which result from immune complex deposition and hypersensitivity reactions, necessitating vigilant identification and multisystem management in affected individuals. The hepatitis B vaccine is an inactivated vaccine composed of non-infectious HBsAg particles produced through recombinant DNA technology, and its administration induces an immune response that protects over 95% of vaccinated individuals for at least 20 years, although routine booster doses are not generally recommended for immunocompetent persons. Vaccination against hepatitis B has resulted in a dramatic decrease in the incidence of new infections, particularly among children and young adults due to robust immunization programs initiated globally, which has contributed significantly to the decrease in hepatitis B-related morbidity and mortality over the past few decades. Liver function tests, LFTs, are crucial in the assessment of hepatitis B infection, as they provide information on the extent of liver damage, with elevated levels of ALT and AST indicating hepatocellular injury, while monitoring changes in these enzymes is critical in evaluating treatment efficacy and liver disease progression. 30. Antiviral therapy for hepatitis B has evolved significantly, with the introduction of potent nucleose (T)ide analogs that offer patients prolonged viral suppression, thereby reducing the risk of liver disease progression and complications. And while viral eradication remains challenging, functional cure defined by the loss of HBsAg is an achievable treatment endpoint for some patients. In individuals with resolved hepatitis B infection, characterized by the presence of anti-HBC and anti-HBs antibodies without detectable HBsAg, reactivation of hepatitis B can occur under certain circumstances, such as immunosuppressive therapy, necessitating prophylactic antiviral treatment to prevent flare-ups of hepatitis. The innate immune response plays a critical role in the initial defense against hepatitis B infection by recognizing viral components through pattern recognition receptors, including Toll-like receptors, leading to the activation of interferon-stimulated genes which modulate the replication of the virus. Lamivudine was one of the first antiviral drugs approved for hepatitis B, and although it was effective in reducing viral load and improving liver function initially, its long-term use is limited by the rapid emergence of drug-resistant HBV strains, emphasizing the need for newer agents with a higher genetic barrier to resistance. Sequencing of the hepatitis B virus genome has led to the identification of several genotypes, labeled A to J, which have variable geographical distribution and slightly differing replication efficiency, clinical outcomes, and response to therapy, thereby influencing regional treatment guidelines and vaccination programs. In cases of acute hepatitis B, the virus is often cleared spontaneously in immunocompetent adults, with less than 5% of these cases progressing to chronic infection, in contrast to neonates and young children who have a higher risk of developing chronic hepatitis B due to their immature immune system. Hepatitis B is considered an occupational hazard for healthcare workers due to potential exposure to infectious blood and body fluids, and strict adherence to standard precautions, along with vaccination, is essential in preventing transmission among healthcare professionals. The detection of hepatitis B DNA levels through quantitative PCR testing is a key component in monitoring chronic hepatitis B management, as it provides information on viral replication activity, helps assess treatment response, and guides adjustments in therapeutic strategies to achieve optimal virologic suppression. In patients with compensated cirrhosis secondary to hepatitis B, antiviral therapy can improve liver function and reduce the risk of decompensation, although close monitoring is necessary given the potential for serious complications, including hepatic decompensation and liver cancer, even during successful treatment. The hepatitis B precore and basal core promoter mutations affect viral replication and expression of the hepatitis B e antigen, commonly seen in patients with HBsAg-negative chronic hepatitis B. These mutations often result in more severe liver disease and require vigilant management to prevent adverse outcomes. The introduction of direct-acting antivirals for hepatitis C treatment has led to many coinfected with hepatitis B experiencing viral reactivation upon HCV clearance, necessitating careful monitoring and consideration of prophylactic antiviral therapy against hepatitis B in these patients. Hepatitis B can have profound psychosocial effects on affected individuals, as the stigma associated with chronic infection and potential transmission to others can lead to anxiety, depression, and social isolation, warranting comprehensive support and counseling to address these challenges alongside medical treatment. Chronic hepatitis B infection can significantly impact pregnancy outcomes, including increased risks of gestational diabetes, preterm birth, and low birth weight, and therefore requires collaboration between hepatologists and obstetricians to optimize maternal and neonatal health through careful monitoring and interventions. #43. Hepatitis B-related acute liver failure, though rare, is a life-threatening condition that requires immediate medical attention and potentially liver transplantation, with rapid deterioration seen in patients who develop severe coagulopathy, encephalopathy, and multi-organ failure. #44. Monitoring hepatitis B surface antigen quantification can provide prognostic information in chronic hepatitis B management, as a decline in HBs Ag levels is often associated with favorable clinical outcomes, including spontaneous disease resolution or successful response to antiviral therapy. #45. Adolescents and adults with hepatitis B often require vaccinations against hepatitis A if they are not already immune, as co-infection with both viruses can lead to more severe liver disease. Thus, hepatitis A vaccination is routinely recommended to reduce the risk of concomitant liver insults. #46. Patients with chronic kidney disease often have a higher prevalence of hepatitis B infection due to increased exposure from dialysis procedures, necessitating routine screening, vaccination of susceptible individuals, and careful evaluation of antiviral treatment regimens to minimize nephrotoxicity. #47. The adoption of universal blood screening for hepatitis B in blood donation centers has greatly reduced the risk of transfusion-related transmission, as blood donors are routinely tested for HBs Ag, ensuring that blood supplies are safer and protecting recipients from acquiring the virus through transfusions. #48. Chronic hepatitis B infection potentially elevates the risk of metabolic syndrome and cardiovascular disease secondary to chronic inflammation and liver disease, requiring integrated management strategies that address metabolic risk factors alongside liver-specific treatments. #49. Individuals co-infected with hepatitis B virus and HIV may require specialized antiretroviral therapy regimens that effectively target both viruses, as some medications used in HIV management, such as tenofovir, are also active against HBV, necessitating coordination between hepatologists and infectious disease specialists. #50. Understanding the transmission dynamics of hepatitis B in communities with a high prevalence of infection is critical for effective public health strategies, as tailoring prevention efforts, such as vaccination campaigns and education on safe practices, can substantially impact the overall burden of disease. #1. Liver cirrhosis, a condition often resulting from chronic alcohol consumption or viral hepatitis, is characterized by irreversible scarring of liver tissue, impairing its ability to detoxify the blood and produce vital proteins, which can result in a range of complications from ascites to hepatic encephalopathy, a state of confusion and altered mental status caused by the accumulation of toxins in the brain not processed by the failing liver. #2. The pathophysiology of liver cirrhosis involves progressive fibrosis, where the deposition of collagen by stellate cells in the liver disrupts normal architecture, leading to nodules that impede blood flow and induce portal hypertension, a dangerous rise in blood pressure within the portal vein system that can lead to esophageal varices and life-threatening bleeding. #3. Liver cirrhosis can be clinically diagnosed through a combination of patient history, physical examination, blood tests showing elevated liver enzymes and bilirubin, imaging studies revealing nodular liver surfaces, and confirmed by liver biopsy, which shows the extent of fibrosis and architectural distortion fundamental to staging the disease. #4. In patients with liver cirrhosis, portal hypertension can trigger the development of varices, particularly in the esophagus and stomach, where the increased pressure forces blood into collateral vessels, posing a risk for rupture and extensive upper gastrointestinal bleeding, which requires preventive treatment with beta blockers or endoscopic band ligation. 5. One crucial aspect of managing liver cirrhosis is monitoring for signs of hepatic encephalopathy, an often reversible complication characterized by cognitive decline, personality changes, and motor disturbances, which can be precipitated by factors like gastrointestinal bleeding, infection, or electrolyte imbalances, and is commonly treated with lactulose and rifaximin to decrease ammonia levels. Six. Ascites, the accumulation of fluid in the abdominal cavity due to liver cirrhosis, is primarily caused by portal hypertension and hypoalbuminemia, and can lead to abdominal distension and discomfort. Treatment strategies include salt restriction, diuretics such as spironolactone and furosemide, and possibly paracentesis or transjugular intrahepatic portosystemic shunt, TIPS, in refractory cases. 7. Although liver transplantation remains the definitive treatment for liver cirrhosis in selected patients, the development of newer antifibrinogen therapies focusing on halting or reversing the fibrotic process is a promising frontier in cirrhosis management, potentially changing the natural history of the disease by targeting pathways involved in stellate cell activation and fibrogenesis. 8. One innovative approach in treating liver cirrhosis involves utilizing mesenchymal stem cells, which exhibit an anti-inflammatory and antifibrinogen potential, providing hope in reducing liver fibrosis by modulating the immune response, reducing collagen deposition, and promoting regeneration of damaged hepatic tissue through paracrine signals. 9. Non-alcoholic steatohepatitis, NASH, a subtype of non-alcoholic fatty liver disease, NAFLD, can progress to cirrhosis through ongoing inflammation and steatosis-driven fibrosis, underscoring the importance of lifestyle modifications, such as weight loss and dietary interventions, in slowing disease progression and reducing liver transplant needs. 10. Recent advancements in imaging techniques, such as elastography, which uses ultrasound or MRI to measure liver stiffness, offer a non-invasive means of assessing liver fibrosis and approximating cirrhosis severity, guiding treatment decisions and reducing the reliance on invasive liver biopsy procedures for ongoing disease monitoring. 11. Patients with liver cirrhosis should be regularly screened for hepatocellular carcinoma, HCC, since chronic liver damage significantly increases the risk of developing primary liver cancer, with surveillance protocols typically including ultrasound examinations and alpha-fetoprotein, AFP, blood levels every 6 months to detect malignancy at an early, potentially curable stage. 12. Hepatorenal syndrome, a serious consequence of liver cirrhosis characterized by renal failure, arises due to alterations in blood flow and vascular resistance within the kidneys from severe portal hypertension and splanchnic vasodilation, necessitating interventions to restore hemodynamics, such as albumin infusion and the use of vasoconstrictors like terlipressin. 13. The Child-Pugh score, a pivotal tool in the management of liver cirrhosis, stratifies patients based on clinical and laboratory findings, including bilirubin, albumin levels, ascites presence, encephalopathy grade, and prothrombin time, into categories indicating disease severity and aiding in predicting prognosis and guiding therapeutic interventions. 14. Cirrhosis management extends beyond liver-focused treatments, emphasizing the importance of managing comorbid conditions like malnutrition, vitamin deficiencies, particularly fat-soluble vitamins, and metabolic bone disease, as impaired liver function affects nutrient metabolism, highlighting the need for comprehensive nutritional assessments and interventions. 15. Emerging genetic studies in liver cirrhosis have identified various single nucleotide polymorphisms, SNPs, associated with an increased propensity for fibrosis progression, offering a personalized medicine approach wherein genetic predispositions can guide surveillance and potentially targeted interventions to delay or prevent cirrhosis. 16. In cirrhotic patients with coagulopathy, a misunderstood aspect of liver pathology, the complex changes in coagulation factors can result in a paradoxical hemostatic profile, where they are prone to both bleeding and thrombosis. Thus, careful evaluation of coagulation status and careful use of anticoagulants is critical, particularly during surgical procedures. 17. Alcohol cessation, a cornerstone in the management of alcoholic liver cirrhosis, not only halts further liver damage but also provides the liver with the opportunity for partial regeneration and improvement in liver function, with robust alcohol counseling and support systems playing a crucial role in patient adherence and successful outcomes. 18. The gut-liver axis, a concept highlighting the bidirectional relationship between the liver and the intestinal microbiota, plays a significant role in the pathogenesis of liver cirrhosis, where dysbiosis and increased intestinal permeability may contribute to bacterial translocation, inflammation, and antibiotics in therapeutic strategies. 19. The MELD, Model for End-Stage Liver Disease, score provides an objective method for assessing the severity of liver disease and prioritizing liver transplantation candidates based on laboratory results, such as serum creatinine, bilirubin, and INR, emphasizing its role in predicting short-term survival and guiding treatment strategies. 20. Cirrhotic cardiomyopathy, a condition of impaired cardiac response to stressors in liver cirrhosis, is characterized by diastolic dysfunction, electrophysiological abnormalities, and impaired cardiac contractile function, necessitating awareness and appropriate cardiovascular management to prevent exacerbation of heart failure symptoms in advanced liver disease. 21. When caring for patients with liver cirrhosis, understanding the significance of small for size syndrome, which can occur following liver resection or transplantation, is crucial, as inadequate liver mass may not meet the metabolic demands of the body, leading to postoperative liver dysfunction, thus requiring careful preoperative assessment of liver volume and regenerative capacity. 22. The interplay between iron homeostasis and liver cirrhosis is complex, with secondary iron overload being a risk factor in certain patients. Careful assessment of serum ferritin and transferrin saturation levels is essential to guiding iron chelation therapy or phlebotomy to prevent additional hepatic injury or progression. 23. Pulmonary complications in liver cirrhosis, such as hepatopulmonary syndrome and portopulmonary hypertension, result from vascular changes and impaired oxygenation, requiring vigilant screening, diagnostic imaging, and the possibility of liver transplantation consideration, as these conditions significantly impact overall patient prognosis. 24. New insights into autophagy, a cellular process responsible for recycling damaged organelles and proteins, suggest its role in liver cirrhosis progression, where dysfunctional autophagy may exacerbate fibrosis, making it a potential target for drug therapies aimed at restoring this intracellular homeostasis and improving liver health. 25. In patients with liver cirrhosis, pruritus or itching represents a common and perplexing symptom potentially linked to elevated bile acids or endogenous opioid levels, often necessitating treatment with antihistamines, bile acid sequestrants, or opioid antagonists like naltrexone to alleviate this distressing condition and improve quality of life. 26. Bone health in cirrhotic patients is of significant concern due to increased risk for osteoporosis and fractures, primarily due to malabsorption of vitamin D, hypogonadism, and chronic inflammation. Therefore, regular bone density assessments and the use of calcium and vitamin D supplements or bisphosphonates are crucial in management plans. 27. Wilson's disease, a genetic disorder leading to excessive copper accumulation, can result in hepatic cirrhosis among its various manifestations. The diagnosis is clinched by low serum ceruloplasmin levels, high urinary copper, and treatment focuses on reducing copper load through agents like penicillamine or the zinc-based regimen to prevent liver and neurological damage. 28. The impact of liver cirrhosis extends to the endocrine system, where hypogonadism, adrenal insufficiency, and thyroid derangements may be present, necessitating regular endocrine evaluations and potential hormone replacement therapies to address these hormonal imbalances and their associated symptoms. Vascular thrombosis, manifesting as portal vein thrombosis, is an underappreciated complication in liver cirrhosis, wherein blood clots form in the portal vein, exacerbating portal hypertension and impeding blood flow, often necessitating anticoagulation therapy despite the complex coagulopathy in cirrhotic patients to improve vascular patency. Secondary bacterial peritonitis, an infection of the acidic fluid occurring due to bacterial translocation, presents a life-threatening emergency in cirrhotic patients that demands prompt diagnosis via paracentesis, revealing neutrophil counts above 250 cells (UL), and initiation of empirical antibiotics, such as cefotaxime, to combat likely pathogens. Growth hormone resistance and resultant insulin-like growth factor 1, IGF-1, deficiency observed in liver cirrhosis may contribute to muscle wasting and sarcopenia, affecting patient outcomes. Hence, nutritional interventions and exercise programs are critical in mitigating these catabolic effects and improving physical performance and survival. Antidiuretic hormone dysregulation in cirrhosis contributes significantly to hyponatremia, a common electrolyte imbalance, where water retention is inappropriately increased despite reduced effective circulating volume, necessitating careful management through fluid restriction or the use of vasopressin receptor antagonists, also known as Vaptans. Collateral circulations, such as caput medusae and the recanalization of umbilical veins, represent compensatory mechanisms observable in advanced liver cirrhosis caused by portal hypertension, often visible on clinical examination as abdominal wall varicosities, but also indicated in imaging studies used to gauge disease severity. By understanding the metabolic and enzymatic disruptions in liver cirrhosis, especially altered drug metabolism due to impaired cytochrome P450 activity, healthcare providers can better tailor pharmacological regimens, adjusting dosages of medications to avoid potential toxicity or subtherapeutic efficacy in this vulnerable patient population. Liver cirrhosis has systemic effects evident in the central nervous system, exemplified by an increased risk of seizures, possibly due to metabolic imbalances, medication effects, or undiagnosed hepatic encephalopathy, warranting proactive neurophysiological assessments and cautious anti-seizure medication use. The role of mitochondrial dysfunction in liver cirrhosis is gaining traction, with studies implicating impaired energy production and increased oxidative stress as underlying factors exacerbating hepatocyte injury and fibrosis, promising a new avenue for targeting mitochondrial pathways to potentially ameliorate liver damage and disease progression. Copeptin, a stable byproduct of arginine vasopressin (AVP) breakdown, is emerging as a promising biomarker in liver cirrhosis for assessing disease severity and predicting patient outcomes, offering the potential to track disease progression and tailor individualized treatment strategies in cirrhotic patients. With the use of sophisticated molecular imaging techniques like PET scans, emerging research in liver cirrhosis seeks to visualize ongoing fibrogenesis in real time by deploying radiolabeled tracers targeting fibrogenic pathways, thus allowing for earlier intervention and monitoring the efficacy of antifibrotic therapies. Autoimmune hepatitis, which can advance to cirrhosis if untreated, is dominated by a T-cell-mediated immune attack on hepatocytes, diagnosed through autoantibody profiles and elevated serum Ig levels, requiring timely administration of immunosuppressive agents such as corticosteroids and azathioprine to prevent irreversible liver injury. 40. Exploring the gut-liver-brain axis in liver cirrhosis uncovers its contribution to neurocognitive dysfunction through the production of neuroactive substances by altered gut microbiota, accentuating the importance of gut health on brain function and opening avenues for microbiome-targeted therapies to ameliorate hepatic encephalopathy. 41. The metabolic reprogramming in hepatic stellate cells, favoring glycolysis over oxidative phosphorylation in liver cirrhosis, underscores its role in perpetuating fibrogenesis, steering research towards metabolic intervention strategies that could impair stellate cell activation and alter the course of fibrosis and cirrhosis progression. 42. Osteodystrophy in liver cirrhosis, characterized by diminished bone strength due to unhealthy liver function impacting calcium and vitamin D metabolism, necessitates bisphosphonate therapy alongside optimized nutritional support to combat the increased risk of fractures and enhance bone mineral density. 43. The emergence of microRNA profiles offers an innovative diagnostic and prognostic tool in liver cirrhosis by shedding light on specific dysregulated microRNA patterns linked to disease progression, paving the way for personalized medicine approaches that leverage these biomarkers for risk stratification and targeted therapeutic interventions. 44. Leveraging artificial intelligence, AI, in the realm of liver cirrhosis promises enhanced diagnostic accuracy through image analysis, particularly in interpreting complex imaging studies to identify cirrhosis severity, variceal risk, and nuanced changes in liver parenchyma, ultimately refining clinical decision-making processes. 45. Gut-derived endotoxemia, resulting from increased intestinal permeability and bacterial translocation in liver cirrhosis, is a critical focal point for new therapeutic approaches, aiming to stabilize the gut barrier and reduce systemic inflammatory responses through probiotics, prebiotics, and specialized nutritional formulations. 46. Lipoprotein metabolism alterations in liver cirrhosis make patients prone to dyslipidemia and cardiovascular disease, highlighting the necessity for regular monitoring and potentially lipid-lowering therapies to mitigate cardiovascular risks, even in the setting of reduced hepatic synthesis of certain lipoproteins. 47. Leveraging the role of extracellular vesicles as mediators of intercellular communication in liver cirrhosis offers a promising strategy to modulate fibrogenic and regenerative pathways, tapping into the potential for using extracellular vesicles in novel therapeutic applications to influence liver repair processes. 48. In liver cirrhosis, the clinical relevance of genetic liver diseases like hemochromatosis comes into play, where excessive iron deposition can accelerate fibrosis and cirrhosis, necessitating genetic screening in at-risk populations and implementing iron-reducing therapies to prevent additional liver complications. 49. Harnessing the potential of epigenetic modulators in liver cirrhosis treatment reflects a groundbreaking avenue that targets specific histone modifications and DNA methylation patterns that drive fibrogenesis, offering a targeted approach to halt disease progression and foster hepatic healing mechanisms. 50. The complexity of central obesity's impact on liver cirrhosis risk reveals its role, as visceral adiposity promotes systemic inflammation and alters adipokine profiles, necessitating targeted interventions focusing on weight reduction and metabolic health optimization as preventative strategies against cirrhosis development. 1. A staggering diversity of microbial symbionts thrives within the human gastrointestinal tract, with the gut microbiota encompassing trillions of bacteria that wield profound influence over digestion and overall health. Yet disruptions in this microbiome, such as through antibiotics or a Western diet, can precipitate conditions like inflammatory bowel disease, irritable bowel syndrome, and metabolic disorders, emphasizing the importance of maintaining microbial balance for gastrointestinal homeostasis. 2. Crohn's disease, a type of inflammatory bowel disease, manifests with transmural inflammation that can affect any part of the gastrointestinal tract from mouth to anus, often leading to complications such as strictures, fistulas, and nutrient malabsorption. Despite its immune-modulated pathophysiology being not entirely understood, innovative biologic therapies targeting TNF-alpha and other inflammatory mediators have significantly improved patients' quality of life. 3. Gastroesophageal reflux disease, GERD, represents a chronic condition characterized by the retrograde flow of stomach contents into the esophagus, leading to symptoms such as heartburn and regurgitation, with potential complications including esophagitis and Barrett's esophagus, and lifestyle modifications like dietary changes and elevation of the head during sleep are often first-line therapies, supplemented by proton pump inhibitors to reduce acid production when necessary. 4. Celiac disease is an autoimmune disorder where ingestion of gluten leads to damage in the small intestine, with specific genetic markers HLA-DQ2 and HLA-DQ8 playing central roles in pathogenesis, and strict adherence to a gluten-free diet is currently the sole management strategy, underscoring the need for vigilance in identifying hidden sources of gluten to prevent malabsorption and related complications such as osteoporosis and anemia. 5. Acute pancreatitis, often precipitated by gallstones or excessive alcohol intake, involves the autodigestion of pancreatic tissue by prematurely activated digestive enzymes, and while mild cases may resolve with supportive care like hydration and fasting, severe forms can result in necrosis and systemic inflammatory response syndrome, necessitating intensive medical interventions and sometimes surgical debridement. 6. Irritable bowel syndrome, IBS, is a functional GI disorder characterized by a combination of abdominal pain, bloating, and altered bowel habits without any detectable organic cause, distinguishing itself with the brain-gut interaction being pivotal in its pathophysiology, and a personalized approach to treatment incorporating dietary adjustments, like low FODMAP diet, psychological support, and specific medication targets hallmark symptoms. 7. Peptic ulcer disease is primarily caused by Helicobacter pylori infection or chronic use of nonsteroidal anti-inflammatory drugs, leading to erosions in the gastric or duodenal mucosa due to imbalances between protective and aggressive gastric factors, and eradication of H. pylori through antibiotic regimens or cessation of offending NSAIDs, coupled with acid suppression therapy, typically results in ulcer healing and symptom resolution. 8. Diverticulosis refers to the presence of herniations or pouches in the colonic wall that become inflamed or infected, resulting in diverticulitis, a condition characterized by acute abdominal pain, fever, and digestive disturbances, highlighting dietary fiber's role in prevention and antibiotics or, in severe cases, surgery's necessity for resolving complications like perforations or fistulas. 9. Chronic liver disease can culminate in portal hypertension, a condition where increased pressure in the portal venous system leads to complications such as esophageal varices, splenomegaly, and ascites, with non-invasive elastography providing a modern diagnostic tool for assessing liver stiffness and therapeutic advancements like TIPS procedure offering significant relief and management options. 10. Gallstones are crystalline concretions formed in the gallbladder due to imbalances in the composition of bile, with cholesterol stones being the most prevalent type in the Western world. And while many remain asymptomatic, if a stone obstructs the cystic duct, it can lead to cholecystitis, biliary colic, or pancreatitis, necessitating potential cholecystectomy as a definitive treatment. 11. The human gastrointestinal system displays a fascinatingly complex layered structure with the enteric nervous system operating as a second brain, capable of autonomous function in orchestrating peristalsis and secretion, with neuronal interconnectivity and neuromodulators reminiscent of the central nervous system, asserting its foundational role in maintaining digestive function and influencing emotional states. 12. Cirrhosis, the final common pathway for a myriad of chronic liver diseases, results from progressive fibrosis and nodular regeneration within the liver parenchyma, ultimately compromising hepatic function and leading to complications such as jaundice, coagulopathy, and hepatic encephalopathy, with liver transplantation remaining the only curative option for end-stage cirrhosis despite ongoing advancements in antifibrotic therapies. 13. Malabsorption syndromes are marked by defective nutrient absorption in the intestine, with conditions like lactose intolerance and tropical sprue affecting various digestive processes, leading to symptoms such as diarrhea, weight loss, and nutritional deficiencies, and they necessitate both accurate differential diagnosis via tests like breath hydrogen and stool analysis, as well as targeted dietary and pharmacological interventions. 14. Gastric cancer, predominantly adenocarcinoma, poses a major global health concern with risk factors including H. pylori infection, dietary influences, and genetic predispositions, often presenting in late stages due to nonspecific early symptoms, but advances in endoscopic surveillance techniques, alongside surgical and chemotherapeutic modalities, have provided tangible improvements in early detection and patient survival outcomes. 15. Functional dyspepsia, a chronic disorder characterized by upper abdominal discomfort and related symptoms, presents without an underlying structural cause, challenging clinicians with its complex interplay of gastric motility disturbance, visceral hypersensitivity, and psychosocial factors, thus mandating a multifaceted approach that may include prokinetics, acid suppression, and psychological therapies like cognitive behavioral therapy. 16. Hepatitis C, a blood-borne viral infection that predominantly targets hepatocytes, can progress silently to chronic liver disease and cirrhosis over decades, but recent developments in direct-acting antiviral agents have revolutionized its management, providing cure rates above 95% and reducing the incidence of liver-related complications, thereby offering a beacon of hope for managing viral-induced liver diseases. 17. Hepatic encephalopathy, resulting from the buildup of neurotoxic substances like ammonia due to liver dysfunction, manifests with a spectrum of neurological impairments ranging from confusion to coma in advanced cases, and treatment strategies focus on reducing ammonia levels using lactulose or rifaximin, alongside addressing the precipitating factors like infections or dehydration to prevent flares of this debilitating condition. 18. Clostridium difficile infection is a leading cause of healthcare-associated diarrhea due to alteration of normal gut flora following antibiotic usage, and the hallmark pseudomembranous colitis can progress to severe fulminant colitis, necessitating prompt recognition and management with oral vancomycin or fidaxomicin, and fecal microbiota transplantation has emerged as an innovative therapy for recurrent cases. 19. Barrett's esophagus, a precursor for esophageal adenocarcinoma, results from chronic gastroesophageal reflux causing metaplasia of the esophageal lining, with endoscopic surveillance and biopsy forming the cornerstone of monitoring, and advanced interventions like radiofrequency ablation or endoscopic mucosal resection in selected cases offer potential measures to mitigate cancer progression risk. 20. Intussusception occurs when one segment of intestine telescopes into another, causing bowel obstruction and ischemia if untreated, predominantly affecting young children who present with classic triad of intermittent abdominal pain, current jelly, stools, and a palpable abdominal mass, with treatment often involving a therapeutic enema or surgical intervention to resolve the obstruction. 21. Non-alcoholic fatty liver disease encompasses a spectrum from simple steatosis to non-alcoholic steatohepatitis, reflecting fat accumulation in hepatocytes primarily linked to metabolic syndrome. Features such as obesity, insulin resistance, and dyslipidemia, demanding lifestyle modifications as the primary therapeutic approach, while pharmacological interventions focusing on insulin sensitizers show promise in reversing hepatic steatosis and inflammation. 22. Helicobacter pylori's unique spiral morphology and urease production enable survival and colonization within the acidic gastric environment, causing chronic gastritis, peptic ulcers, and being a recognized carcinogen associated with gastric cancer, making eradication regimens combining multiple antibiotics and acid suppression pivotal in reducing its clinical burden and preventing associated gastric malignancies. 23. Acute appendicitis, the most common surgical emergency, results from obstruction and subsequent infection of the appendix leading to inflammation and potential perforation, presenting with periumbilical pain migrating to the right lower quadrant, and timely diagnosis and surgical intervention, typically in the form of appendectomy, remain crucial to avoid complications like peritonitis or abscess formation. 24. Hirschsprung's disease is a congenital condition resulting from the absence of ganglion cells in the distal colon, leading to functional bowel obstruction and chronic constipation in neonates, with rectal biopsy being the definitive diagnostic tool, and surgical resection of the aganglionic segment forming the cornerstone of treatment to restore normal bowel function and prevent enterocolitis. 25. Autoimmune hepatitis, characterized by chronic inflammation of the liver due to immune-mediated attack on hepatocytes, presents with varied symptoms from asymptomatic elevations in liver enzymes to fulminant hepatic failure, and although precise etiology remains elusive, treatment typically involves immunosuppression with corticosteroids and azathioprine to control inflammation and prevent progression to cirrhosis. 26. Esophageal achalasia, a disorder of esophageal motility characterized by impaired relaxation of the lower esophageal sphincter and loss of peristalsis, presents with progressive dysphagia to solids and liquids, and high-resolution manometry aids its diagnosis, with treatment options including pneumatic dilation, surgical myotomy, or peroral endoscopic myotomy offering symptomatic relief and improving esophageal function. 27. Microscopic colitis, comprising collagenous and lymphocytic variants, is an inflammatory bowel condition causing chronic watery diarrhea with normal endoscopic findings, but distinctive histopathological features on biopsy, and management generally involves cessation of potential offending agents like NSAIDs, with budesonide providing effective resolution of symptoms in many cases. 28. Zollinger-Ellison syndrome is a rare disorder caused by gastrin-secreting tumors, usually in the pancreas or duodenum, leading to gastric acid hypersecretion and recurrent peptic ulcers, with gastrin levels and imaging for tumor localization aiding in diagnosis, and management encompasses not only acid suppression but also surgical resection or somatostatin analogs to control hormone production. 29. Gluten sensitivity, a non-celiac adverse response to gluten ingestion, presents with symptoms overlapping with irritable bowel syndrome, including abdominal discomfort and bloating, without the autoimmune component seen in celiac disease, necessitating exclusion of other potential causes, and a gluten-free diet often providing symptomatic improvement, although the long-term necessity of dietary restrictions remains a topic of ongoing research. 30. Incarcerated inguinal hernias present when a segment of intestine becomes trapped within the inguinal canal, risking obstruction and ischemia, with acute presentation involving localized pain, irreducible mass, and possible systemic signs if strangulation occurs, and urgent surgical intervention is imperative not only to release the incarcerated bowel but also to repair the hernia to prevent recurrence. 31. Gastritis refers to inflammation of the gastric mucosa, which may be acute or chronic, and although often asymptomatic, it can manifest with epigastric pain, nausea, or bloating, with etiological factors ranging from infection by H. pylori to NSAID use and alcohol consumption, highlighting the importance of addressing the underlying cause alongside acid suppression to facilitate mucosal healing. (32) Hemochromatosis, a genetic disorder characterized by excessive iron absorption and accumulation in tissues, leads to organ damage, particularly in the liver, heart, and pancreas, presenting with liver cirrhosis, diabetes, and skin pigmentation changes. An early diagnosis facilitated by genetic testing allows for effective management through regular phlebotomy to prevent long-term complications. (3) Gastrointestinal stromal tumors, GISTs, are mesenchymal tumors arising predominantly in the stomach or small intestine, characterized by mutations in the KIT or PDGFRA genes, and present with nonspecific symptoms such as gastrointestinal bleeding or pain, with management advancing significantly through the use of imatinib, a tyrosine kinase inhibitor, besides surgical resection for localized disease. (34) Ascites, the abnormal accumulation of fluid in the peritoneal cavity, commonly arises from portal hypertension or malignancy, presenting with abdominal distension and discomfort, and evaluating the serum ascites albumin gradient aids in establishing the etiology, while therapeutic paracentesis provides symptomatic relief, with albumin infusion and diuretics being adjunctive therapy to manage fluid overload and prevent recurrence. (35) Behçet's disease is a systemic vasculitis characterized by recurrent oral ulcers, genital ulcers, and uveitis, with potential gastrointestinal involvement leading to ulceration and bleeding, and although its precise pathophysiology remains unclear, treatment with immunosuppressive agents like colchicine, corticosteroids, or biologics targeting tumor necrosis factor alpha plays a pivotal role in controlling systemic and gastrointestinal manifestations. (36) Functional abdominal pain syndrome is a chronic pain condition characterized by continual or frequent abdominal pain not associated with altered bowel patterns, distinguishing it from other functional gastrointestinal disorders, with its management necessitating a biopsychosocial approach involving pharmacologic measures targeting pain pathways, psychological therapies, and supportive care for comprehensive symptom management. (37) The role of ghrelin in the gastrointestinal system extends beyond its well-known hunger-promoting action, with this peptide hormone influencing gastric motility, pancreatic hormone secretion, and potentially exerting protective effects on gastric mucosa, positioning it as an intriguing target for therapeutic research in conditions ranging from gastroparesis to cachexia due to its multifaceted physiological and pathophysiological roles. (38) Eosinophilic esophagitis is a chronic immune-mediated condition characterized by eosinophil infiltration in the esophageal mucosa leading to dysphagia and potential esophageal remodeling, often linked with atopic conditions, and its management involves dietary exclusion of allergens, typically guided by allergy testing, alongside topical corticosteroids to reduce eosinophilic inflammation and prevent disease progression. (39) Helicobacter pylori's involvement in extragastric manifestations such as idiopathic thrombocytopenic purpura and iron deficiency anemia continues to intrigue researchers, with evidence suggesting that eradication of H. pylori can lead to resolution or improvement in these conditions, thus necessitating consideration of this bacterium's far-reaching impact beyond the confines of the gastrointestinal tract in certain clinical scenarios. (40) The curiously named Meckel's diverticulum is a remnant of the omphallomesenteric duct found in the ileum, which may become symptomatic if it harbors ectopic tissue-producing acid, or causes obstruction, and while often asymptomatic, it remains the most common congenital anomaly of the gastrointestinal tract, with technetium-99m scintigraphy aiding in diagnosis when symptomatic presentations resembling appendicitis or gastrointestinal bleeding emerge. (41) Gastroparesis is a disorder characterized by delayed gastric emptying without mechanical obstruction, presenting with symptoms such as nausea, vomiting, and early satiety, often associated with diabetes or idiopathic causes, and management includes dietary modifications, prokinetic agents, and potentially gastric electrical stimulation to improve gastric motility and alleviate symptoms. (42) Chronic intestinal pseudo-obstruction mimics mechanical bowel obstruction without a physical blockage, resulting from significant abnormalities in enteric smooth muscle or nerves, leading to gastrointestinal dysmotility with symptoms like abdominal distension, pain, and malnutrition, necessitating a multifaceted approach including dietary adjustments, pharmacological motility agents, and sometimes parenteral nutrition for effective management. 43. The multifactorial etiology of colorectal cancer encompasses genetic predispositions, including familial adenomatous polyposis and Lynch syndrome, alongside environmental influences like diet, with screening colonoscopy playing a crucial role in early detection and prevention, while advances in molecular profiling deride personalized approaches to therapy, including targeted therapies and immunotherapies, in improving patient outcomes. 44. Primary biliary cholangitis is a chronic liver disease driven by autoimmune destruction of intrahepatic bile ducts, presenting with fatigue, pruritus, and eventual progression to cirrhosis. And while its precise etiology remains enigmatic, treatment with ursodeoxycholic acid and emerging drugs like obeticholic acid can slow disease progression, providing a favorable prognosis when diagnosed early. 45. Biliary atresia, a life-threatening congenital liver disorder, involves progressive obliteration of extrahepatic bile ducts leading to cholestasis and cirrhosis, requiring the Kasai procedure, a surgical intervention connecting the intestine to the liver, as a timely measure to restore bile flow and delay liver transplantation, which remains inevitable in many cases for long-term survival. 46. Small intestinal bacterial overgrowth, SIBO, results from excessive bacteria in the small intestine, often due to impaired motility or anatomical abnormalities, leading to symptoms like bloating, diarrhea, and malabsorption, with diagnosis supported by breath testing, and management involving antibiotics and probiotics aimed at restoring normal bacterial populations and alleviating symptoms. 47. The gut-brain axis embodies the complex bidirectional communication network between the central nervous system and the enteric nervous system, influencing not only gastrointestinal processes but also psychological states and behaviors, with emerging evidence highlighting the role of gut microbiota in modulating this interaction, opening novel therapeutic avenues for disorders like anxiety and depression linked to gut dysbiosis. 48. Esophageal strictures occur due to fibrosis and narrowing of the esophageal lumen from conditions such as chronic reflux esophagitis, malignancy, or radiation, presenting with progressive dysphagia, and management typically involves endoscopic dilation to restore luminal patency, while addressing the underlying cause is critical for preventing recurrence and ensuring durable symptom relief. 49. Hepatorenal syndrome, a serious complication of liver cirrhosis, arises from renal vasoconstriction secondary to systemic circulatory changes, leading to acute kidney injury in the absence of intrinsic renal disease, and its management includes vasoconstrictors like terlipressin and albumin infusion to improve renal perfusion, while liver transplantation offers definitive treatment and resolution of this life-threatening condition. 50. Carcinoid tumors, slow-growing neoplasms originating from enterochromaffin cells in the gastrointestinal tract, typically secrete serotonin and other vasoactive substances, leading to carcinoid syndrome characterized by flushing, diarrhea, and valvular heart disease, and while surgical resection remains curative for localized disease, somatostatin analogs provide symptom control and reduced hormone secretion in metastatic cases. 1. A cerebral aneurysm is a localized dilation in a blood vessel within the brain, often forming at artery junctions due to intrinsic weaknesses in the vessel wall that can be exacerbated by conditions like hypertension and atherosclerosis, raising the risk of rupture, which can lead to a potentially life-threatening hemorrhagic stroke. 2. The rupture of a cerebral aneurysm results in a subarachnoid hemorrhage, characterized by a sudden, severe headache often described as a thunderclap, or worst headache of life, due to the rapid increase in intracranial pressure, with symptoms potentially including neck stiffness, photophobia, nausea, vomiting, and impaired consciousness. 3. Many cerebral aneurysms remain asymptomatic until rupture, but unruptured aneurysms may occasionally cause symptoms by pressing on surrounding brain tissue or nerves, potentially leading to focal neurological deficits such as vision changes, pain above or behind an eye, or numbness on one side of the face. 4. The pathophysiology of cerebral aneurysms involves a complex interplay of genetic factors, hemodynamic stress, inflammation, and extracellular matrix remodeling that weakens the blood vessel wall, primarily affecting the internal elastic lamina and media layers, making the vessel more prone to dilation and rupture. 5. The gold standard for diagnosing cerebral aneurysms non-invasively is magnetic resonance angiography, MRA, or computed tomography angiography, CTA, which provides detailed images of blood vessels in the brain, allowing clinicians to identify even small aneurysms and assess their size, shape, and location. 6. Risk factors for the development and rupture of cerebral aneurysms include smoking, hypertension, family history, age over 40, female gender, alcohol abuse, and certain genetic disorders such as polycystic kidney disease or Ehlers-Danlos syndrome, which can contribute to connective tissue weaknesses. 7. Management of unruptured cerebral aneurysms involves a careful balance between regular monitoring and surgical intervention, with decisions influenced by the size, location, morphology of the aneurysm, and patient-related factors such as age, health status, and risk tolerance, to minimize potential rupture complications. 8. Endovascular coiling is a minimally invasive procedure commonly used to treat cerebral aneurysms by inserting a catheter through the blood vessels to the site of the aneurysm, where detachable coils are placed to induce clotting, effectively sealing off the aneurysm and reducing the likelihood of rupture. 9. Surgical clipping of a cerebral aneurysm involves an open craniotomy to access the aneurysm directly, allowing a neurosurgeon to place a metal clip at the neck of the aneurysm, thereby isolating it from the parent vessel, which is a more invasive but often definitive treatment compared to endovascular techniques. 10. The choice between coiling and clipping may depend on various factors, such as the aneurysm's size, shape, and location, as well as the patient's overall health and the availability of experienced surgical and endovascular teams, with both methods having their unique risks and benefits in terms of efficacy and recovery. 11. Cerebral vasospasm is a potential complication following the rupture of a cerebral aneurysm, where the sudden release of blood into the subarachnoid space leads to narrowing of cerebral arteries, which can significantly reduce blood flow and cause further brain injury, often peaking 3 to 14 days after the initial hemorrhage. 12. Nimodipine, a calcium channel blocker, is routinely administered orally in the acute management of subarachnoid hemorrhage from a ruptured cerebral aneurysm to prevent or mitigate the effects of cerebral vasospasm and associated ischemic deficits, despite its hypotensive effect requiring cautious monitoring of blood pressure. 13. The Hunt and Hess scale in the World Federation of Neurosurgical Societies, WFNS, scale are clinical grading systems used to assess the severity of aneurysmal subarachnoid hemorrhage, helping to predict outcomes by evaluating factors like the patient's level of consciousness, presence of focal neurological deficits, and overall clinical condition. 14. The Fisher scale, based on the amount and distribution of blood seen on initial CT scans, is used to grade subarachnoid hemorrhage from a ruptured cerebral aneurysm, offering prognostic information regarding the likelihood of vasospasm, with higher grades indicating an increased risk and need for vigilant monitoring and intervention. 15. Seizures may occur after the rupture of a cerebral aneurysm due to the acute brain injury and cortical irritation caused by subarachnoid hemorrhage or increased intracranial pressure, necessitating prophylactic or therapeutic anticonvulsant medication in some patients to manage and prevent further neurological complications. 16. Genetic testing for individuals with familial history of cerebral aneurysms may help identify underlying hereditary factors, especially in cases of connective tissue disorders like Marfan syndrome, providing insights into potential predispositions and enabling proactive monitoring or early intervention to manage increased rupture risks. 17. Acute management of a ruptured cerebral aneurysm focuses on stabilizing the patient's condition through airway management, blood pressure control, intracranial pressure monitoring, and potentially early surgical intervention to prevent rebleeding and manage complications that could worsen patient outcomes. 18. Secondary complications like hydrocephalus, an accumulation of cerebrospinal fluid due to impaired reabsorption following subarachnoid hemorrhage, may require the placement of a temporary external ventricular drain or a permanent ventriculoperitoneal shunt to alleviate pressure in the ventricles, preventing further damage to brain tissue. 19. Lifestyle modifications, including smoking cessation, alcohol moderation, regular blood pressure monitoring, and a heart-healthy diet, are recommended for individuals at risk of cerebral aneurysms to reduce modifiable risk factors associated with aneurysm development and rupture, contributing to improved long-term outcomes. 20. High-resolution vessel wall imaging using MRI can provide insights into the morphology and histopathology of cerebral aneurysms, allowing the visualization of intraluminal thrombus, aneurysm wall inflammation, or instability, thus helping in the stratification of rupture risk and guiding clinical management decisions. 21. Computational fluid dynamics is an emerging tool that allows the assessment of hemodynamic forces at play within and around cerebral aneurysms, providing valuable data on flow patterns that may influence aneurysm growth and rupture risk, and can aid in the customization of treatment approaches or the development of new interventions. 22. The role of inflammation in cerebral aneurysm pathogenesis is under active research, with evidence suggesting that an inflammatory response within the aneurysm wall contributes to wall degeneration and rupture, highlighting potential therapeutic targets for anti-inflammatory agents that could stabilize aneurysms or slow their progression.